I'm very excited. I see friends in the room. I see powerful. I can come to you. And I don't want us to be saying, excuse me, excuse me, excuse me. You're my far right. Excuse me. You're my far right. You're the far left if you're looking at this. Yes, something like that. Okay, let's try take this photo. And we're going to try it again. 1, 2, 3. 1, 2, 3. I love how you're looking with intention. What is she going to make us do? The same thing, I promise. All right, who are having their coffee, join us. I would love to join us. I would love to welcome you to these East Africa regional. English to give you to say. Let's have you say, literally lifting of one other. There was nobody I could talk to, but that you have come together in your respective positions to hold each other's hand. I think that is a beautiful thing and an extremely necessary thing. So we have an amazing day lined up for you ladies. I do want to ask that we disturb the internet. And what does that mean? If you are on social media, on any of the platforms, we would like you to use our hashtag for today, which is hashtag EA Dialogues 2024. And I'd love to encourage you to take photos if you've met somebody new. Are you sat next to somebody that you know currently? Yes, most of you? See, this is not what networking is about. Yeah, you look at someone, you say, I love your outfit, sit next to them and force a conversation, right? So during the day, I'm going to either ask you to change how you're sitting, and let's aim to meet 5 new people. Can we do that? 5 new people today to add to your network, and then take your selfies. Now, guys would have issues with which kind of phones they have. You know, guys are like, oh, me, I'm an Android. Ladies, do as long as we look good in our friend. I want to ask and selfie now as we disturb it. Let everybody in the world, in this region, know that we are here. Are we ready? On the count of whatever, whenever you're able to press. Find your light. Find your light, ladies. Find your light. No shadows on our faces. Hashtag is EA Dialogues 2024 on Twitter or X, Facebook, LinkedIn, and Instagram. I like it. For those who are not smiling next to somebody, sorry, I'll come and find you. You can use my face. I will lend you my face. It has been beaten this morning, as you can see, so I will lend you. Can I come? We take a selfie? Okay, I'll give you 30 more seconds because you can do as many as you want during the day. Wonderful. So we will start off with some introductory remarks. We have a great keynote that you will not want to miss, to just sort of set the tone and inspire us for the day. We'll have some fireside chats, and then we'll also have a number of panel discussions that will help us really delve deeply into some of these topics around allyship, which is really what we are trying to discuss today as our theme. Equipped to lead, centering allyship and gender equality to transform global health leadership. And so once we are done with our morning session, we'll break for lunch and then go into some workshops, which I think will also give us a more comprehensive look at specific topics. I believe most of you have already registered for the workshop discussions that you would like to participate in. All right, well, ladies and gentlemen, allow me then to start us off formally and ask you all to be upstanding for the national anthems. the East African National Anthem.
Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
You may take your seats. It was interesting that the lyrics were there for the East African one. We are friendly people. We helped you. It's one that we have to memorize. We are here as the East African Regional Dialogues. Yes? Okay. Well, today's discussions will be streamed on YouTube. So if you have friends who have not yet made it and they would like to follow, please go to the WomenLift Health YouTube channel. We want to welcome our sign language translation team in the spirit of inclusivity. Thank you for being here with us. Ladies, please wear your badges, and gentlemen, please wear your badges at all times. Have them in a place that we can recognize. There are other conferences happening, and we don't want you to get lost, especially when we disperse for lunch. We'll ask that you keep your phones on silent. You are in a very important sector, so you may be called, I understand that, but we'd ask that you have minimal movement as the sessions are going on so that we can avoid disrupting any of the conversations. We have the Larder restaurant, which I will be guiding you to, which is sort of out in the foyer where you were at the beginning, and then to your left. And that is where we will have our lunch and tea. At the restaurants. I hope that you have identified the washrooms. They are in the corridor as you came in from the reception, and they're clearly marked. So if you need to answer the call of nature, please do so. And of course, our session times, we're going to do our best to keep time. We have a packed program, so we will ask for your help to do that. So I'm going to ask that we do a 30-second commitment. Can we do that? Please place your hands on your chest. Find where your heart is. It moves sometimes. And say, I. Please state your name. Do solemnly swear that on this Friday, the 11th of Tentober, I said Tentober, I will do my utmost to be in the rooms that I require to be, at the times that I am required there, and that I will commit to show up, to be present, to open my heart, my soul, my mind, and most importantly, my ears. Aki, so help me God. Ladies and gentlemen, allow me to introduce and welcome up on stage our host. And even as she comes up, Dr. Nora Obudo is a force. Do you agree with me? A force of nature. And she is surrounded currently with some of our VIPs. Dr. Zainab Gura, welcome, the Deputy Director General for the Medical Services in the Ministry of Health, Kenya. We're so honored to have you here. Honorable Cicely Kariuki, who is a former Cabinet Secretary in the Ministry of Health and the founder and CEO of Reimagine Impact. Amy Batson, who's our President at WomenLift Health. Samburu Washiko, Regional Representative for the East Africa Bill and Melinda Gates Foundation. It's lovely to see you. Dr. Nora Obudo, you stand among giants, and we are now ready to hear from you. Please, ladies and gentlemen, welcome Nora Obudo.
Wamama hoye. Wamama hoye. Wababa hoye. Wababa hoye. And I'm sure they're on YouTube joining us on this. But I am really, really, truly honored to be here and to have you all here, ready for a day of great engagement and learning. as we move forward. So again, distinguished guests, partners, allies, ladies and gentlemen, all protocols observed. Good morning.
Good morning.
And so it is my honor to welcome you to this inaugural WomenLift Health East Africa Regional Dialogues. But it is not under the assumption that everyone knows WomenLift Health, so I must speak to who WomenLift Health are creating in this globe. And so, established in 2019, WomenLift Health is committed to expanding the power and influence of talented women in global health. And why is this? Because we know global health challenges will not be solved unless we have women seated at those decision-making tables. We've been doing a lot, but there's been no focus on leadership. Who is leading, how they're leading, why are they leading, right? So there has to be some impact that we're looking for to achieve. And as we look at our SDGs, we are far off from meeting them. And I challenge us to relook at that and look at that leadership component and question where the women who are the highest consumers of health, who are caregivers, who are managing at the community, who are 70% of the health workforce. But when you look at the decision-making tables, we are only a mere 20 or 25%. And so we need to be in these tables. We need inclusivity in decision-making. And so that's why we need to be there. And so that is why WomenLift Health exists. So we are addressing that gap. So we exist in North America, South Asia, East Africa, as you know. South Africa is coming up, and so is Nigeria. And so we are really on a mission to take over the world, but in a phased process, all right? And we are creating a movement that is the women leaders here. So when we look at what we are doing, we are working in 3 different areas: at the individual, at institutional level, and societal levels. And I know some of you might be familiar with some of our offerings. So at the individual level, we have our leadership program, the leadership journey of who alumni and current cohorts in the crowd. Woo! Please, for those who have not interacted, those are the people who tell you the stories and the experience of the leadership journey and what the women are doing. And at the institutional level, of course, we are there to impact leaders, institutional leaders, to look at how they are working or their policies or how they're enabling women's leadership in their workplaces. And in my discussions, of course, with Amy, she was appraising me on World Bank's strategy. The 3rd pillar is getting women into decision-making spaces. Imagine that is a strategy for such an organization. So what about the organizations we exist in? We must be intentional about putting women in these leadership positions. And at the societal level, we continue this discourse around why we need to invest in women's leadership. And if you are privileged to engage with our conference in April, that was some of the things that we engage in, these conferences where we engage in these dialogues to look at why we need to invest in women's leadership. And the East Africa dialogue is such that it is very focused within the hub to have that kind of discussion. And at this time, of course, we're going to be looking at allyship. So this is a platform that is centered on driving institutional change to advance gender equality in health leadership for long-term impact. Today, we are gathering as women leaders and male leaders, allies, champions of change who are all committed in advancing gender equality in global health. So the theme for this engagement today is Empowered to Lead, Centering Allyship and Gender Equality to Transform Global Health Leadership. And this encapsulates the urgent need to address the persistent gender imbalances in leadership within the global health institutions, which we are all aware of. This discussion comes at a critical juncture. The demands of global health are changing, and the ways in which we view equality, leadership, and governance in health are shifting. To achieve health for all, as envisioned in the Sustainable Development Goals and the African Union Agenda of 2063, if we are to achieve it, provides a blueprint for countries to participate actively in creating the Africa we want. We must address the barriers that stand in our way. And this includes the persistent gender gaps in health leadership. So, over the past few decades, progress towards equality has been made, but we acknowledge that, but the progress is too slow. And we are still far from where we need to be. And we have the statistic of 70% of the workforce being women, yet only 25% in leadership. And only 5% in senior leadership within these global health organizations. are present in the low and middle income countries, women like us who need to be taking up that space. This disparity undermines our ability to achieve equitable and effective health outcomes. And we know that without women in these key decision-making spaces, then it's impossible to build inclusive health systems that, in addition to serving whole communities, also respond to the unique needs of women. Without our representation in the boardrooms, technical work groups, task forces, in whatever way it exists in the countries in East Africa, then we are bound to not achieve any health impact or health outcomes as we view them. So we must do something about this, and we must do it together and now. Fellow allies, over the course of the day then, we will be unpacking the leadership challenges that persist within our health institutions in the region. And some may be known to you, but also we had a specific study, a discovery analysis in East Africa. And some of the challenges and barriers to women's leadership included work-life balance, politics. Navigating politics is a deterrent for women to engage in leadership, and gender harassment and gender discrimination and sexual harassment in the workplace. Those were the top 3, among others, in East Africa. One of the solutions we hope to delve deeper into this idea of allyship in global health and how the different forms of allyship can come to play. And this includes male allyship, it includes senior women allyship, and peer allyship as well, and how they will impact the health sector. We believe that male allies in particular have a crucial role to play in shifting the power dynamics that have historically excluded women from leadership, because as we know it, the workplace was really built up for men. How are we adjusting that to the reproductive cycle of women as we try to achieve our work and leadership trajectories and also balance with home? Through a selection of exciting sessions, including a keynote address, a fireside chat, and an inspiring interlude, panels and workshops, we hope to encourage exploratory thinking, diverse viewpoints, and sharing of solutions that apply to our unique context. So in closing, at this moment, as we engage in this dialogue, I urge you all to reflect on how we can leverage allyship to transform global health and the roles that we can play in advancing gender equality in health leadership. This is not just a women's issue, it's a global health issue. We know that when women lead, better health outcomes follow. And so I invite you to actively participate, challenge that status quo that exists, and commit to fostering an environment where women can thrive as leaders and influence this trajectory in global health. And with that, fellow allies, it is now time and my pleasure to invite on the stage Dr. Zainab Gura, the Deputy Director General for Health in the State Department of Medical Services within the Ministry of Health, to deliver the keynote address. Dr. Gura, as she walks up, is a medical epidemiologist and public health specialist with over 18 years of experience working in the public health sector. For the last 10 years, she has worked at the Ministry of Health, where she has helped shape policies and led various teams in the departments and directorates, including epidemiology, workforce development, health system strengthening, and healthcare services. Please welcome her again with a round of applause.
Thank you, Dr. Nora. Nora's my friend. We've come from far. Actually, she was my undergraduate classmate. And I'm really glad to be here today. Really excited to be amongst you, beautiful ladies. The room is so colorful. I was telling her even before we start this event, it's already fulfilling. Being with all these women and men who support women leadership, and to be able to discuss this over the whole day today. It gives me an immense pleasure for you to be with you today, the women leaders, and standing on all the protocols that are already established before me. Allow me to first welcome everybody else. I believe, and I've heard that we have diverse groups from across East Africa. Welcome to Kenya, and please be welcome, feel at home. We are a very hospitable nation and people, and I'm sure you have experienced it before and you'll experience it today. I'd like to recognize the presence of all the women leaders and my former cabinet secretary, Ms. Cecily Karaoke. I believe she is with us, and the chair of WomenLift, Amy, and I appreciate to be amongst you today. Allow me to take this opportunity to highlight a few reforms that are ongoing at the Ministry of Health so that we put that context in place before we continue with the discourse on women leadership in global health. The Ministry of Health and the Government of Kenya has committed to provide quality, affordable health care for all Kenyans and attainment of universal health coverage. The Ministry of Health, in collaboration with the county government, is focused on achieving UHC through developing sustainable health financing reforms, comprehensive and integrated digitalization of healthcare, ensuring health commodity security, and availing adequate and skilled health workforce. To realize this plan, the ministry developed 4 legislations that provided the legal platform for delivering universal health care. This follows assented to it by His Excellency the President on 19th of October 2023, include the Social Health Insurance Act of 2023, the Digital Health Act of 2023, the Primary Health Care Act of 2023, and Facility Improvement Financing of 2023. On 1st of October this year, the ministry started the rollout of the Social Health Authority, which is established under the Social Health Insurance Act of 2023 and replaced the National Health Insurance Fund. Social Health Authority houses the publicly financed Primary Health Care Fund, Emergency and Chronic Critical Illnesses Fund, and Social Health Insurance Fund, and all Kenyans are encouraged to register for these funds through *147# or visit the website at sha.go.ke. The shift from NHIF to Social Health Authority embodies equity both in contribution and benefits in the true spirit of leaving no one behind. Distinguished guests, we cannot achieve universal health coverage without guaranteeing women health and gender equity in health. The UHC reforms is envisioned to strengthen health systems and delivery of primary and specialized care with focus on household wellness and women's health. Relationship between the gender equity and access to healthcare services cannot be overemphasized. We also need to strengthen our governance and leadership for health, and this is a critical pillar because even with all the other inputs in place, if we have not addressed the governance issues, we will not be able to achieve universal health coverage. As has been said earlier, women constitute 70% of global health workforce, but hold a mere 30% of the senior leadership roles, revealing a significant imbalance in decision-making authority within the health sector. Health systems will function better and will be on our way to achieving universal health coverage when women who deliver much of the care have an equal say in the design and delivery of health. Women in health leadership can expand the agenda, give greater priority to issues such as sexual and reproductive health that apply to all but have the greatest impact on women and girls. Gender equality in leadership is essential for developing patient-centered health policies that address the diverse needs of the entire population. Women leaders bring unique perspectives that can shape more inclusive, effective healthcare solutions, better health outcomes, retention, and greater innovation. More women leaders will increase the number of women role models and mentors for both men and women, breaking the stereotypes of men as the natural leaders. Women form almost half of the population of the world. That is also true for Kenya. Women also uniquely bear the burden of disease and mortalities directly or indirectly because they are majority of the caregivers. It is therefore important that the decision that affects health of women or of their children and their families are taken with the woman seated right at the table. For example, I have experienced discussion around health financing, and it is important when justifying why cutting funding for vaccination and family planning will have far-reaching implications into population growth and building healthy human capital needs a woman in global health to be seated at that table. Discussion on strengthening human resource for health to achieve the health worker to population ratio needs a woman in global health to sit at that table. Strengthening of primary health care and community health as we focus on Afya Nyumbani in our country through our community health promoters, who are actually majority are women, needs a woman leader seated at that table. Women not only bring expertise to the table, They bring their lived experiences, and indeed, they are and will be high opportunity costs arising from excluding women from these tables that are decision-making about health for them and for their families. As a ministry, we are privileged to have women leaders at the helm of the ministry. The cabinet secretary and one of the two principal secretaries are women. At the head of the division level, where the work actually gets done, over 50% of the heads are women. But when you come to the heads of directorates, where decisions are taken, then we only fall down to 25%. At the boards and parastatals of health and subnational levels, the statistics are not very encouraging. So this reality, as it is, it indicates that majority of the leaders currently in our national and global health are actually men. Within this context, and to realize the gender equality in global health leadership, men have a role to share the space, invite to the table, and support women to develop and take larger responsibilities as they rise through the rank. We must be inclusive, therefore, and include men in our discourse as our allies, as our collaborators and co-collaborators, and the positive observers who will catalyze the creation of gender equality in global health leadership. As we advance this discussion today on allyship, we need to explore how to enlist or even empower men leaders, not only to be aware of the inequity, but to also identify and provide opportunities for women to take up leadership positions, and be our partners in the fight for a gender equal world and reducing inequitable structures. We need mainstreamed understanding that gender equality is an issue that affects everyone, and that promoting women's leadership will be achieved when women and men work together side by side. Allyship is not about speaking on behalf of women. To me, it is rather starts by listening to the women. Allyship should be a practice that will include creating and recommending women to global health leadership and correcting the power asymmetries that are there now. Allyship is about showing up over the long haul. Should not be a short-term measure. It should be about listening and learning, building trust, engaging as men and women to be part of solutions of our global health challenges. We also need to deconstruct networking and mentorship from what it traditionally used to be an example of late evening meetings and cocktails to what is happening now in this room. And I want to appreciate the WomenLift Health for this initiative, where we have deconstructed the traditional networking to what we are doing currently, where women talk, discuss, identify their issues, and look through solutions that will be there for all of us. We believe that with that, we'll be able to support each other, learn together, understand, and stand on the shoulders of our seniors and our predecessors as we navigate to create equity in women leadership. In the spirit of achieving universal health coverage, global health security, and leaving no one behind, we need inclusive leadership, and we also need all the hands and minds on deck. We need to demystify the rising misconception that women's equality discriminates against men. And we need to offer solutions to champion male allyship through progressive and inclusive approaches to accelerate gains towards gender equality and health for all. We as women, we are the care providers, we are the caregivers, and should be among the decision makers together with men. For a world with equality will be a just and inclusive society. Indeed, there is no us versus them. When women lead alongside men or together with men, we all benefit. As you continue with this discussion today, I wish you fruitful deliberations and look forward to reading the outcomes and insights from this meeting here. I wish you well. Mungu awabariki. Asanteni sana.
Thank you so much, Dr. Zainab Gura, for that inspiring keynote. Indeed, there is no us versus them. We have to work together. Thank you for highlighting the need for inclusivity and for sharing that there are things that are happening. There's progress that is happening as we try to strengthen our healthcare systems, as we try to deal with governance issues, and we speak specifically about women being in bringing expertise and lived experience. I think that's a very interesting one. When I'm not here with you all, I host a radio show on Capital FM, and I have a co-host who is male. And every time the body gets hot, are we understanding each other? I'm like, why is it me? And he has had to learn that we are going through changes, yes? And I feel like those are some simple things that we experience on a daily basis. I told him he is a brother, he is a son, he will one day be a father, he is somebody's boyfriend. So when he starts to see these things happening, he can use me as the bar to know how to treat his family members, yes? How are we feeling, ladies? So far, so good? Yes, are you ready? Are you excited? What are you most looking forward to?
To learn more. Yes.
And to meet me, yes? Okay, that's a good answer. What about you? What are you most looking forward for?
To take a selfie with you.
These are the kind of answers I like. Let me see what's happening on this side. I want to make sure the people on the farther side of the room don't go to a different meeting. Hi, how are you? You're well? Are you excited to be here? You also want to take a selfie?
Absolutely, absolutely. Learning from all the women in the room. Mm-hmm.
All right. And one last one here. How are you? I am loving your hair. What are you looking forward to?
Interacting and learning. I'm a lifelong learner, so I'm looking forward to that.
Lifelong learner. That's a nice one. I'm going to use that hashtag. And one last comment from you. Are you also a lifelong learner?
Hopefully, yes. I'm looking forward to interacting with other people and for us to share our common challenges and lift each other up.
And lift each other up. Remember, our hashtag is EA Dialogues 2024. You can also use the hashtag WomenLift. I want to see more commotion on the internet, guys, more. Yeah, don't feel shy. That is also our space to occupy. Tell your neighbor, occupy internet. We have a fireside chat that I am now going to ask us to prepare our hearts for and our minds. They're going to be discussing allyship for transformative leadership, which is really important because leadership exists, but how do we transform it for the better? That's what we're trying to do. And even as we focus our minds on solutions, I think that's the goal for today. The how is what we want to achieve. So allow me to introduce Professor Rhoda Wanyenze. If she could come up and take her seat. You can give her a round of applause as she comes. She's the Dean of School of Public Health, Makerere University, the Makerere University in Uganda. As she comes, also welcome Filana Mugenyi, who is the Director of Government Affairs, Public Policy and Market Access Africa for GE Healthcare in Kenya. A round of applause. Filana, also make your way up. I'll ask you to take the first two seats here on your left and right. One of you in the center. Thank you so much. And to lead this fireside chat, Angela Ndunge. Actually, the two that you've walked by, allow me to position you ladies. Professor Rhoda, may I ask you to sit on that chair? I'll explain why. Yes, please. Yes, yes. No, I'd like both. You can stay where you are. I'll tell you why. Don't follow that one. That is just to confuse the nation. Angela Ndunge is the Women in Health Leadership Project Lead at the Strathmore University Business School, Kenya. Thank you for being here, ladies. Angela Ndunge, over to you.
Hello? Oh, the good thing I'm a lecturer, so my voice tends to be loud anyway. So I'm delighted to be here. And as you've heard, my name is Dr. Angela Ndunge. Just to give you a little bit about my background, we've been briefed that this is a fireside chat, so we are a bit informal, not very formal, and we will also want to include you in the conversation as we move along. So my name is, as you've been told, Dr. Angela Ndunge. I'm not a medical doctor. My background is psychology. So I studied psychology for my bachelor's, for master's, and for my PhD. For the longest time within the Strathmore University, was the deputy dean up until July, where I pivoted into full-time academia, focusing on research and teaching as I pursue this to become a professor, like my colleague right there. So I think I've been able to pursue the admin type of leadership, and now I'm seeking to pursue my leadership from the academic side. So I'm delighted to be here to tackle this topic on allyship for transformative leadership. I'm really looking forward to hearing what the ladies here will say, given what we have just discussed in the background. So I'll first allow them to introduce themselves, just talk about their experiences so that even as we are delving into the theme, you're also able to contextualize through their experiences and what they have done. So thank you. Over to you, Filana.
Oh, it's on. Good morning, ladies and gentlemen, because I can see one here. Good morning, everyone. I'm Filana Mojeni. I work with GE Healthcare as the Director of Government Affairs, Public Policy and Market Access for Africa. I'm also not a doctor. I'm a lawyer, but I've had a lot of experience working in the healthcare industry. And just like my sisters on stage, I'm so excited to be here, to learn from them, to share experiences, and also learn from you. So thank you and welcome.
Good morning. Happy to be here and happy that you were able to include me. Looking forward to hearing and learning from the ladies. My name is Rhoda Wanyenze. I'm a professor and dean at Makerere University School of Public Health. I'm a medical doctor and also have a PhD in public health and have been in many spaces in the clinical world and then in programs, policy, in health, but also now in academia and research. And I've had an opportunity to provide leadership at several of these levels. When I was in programs, managing a program as a program manager, but also leading a wide range of research teams, some of them really large and large networks. The largest was in 13 countries. In Eastern and Southern Africa. So I've had an opportunity for scientific leadership as well and other categories of programs in addition to leadership in an academic institution as dean. And I have a passion for supporting people to ensure that everyone realizes their full potential. So I do this for women even before I understood all the terms and whether it's inclusion or whatever it was called. When I look back, I feel like I was always doing it. And I also do have a passion, especially in advancing women in leadership, in academic institutions, in addition to health, and young people. That's the other group that I feel we don't give as much space, and we need to do more of that. So I've taken that up as well, and looking forward to sharing, but also learning from the team and the rest of you. Thank you.
Okay, so thank you, Prof, and maybe we'll start with you because just as a way of setting the context, what does allyship mean to you? Because you said you did not think about the terminology previously, but as we were reading around it, you realized this is what I have been doing, but maybe didn't have the language for it. So maybe you can expound. What does allyship really mean for you and from your experiences?
Yeah, what does it mean for me? It's supporting people, it's accelerating and nurturing people to grow, to realize their full potential, whether it's in technical fields, professional, but also in leadership, various forms of leadership. And to me, it also means that people should feel good about themselves, because when we are nurturing people to grow, we tend to focus on the professional, the technical, the leadership, but people should feel good about themselves. And this comes with feeling valued. What is it that makes you feel valued? Quite often it's being heard, having an opportunity to contribute, because sometimes you grow in leadership and you occupy a position, but you actually don't feel like you're valued, you belong, you are heard, and that you're truly making a contribution. So creating that environment that people can thrive and not just grow in leadership positions, for me, that's what allyship is, whether it's individuals, whether it's at institutional level, creating that environment, the culture, the policies, and anything else that we might have the mandate or opportunity to adjust to make that environment one that is able to nurture other people. That's what it means to me.
Fantastic. Filana, your thoughts. What is allyship based on your experiences and maybe what you have read?
So I think I'm not going to repeat what the professor mentioned, because that's true. It's about feeling valued. But I think allyship is also about finding a group of people who you can trust, who you can trust to be vulnerable with, to be honest with, and to be honest with you. Because I think as you grow in your career and you take up more senior roles, the title will say you have a big, important job, and you'll know technically what to do because that's why you got the job. But you might find yourself feeling a little bit lost, and you might find yourself, having a bit of imposter syndrome. How did I get here? Am I doing the right thing? I'm now the director. Why don't I feel like I'm leading? And I think it's really important when you're talking about allyship to figure out, what do you need? What do you want? At that stage in your career, what sort of women and men do you need to surround yourself with to get to the next level and also to do well where you are right now? And it's not always the obvious allies. I know increasingly there are amazing women out there. You see them on TV, you read their books, and you think, wow, I want to be mentored by her. I want her to be my ally. And that's all well and good, but I have a bit of a controversial opinion. Those are not the women who need to be your allies, because those women are at a level and are experiencing the workplace and their leadership in a completely different way than you. So they might have the success, but you're not going to be able to relate to them. I remember a conversation I had with a CEO, a female CEO, and I was so in awe of her. This was about 10 years ago, and I said, I really want you to be my mentor. I really want you to be my ally. And she said no. And she said, I'm not going to be your mentor because I'm not the right person. Right now, you're operating in an environment where there's social media, there are policies that are supposed to advance women, there's #MeToo. I'm a CEO. When I'm sitting in a boardroom, nobody's interrupting me, nobody's talking over me, nobody is second-guessing me. I don't have to justify why I'm there. You are at a level in your career where maybe your voice isn't being heard. Maybe people are talking over you. Maybe people are stealing credit for your ideas. I can't relate to that. You need to find women and men who can relate to where you are right now. And on a more practical level, I don't have time. I don't have the time to invest in making you better and in being a good ally to you. So for me, allyship means finding the right group of people who are meeting you where you are and can help you get to where you want to be.
Okay, fantastic. I think just the same as Prof was talking about, sometimes we have all these terminologies, and I remember when we were having the briefing about this session, I also thought I knew what allyship was. So I also spent some time reading more around it, and I think what I liked about allyship is the aspect of using our personal privileges to uplift others. And I think sometimes we think it's only the people who are up there who can be our allies, but our ally can be the watchman. It can be your ally. Anybody can be your ally, and each of us has a privilege that somebody else that does not have. So with that privilege, how are you using it to uplift others? Because sometimes I think we tend to think only those who are the top there are the ones who are supposed to uplift others. But I think it empowers us to know each of us has some tool, has a talent, has something that they can give to somebody else. So even as we are sharing our experiences, because each of us are in that context, I'm hoping we are reflecting on some of those privileges that we have and how we can use them to uplift others. So maybe moving on in terms of allyship, maybe you can delve deeper and share some of your experiences on how you have experienced allyship in your profession and how it has transformed your leadership or the workspace or wherever you are. So we'll start with you, Philana.
Thank you. I think there's two personal experiences and examples that I can share. The first one is, and I know we're going to get to male allyship in a minute, so I won't go into too much detail, but the biggest thing I found, I expected when I started my career that it was women who were going to be the ones to uplift me. I expected that I should look for the most senior woman in my organization, in my field, and connect with her and rely on her to open the doors, to tell me what to do, to guide me, to be my mentor, my sponsor, my ally, all of those words. And what I have found, which is disappointing, and I hope we can change that, is that wasn't the case. I went into organizations trying to identify the woman who looked most like me. I was looking for the senior most black woman in every organization and trying to connect with her. And it didn't work. Instead, what I found is the people who have been most instrumental in advancing my career were old white men, and who had nothing in common with me and technically no interest in advancing my career or in supporting me. So that was a big surprise. I'm really glad I leaned into that particular group of allies because it helped. But it also taught me an important lesson. Don't assume that your allies are going to look like you or are going to be the ally that you expect them to be. But that leads me to my next example. I realized that, you know, that saying where they say, if there's no space for you at the table, create your own table. I expected that I would have a seat at the table because of my title, because of the company I worked for, because I'm senior enough, I deserve to be at the table. And when I got to the table, if I got to the table, because sometimes I wasn't invited, I found that, just like the professor said, I wasn't being heard. I didn't feel like my contributions were being valued, and I didn't actually feel that it was a space where I could even give contributions. And it was incredibly frustrating. And so I realized I need to create my own table, because I would speak to many women, some I even recognize in the audience, and they have incredibly senior titles, and from the outside it looks like, wow, she's amazing. But we would have the same conversations. I'm not being heard, I'm not being able to make impact, what's wrong? So I realized there's enough of us to create our own table. And it's a different table. And so I gathered a bunch of women who I trusted, I liked, I respected, not all of them from the health industry. And I said, what can we do to advance female leadership on boards? And from all of those discussions, we actually got to a position where we're now formally launching an organization next week. By the way, I'll tell you more about it after if you want to hear, that is dedicated to gender diversity on boards. And the difference is we're looking at women who are like me. You're not super senior. You're not in your late 50s. You're a young woman, you're mid to senior level in your organization, you want to serve on a board, you don't know how to do it, we're going to figure it out. And we're going to be a network. And so my second example is allyship sometimes looks like being the trigger to actually make a change happen. Thank you.
Right. Thank you, Philana. So, Prof, probably the same question, but given you're the dean, I'm sure from an institutional perspective, you can also share your experiences at an individual, but also from a leadership perspective of leading a big institution that is public sector. How have you experienced allyship in your career?
In my career, so first of all, before I get to the career, I would say I just didn't realize that I had allyship when I was growing up in my family until much later on that I realized my dad was my first and greatest ally because he always spoke hope into us. He always said, women are smart. Women can do as well as men. You can do whatever you set out to do. And you can be anything. And he said it all the time. And so growing up with that voice, I didn't realize when I got into other spaces that they would be different. And of course, it was surprising that I didn't have the same, encouragement all the time. And sometimes I had a different tone and expectations coming from that background. But I think in a way, it also helped me to keep more open to who would give me that support, especially when I entered into leadership within the medical field and within public health institutions where I didn't necessarily see women ahead of me as leaders. I didn't see them for decades in my own school. And so naturally, it's the men around me that supported me, and there were several of them. I've had really excellent mentors. I had one of these professors that said, "You're smart, you can go far. We need to support you." I had several others support me, advancing in terms of further training, nurturing my leadership. But I had one person that was very interested in what I was doing. I would meet with him, not too often. You don't have to be available all the time. I used to meet with him once a year, by the way. And he would always say, "So what have you been doing this year?" And so we would engage on that. "So how about you trying that? So what are you going to do next year?" And if he felt that I was thinking too small, then he challenged me to think bigger. But then I knew that he'd made it a habit to meet with me once a year, always in December when the year was wrapping up. I had something to tell him. I didn't want to disappoint him. And so somebody doesn't have to have all the time. Sometimes all they need is to just speak positive, point you to one opportunity or the other. And I learned to calibrate my expectations of people because some of them are too busy. I don't want to send you too many emails when you don't even have space to read them and respond to them. But just thinking, what do I need and from who helped me to be able to engage and take the best out of what my really busy male colleagues were able to do for me. And then I also came along women. Some of them were different from me because there is also personal character and approach to things. People are different, so there are certain things they will do and they don't identify with you and you might feel uncomfortable, but there's something else you'll get from them anyway that's useful. So again, along the way, I learned to take what I can get from everyone. Excellent technical, but maybe you will not talk to me as kindly, so it's okay because you don't intend to hurt me. Maybe that's who you are. So again, I've learned to adjust to that in terms of how I have experienced my allyship, but also to be more kind to the women, because I think there is a myth that women are always harsh to each other. And so sometimes even when you meet a woman that would add value, you start off with I think they won't support me. That's a challenge. And also, as a leader, as a woman leader, I see women that I need to nurture and to support, and sometimes they are not doing certain things right. One of my biggest challenges has been when I have to give them negative feedback. Because when I do, then it will be, there she goes pulling me down. If I don't, then I'm not helping you to reflect and have that self-awareness to identify areas where you can do better. So for me, that has been my challenge. I don't know if the others in this room feel the same way, but I think we have to come to a point where we have to say no. There are not bad women out there that are waiting to pull women down. There are also bad men. They actually fight and pull each other down all the time. And I have said to my colleagues in my university, in an academic environment, people are always politically charged, and sometimes they are really aggressive and competitive. And I've said, look at those men. They fight all the time. They pull each other down. I've never heard anyone say they did it because they are men. But if they were women, we would say, there they go, the women always pull each other down. So I think we need to rethink some of these things and redefine them so that we are more comfortable to be able to support one another, to be able to say it when something is not going right so that we can help people to improve. Now, for me, coming from other people supporting me so much, even before I knew what allyship meant, I just said, they gave so much to make me who I am. I'm going to do the same for others. I think I have an obligation to do the same. And so I keep doing this for the women around me, especially, and that drove me also, you might have heard me say this, because for decades, 2 decades, I didn't have a leader of my school who was a woman or a head of department. So when I got there, I said, no, this has got to change. And now we've shifted the face of that. Of course, now it's gone to the extreme. Everyone is a woman. But now we are getting back to... but it wasn't intended to discriminate. It was encouraging the women. And what I realize is just how much they can respond when you give them free space and environment and encourage them. They stepped forward, they competed fairly, and they are leading. And now everybody feels, yes, the women are in charge, the women can do a good job. So we've changed that perception that women won't do it well. And we are also encouraging men, many young men who are coming up. So soon we shall create our own balance as it comes. So I've been able to do that, but every time I have an opportunity to deal with, especially those structural issues, those the policies, every time I've been on committees, I've chaired committees, it's really shifting those policies that are not fair and making sure the environment is better. I've gone through advocating to have more women in STEM, including changing and putting targets. And negotiating. We had very few women in some of the disciplines in our university, somewhere like 10%, 15%. So we now have a 40% target for women, especially the scholarships coming from government. We had to be very deliberate. I proposed 50 because I knew they would urge you to bring me down. So we said we wanted 30, but we said if we say 30, they'll put us at 20. Let's tell them it's 50. So we managed to get it down to 40, and many other spaces. I've been able to do that all the time. When women are seated, they're at the back, I'll pull them to the front. Make sure they will say something before they leave. And I always say it before I even get to them. I'll say, everyone is going to say something. I'm going to come down to all of you. I need to hear from everyone on this. So they begin to think. By the time you get to them, they are prepared and they can make a meaningful contribution with confidence. I don't like to pounce on them because then you embarrass them. They are not ready. They will say something they will regret later on. So if I'm coming to you, I just want you to know I'm coming. Please think you're going to say something. So getting them to speak, getting them to be seen, to be heard, and to be confident to share what they've done. So that I do all the time because of the experience I've had. Okay. Yeah.
Fantastic. I think listening to both of you, and that shows the diversity of our experiences. I also had similar experience with you in that my first allies were predominantly male, and coming also from academia, joining the university immediately after my PhD, I had no thoughts about being a leader. It was never in my ambition. I did not actively seek any leadership position. But it was interesting, my former boss, out of the blue, somebody went on maternity. I was only 6 months in the university. And he said, Angela, you're going to act. And I was like, what? So I ran back to my mother and I was like, I can't believe this. I've only been here 6 months. I barely know what the organization is, and now I'm being told I must act as the vice dean at that particular point. So my first instinct was, of course, this is not what I came here for. I came here to be a researcher. I'm not interested in being a leader, which is something most of us academics tend to run away from. But she was like, I mean, try. Go and give it your shot. So my boss, I guess, later on, I've always wondered, and I said, maybe when we both retire, I'll ask him, what made you just decide that? Because I didn't know anything. But anyway, I decided to take it up. Like men, he did not sit down with me to tell me what to do. I was supposed to figure it out along the way. So I had to look for other allies. So I look at him as the person who opened the door. Now, how I survived there was for me to look for another ally so that I'm able to figure out how to survive. So I was really counting down how this maternity leave of this person should end without me making a mistake. So I used to just wake up and I'd be winging it for those 3 months. But somehow I survived. Especially being I was the youngest faculty and now no experience, and then I'm thrust into that position. So in that perspective, the ally, there was one that opened the door, but for me to be able to navigate the politics and everything around there, I had to rely on a different ally to give me the tools, which at that particular point, I didn't have the tools. So I liked the fact that you talked about that, Prof. Sometimes women, we are given those opportunities, but we do not apply ourselves when we get there. And therefore, it becomes a challenge to continue to advocate for that person. So I think that's something also I have experienced where I have advocated for somebody, they land there, and it's such a huge disappointment in terms of, okay, I was expecting you to embrace this opportunity a little bit stronger, and they don't. So how do we sometimes navigate that? Because in our quest to be allies, we can be seemingly to favor some people. I don't know if you have experienced that. In terms of favoritism, where do we draw the boundaries so that you're able to be an ally, but again, not to be seen to favor certain people at that particular point? Maybe starting with you, Filana.
I think the first thing is, ladies, make sure you know your stuff. If you want to pursue a position of leadership or advancement, whatever it is, please make sure you know your stuff. Because if you only want to lead for the sake of leading, but from a technical or a substance perspective, you don't know what you're doing, you're only going to embarrass yourself, the person who is trying to lobby for you, and you're going to let down a lot of people. So know your stuff. Anybody who I push for or who I'm supporting, I make sure I know she knows what she's doing, so that once she gets through that door, she's not fumbling. I think the other thing I would suggest is, and this was touched on by the professor, with women, we tend to take everything personally. If somebody gets promoted, women will say, oh, it's because he likes him, or because he knows him, or it's because she did this or she did that. And we take everything personally, but the reality is, certainly in the corporate world, nothing is personal. All they care about, are you adding value? What are you doing to the bottom line? And men fight, but they don't take it personally. Women take it personally. If somebody steals my idea and gets credit for it, I don't think, how do I better explain what I'm doing to the right person in the right way so that I can get credit. Instead, I get upset. How could he? How could he do this to me? I thought we were friends. And I completely missed the opportunity to grow. So I think make sure you know your stuff. Once you get into the room, be ready for politics. Be ready to navigate politics, as every organization has politics. Some are more politicized than others. And the higher you go, the less it is about what you know. It's about how you can navigate those sort of complexities and do it in a way that works for you, that's authentic, but still gets you where you need to get. So my advice would be know your stuff, don't take it personally, and learn to start depersonalizing what happens in the workplace. That is the main thing. And if you do those, nobody will be able to accuse anyone of favoritism. All the women who I lobby for, I know they're good, and I know when they get in the room, they can fight their corner, they can stand their ground, and they can do it in a way that's authentic to them. So that's how I would approach it.
Okay. Prof, what has been your experience with that aspect of favoritism?
Yeah, it's potentially an area that can be challenging, especially if you're dealing with individuals and you pick the same individual for the same opportunity all the time when there are others who are equally qualifying. It might be women and you pick just one woman, so maybe to you she's better than others, but maybe others just need to a bit more push to be able to discover themselves. So personally, what I often do is to be clear about what I think needs to happen. In my school, I've been very clear that we need to be more inclusive. We have fewer women. We need to bring in more women. And we have the numbers, so I can say fine. So we have women in leadership, but we still have about 28%. That's not good. And I have told my colleagues that this is not favoring these young women, because I've been tracking the performance of our students, and I know the women, the young ladies are top of the class in many of the academic programs. So I'm saying, can we deliberately pick them and work with them? If we have research projects, let's engage them. And we are not only picking those women, we are also picking the young men. And then let them come in. They begin to see if this is something they would like to do. When there are opportunities, encourage them to apply. We need more women to come in. I've been very clear about that. I've also been very clear about including younger people in conversations. I don't set up a committee and it's complete until there's the youngest person represented within the school. So they understand the general principles, we identify with it, and I've told them this is about sustainability. We need to grow the next generation of leaders so that we are strong at institutional level. So when I bring in young people, that's okay, because it's open and we are accountable. We have the numbers, and the intention is to include more people. So if people are disadvantaged and we are drawing onto them to be part of it, again, in a fair way, because if there are 3 or 4 women that are all good, I won't pick one for everything. In any case, there's no one that has all the, all the capabilities for everything. So it might be that I've sent one for an opportunity. If it's training, then I'll send another for the next opportunity. Everybody is given a fair chance so that the best people will emerge and grow. But sometimes you see somebody that's really a good fit for an opportunity and you think they can do a good job. Again, it's very clear the basis for that. So I won't shy away from pointing to that person and saying, yes, so-and-so is the best fit for this. Yes, some people might not fully understand me because they don't know that person and they don't see the capabilities that I see. So sometimes you've got to be bold if you're going to change the space. If you're going to be very apologetic for trying to draw on people that are being left behind, we're just not going to change the space. So we're not going to apologize for bringing in more women to lead. We are not going to apologize for encouraging more young people to speak, to be heard, and to be part of conversations and decisions within our institutions. We have to be prepared for it. We have to be open, and we should be accountable. If indeed we are not doing it right, we need to listen to others, and we can course correct that is also okay. Yeah.
I'll still stick with you because in your previous, as we were discussing, in your experience as the dean, you talked about pushing for policies, pushing for more institutional change. So maybe from that perspective, because sometimes allyship can seem to be a more individualized approach, such that if Prof is not there, then this will not happen. Or if Filana is not there, how do we then, as women, approach that aspect of ingraining allyship in workplace culture, and how can we help to make it more institutionalized so that it's more accepted and it's not individual, or if I feel like it, then I am able to do it. So maybe you can talk into that, and then Filana can also add.
Yeah, it is. It's the best thing to do, because that's where the biggest problem is. There's so much you can do when you're just going for individuals, and so in a lot of my experiences, I've always argued for changing certain spaces. When I first got into Senate to represent my school, I was surprised that we had about maybe 15% women. Anyway, but at the time, again, we had only, when I became dean, we were only 2 out of 29, then we moved to 3, and then I felt, oh no, something has to change. So I argued whenever we set up committees to the chair that there must be a woman, but then I realized we were overburdening the women. They were always on some committee because we wanted to balance. There were just too few to go around. And so we felt we needed broader change. So I actually spoke to him about this. And so when they decided to review the gender terrain in my institution, they asked me to chair it. It wasn't easy when it's your own institution, but the numbers were not good at all. And we made sure that they were in everyone's face. And we had to do something. So we've now grown to 11 female deans. People had to be more deliberate. And we said, no, talk to them, encourage them. It's okay, they will step forward. It's competitive, it's political. They go to vote for you in your school if you're more than one, but it's okay. These women are capable. So I can see now that the terrain has changed. And so when we had a chance to revise the policy, then I really pushed for having targets there for the first time. It wasn't easy, but somehow when we achieved it, it has also helped us. And beginning to speak about these things, because you interview everyone and they say, but we are training them. And I said, no, yes, good, train us, we need it, but we are ready now. I don't know how many men you had to train for a decade before you gave them a chance to actually get into an administrative position. So we are more than ready. We just have to take a step. So we've actually created that shift beyond my school, and I'm happy that we are beginning to see that happen. But I can tell you the biggest issue to change is the unwritten rules, the subtle things, the culture about who is capable and who is not, who is a good leader, because there's a definition of who a good leader is, and you can truly see that if you are the engaging type, the one that listens, but the culture of your institution is you must be aggressive, they won't pick you because they're looking for an aggressive person to be the leader. You are the engaging type, you're not a good leader. So there's the culture of the institution, who is a good leader, and all these things have to shift with time. And those are some of the things we are now talking about. Who is actually a good leader? We are talking about it at institutional level so that people can become more conscious that being the toughest person in the room that doesn't allow people to speak back is actually not good leadership. That in fact, we don't have to change who we are and begin to mirror that toxic leadership that's not inclusive in decision making in a way of getting us into those positions. What we need to do is to shift our definition and perception of what good leadership is. So we are having those conversations. The downside is if it's your own institution, sometimes you're misunderstood. People feel this person must be interested in the other position. So it becomes really challenging. And so with time, I've been telling my colleagues that advancing ourselves for some people might mean We shall crack this ceiling, some people will walk through. And I wish that in celebrating women, we could shift to celebrating the people who crack those glass ceilings but never go through as much as the people that go through. Because then we can encourage more women to say, fine, my role might be to open the door, but I might not be the first to get through that door, but that's okay, and it's also celebrated. So that's the downside, so that if you're getting into it, you've got to understand that it comes with challenges, and you've got to be prepared and see how much you can take, and maybe sometimes take a break and recover before you move to your next, or perhaps hand over the mantle to somebody else. Yes. Because for me, what I've done is to engage and see that there are many people who are conscious about these things and can speak to them. So it's not personalized, it's not RODA, it's about we and the shift we want to see in the space.
Thank you, Prof. I think you made me reflect because after the 3 months acting, I did another acting and ended up as the faculty director within a year. And I remember that time we were only, is it 3 females or something like that? And I kept wondering, where are the women in this institution? So in part of shifting the culture, as you said, there are few women. The first thing for me was to look at how can we hire more women academics so that there's even a larger pool of people to select from, because with the 3 of us, there's only so many leadership committees or that we can attend, so many leadership positions. So I think first, even just at the bare minimum, we need enough women within the organization so that we are able to nurture those to grow. Coming back to you, Philana, how has that experience been, and how can we ingrain allyship in our workplace cultures?
So I think with every corporate today and every business, they're going to say we're for women. We embrace women leadership. We have programs to grow our women. They may have a women's network. Every corporate I've worked for has a women's network. And so on paper, the corporates are saying the right things. But as has been pointed out, the reality is often different because there are cultural challenges that a policy or a women's network can change. So what I've found works is, as cheesy or as ineffective as those women's networks or corporate programs may be, join them. Join them and do everything you can to advocate to make them actual instruments of change. So I've joined networks, diversity, equality, and inclusivity. They have so many names. I know what they're trying to do, but you often find it's a tick box. The people who are running them may not necessarily be interested. So if those exist in your organization, get on that committee, get on that council, and start pushing for actual meaningful change. Push to get a budget. Push to increase your membership. Push to get visibility at board level. Push to make sure that whatever that council or committee is doing, it's actually advancing women in your organization. So that's internal. Externally, and a lot of people do this, but I've seen women in particular, we have a tendency to mix up our career with our job. So I work with GE Healthcare. I might stay at GE Healthcare for many, many years. My career might grow in GE Healthcare, but GE Healthcare should not be responsible for my career. And if your career is a book, all the organizations and jobs should just be chapters. You are the main character in your story. What is it that you want to do? What direction do you want to go in? Do not wait for an organization to tell you the direction you're going to grow or the direction you're going to go. So what does that mean? It means you need to build a profile and a network for yourself outside of your organization. You might be the finance manager for company X, and you might be really good at it. But outside of being a finance manager for company X, what value can you bring to any organization? What things would you be doing even if you weren't being paid? What networks are you part of? Women are really well networked. Women know so many people. Men are not actually good at networking, and they're very poorly networked. But what men are good at is making their networks work for them. I'm sure if I called any of you in the middle of the night and said, do you know a good hairdresser? Do you know a rider? Do you know a dentist? You say, yeah, I have him on speed dial. But would I be able to call you and say, you know, I hear that your organization is hiring, and I'm really interested in this role. Can you help me? We don't do that. We're very weird about trying to work our networks, and men are not. So it's very important to build a network, and that's why organizations like WomenLift are so important. Everyone in this room, you're now part of a network. The question is, are you going to make this network work for you? Look for professional associations in your industry. If they don't exist, create them. Create them and make them inclusive, make them welcoming. Make them a platform where people can actually get value, and you turn into an ally. So I think, for me, the most impactful things that have driven my career is building a profile outside of GE. If I leave GE today, I know that I have enough of a brand and a profile, and I know what my values are. I can still bring value anywhere, and most importantly, people will know it. Because women, we worry that if we leverage our networks, we're being transactional. I don't want her to think I'm only her friend because she's the CEO at this company. I don't want to ask my sister because I don't want it to look like I'm just using my family. Men do it all the time. I have been asked by men who I struggled to work with to give them recommendations. They will call me and they don't take it personally. And I'm so angry at him like 10 years later. And he has the cheek to WhatsApp me and say, I know you're hiring, can you recommend me? And I'm like, what am I reading? But then I realized it's just business, it's not personal. I'm still hung up on this, he's moved on, and he's probably going to move ahead because he's not personalizing things. So build a network, join a network, create a network, and be active in your networks, and it'll really help you advance. So I think for me, that's the biggest takeaway that I've seen so far.
And I'm grateful you've emphasized that, because sometimes we tend to have that, we miss the internal locus of control where we think everything is happening to us and we don't have a proactive approach in what is happening to us. So I think that's a good point in trying to shift cultures. It first starts with you, and requires you to educate yourself, seize the opportunities that are there, think about if you're being a good role model to others. And what I have also picked is also sharing your experiences like we are doing, because sometimes we think we are the only ones going through something until you meet the next woman and you find out that they are also experiencing the same, and that gives you a sense of comfort. We are running out of time, yet the conversation is getting a little bit more and more interesting. So I'm trying to pivot a little bit, because you talked about the favoritism thing, and sometimes some of the men have talked about feeling a little bit constrained to be allies because of how that dynamic can be perceived. So maybe, just from your experiences, how can we encourage like men to safely be allies so that they don't feel sometimes that being an ally could be more misconstrued for other intentions? I don't know if you have seen that. The men are not here. Maybe when the Q&A comes up, they will speak about that. But as we begin to wind up, how do you think we can bring men to be more secure in being allies? Philana.
Okay, again, controversial opinion. That sounds like a him problem, not a me problem. Mm-hmm. I don't think the responsibility for adjusting someone's behavior should rest on me. If you are not comfortable, confident enough as a man and in your position and at your level to professionally and meaningfully mentor a young woman without the perception that perhaps there's something untoward happening, with all due respect, it's not her problem. That's a you problem, and you need to work on that. And if you're not able to do that, then maybe you're not the right person to be an ally to a woman. Women are expected to take responsibility for everything, including the shortcomings of men. If we're really striving to have women in leadership, we cannot have different rules and different expectations for men and women. So, I would suggest, if you want a male ally, find someone who is comfortable doing it. Because if they know how to do it, there won't be any of these perceptions or misconceptions. The second thing is, look at yourself. And this is why I went back to know your stuff. Make sure you're good and you can actually do the job you're trying to do. Because if anyone wants to accuse you of getting ahead on any basis other than your merit, it'll be really hard for them to do that if you have a proven track record of excellence. And again, build a profile outside of your company. Because if everyone internally thinks you only got ahead because you were sleeping with the CEO, that may be the case. But how did you get on this board? How come you are leading this association? How come you're being asked to speak on panels? You can't get all of that because of sleeping with one person. So you really can't. It's like there are limitations, right, to what doing that will get. So build a profile for yourself outside of your job that is so impressive, that is so solid, that your credentials cannot be questioned. And look for male allies who should be allies. Don't try and make someone an ally just because you think it would look good. If he's worried about how it will look, he's not the right ally for you.
All right, thank you. I think that's a really good one. Prof, I don't want you to tackle that one. I think she's tackled it really well. Briefly, about cultural norms, societal norms on this aspect of allyship. What must allies do to address some of those deeply held cultural, societal norms, beliefs?
Yeah, before I get to that, I just wanted to add the institutional perspective to this. Because at institutional level, we need an environment that can nurture and grow the number of allies. There are many men that mean well and actually want to support women. They just don't understand how. They don't fully appreciate the challenges we face. So having a deliberate arrangement where we can engage them, where we can even train them, where we can equip them with tools in terms of how to deal with this, even how to navigate the complex issues such as what you've raised, Philona. What they feel uncomfortable being seen with a woman, so how do they go around supporting a woman without getting themselves into compromising situations where they can be misunderstood? So we can actually engage on this as well, so that we can unlock the full potential of the men that would like to be able to support women. These men are husbands. These men are our brothers. These men, are our fathers. These men mean well. We just need to engage them. They have been exposed to certain environments for so long, which have shaped the way they think about us and our capabilities. We can begin to engage on those things and we can shift that terrain. And that applies to the institutional level where we work, but it also applies to the family and the society as we shift to the societal norms and those complex issues. We need to engage. That engagement needs to get into our religious engagements. I've seen religious leaders who are both men and women advocating for women, and many other spaces within the communities. We've seen this happen. So I think these are things we are not going to break overnight, so we also have to be realistic in terms of how quickly we can shift, but we can begin to shift that space. We've seen that change within the workplace. We've seen it change within politics. And I think all of us need to be part of it. Raising that consciousness too, that it starts at home, is so important. How are we nurturing our children? Are we preparing them to be more bold and step forward, both men and women? Are we nurturing our girls? I heard you talk about your mom when you went to say you were going to act for 3 months. She encouraged you. So we need to have that happen at home, but we also need to nurture our boys to be able to deal with strong women and to encourage women to be the best they can be. So we need to think about all these spaces in a more deliberate way. And we see that it's happening. There are opportunities. So even for us here in this room, what are we doing at individual level? How are we bringing up our children? Are we bringing up our daughters saying, you can't do this because you're a woman, just like you had your grandmother say to you? Are you bringing up your son to respect women and support women? The mentor I told you was very good to me. I actually asked him. I told him, you're different in this. He said, my mother told me to respect women. And so sometimes if he said something and he felt, oh, I slipped there, he said, my mother would kill me for that. So, so I thought, that was a good mother. Can we all be mothers that nurture men like this? So that we can begin to shift the generations and leadership towards supporting women and having a more inclusive society and workplace.
So I see the screens have been shut. So before they shut down our mics, can you give us your parting shot, Filana, because I might just be kicked out of this stage. Make it brief.
Okay, my parting shot is, I know it sounds corny, but be the change you want to see. Whether you're a man, whether you're a woman, act at an individual level, but think at a global level as well. And finally, build your networks. And I've seen so many incredible women in the audience. I hope you want to be part of my network. 50-50 women on board. The Nairobi chapter is launching. It's all about equal gender representation at board level. And I would love for you to attend that. But it's invite only. So please find me after this if you want to get on the list. Thank you so much.
Thank you. Prof?
For me, it's got to be a call to all of us that there's something you can do in whichever space you are, whether it's you parenting, whether you are participating in your institution at whatever level. If you're at the top, so much the better. You have so much power that all of us can change this space. And we are not fighting with the men. We want to work together. Because when the world is more inclusive, we draw on many more experiences and all the capabilities that everyone has to create more impact for everyone. So it's not a confrontation. We need to work together, and I think we can create that shift. Maybe it's too slow and we are uncomfortable. Let's keep at it, and whatever we can tear down quickly, let's do that. And let's continue to grow. Let's prepare ourselves, because we can't give what we don't have. So we need to grow our knowledge, our skills. I had someone say they're a lifelong learner, but also let's grow our negotiation skills, capabilities, advocacy, and speaking up, and let's create that shift.
Thank you, Prof. I'd like to thank you all for a wonderful conversation. I believe it has been a good way to create a segue for the panel sessions that will follow this. Judging that the MC is not looking at me, I don't think we will be able to take questions, but we are around, and I'm sure the conversations will go on in the breakout rooms. So thank you very much, everyone, and thank you.
Wow. Ladies and gentlemen, put your hands together again and again and again for Professor Rhoda, Filana, and our lead conversationalist, Dr. Angela Dunge. You know, I feel like I must introduce myself again. Did you hear all the accolades they gave themselves? So well. My name is Advocate of the High Court, June Gashui. I am the dopest intellectual property lawyer in this nation. I am a radio show host of the station you should all be listening to, 98.4 Capital FM. I am a mother. I am a sister. I am a daughter. I am so dope at what I do. Ata nimesoma. I have degrees. We have to change how we come forward and introduce ourselves. Ladies and gentlemen, once again, our three. You guys have given us so many sound bites. I'm just like hashtagging everything. And humor is a thing I lean into. And when Filana talked about these old white men, I was like, okay, I hope we don't all start going to look for them to be our mentors. Like, do not look for old white men unless they look for you. We're going to move on in the interest of time, and I'm going to invite up a speaker who will speak from this podium here. So you can also shift your necks a little bit. And I'm going to ask Purity Kagweria, who's a board member of Humanity United Kenya, to come up. And she will be speaking about the topic we've been discussing, allyship. But she says that allyship is feminine. Can you clap your fingers? Snap your fingers. Allyship is feminine. Welcome.
Thank you.
And we will take our selfie.
Please.
Okay. Ladies and gentlemen, Purity Kagweria.
Hello, everyone. I'm so excited to be here to share with you my stories about transitions and everything in between. So in 2018, I decided to start planning for my retirement. I was still in my 30s, but it felt really like the thing I wanted to do by the time I hit 40. And I don't know, for those who haven't hit 40, it always looks like such a mountain that you're going to get to, and something will drastically change. So I wanted to be in charge of that change and wanted to really start to plan my retirement early. So I said to myself that I was going to get one last job, like I was going to just be employed one last time as I figure out my life, and I thought I'll end up in coaching and farming. I really like farming. So the job that I wanted to move to, or the space that I wanted to move to, was the field of philanthropy. And I'd spent my time working with girls and young women, first as an activist, as an organizer, as an executive director of a prominent organization, and I knew all the pitfalls of looking for money, of people looking at you, and half the time you don't fit the bill. So I thought that if I occupy that space, then I would first of all, bring my tribe along, and I would have the opportunity to actually make the changes that I wanted to see in philanthropy. So one time I was traveling, and I was with a friend of mine. I called a friend of mine because the trip I had gone to was not as busy as I had hoped it would be when I left Kenya. And so my friend said, come, let me cook for you some food, because I also hadn't been eating well for a couple of days. So I go to my friend's house, and this friend of mine used to be my funder then. And we're just catching up, and she's asking me, what's going on, what am I thinking about? And I do tell her that I now feel the itch to leave this organization that I truly love, and it's because I want to move into philanthropy, and I also want to find ways of organizing at a global space. I was already organizing at a global space, but I wasn't really giving the money. That's what I wanted to do. So my friend says, I'm going to keep my ear on the ground, and if I hear anything, I'll tell you. A few opportunities come along. I started to interview for these jobs, and there was one that I was sure I was going to get it. My friends were already starting to buy my seats and my whatever in the house because I was leaving the country, because if this job I'd already interviewed for, and in my mind I had gotten the job. I went to interview as the last 2 candidates, and I came back home and waited for, I think, 2 months. And in that 2 months, the week that they told me I didn't get that job, I also learned that I was pregnant. And so my life suddenly took a whole other shift that I really needed to pause, because I knew that this pregnancy, all it demanded was sleep and eating eggs and a cheese sandwich. So I knew there's nothing else I'm going to be doing with my life for this 1 year. It's really not 1 year, it's 10 months, right? But I spent a lot of time really just sleeping. And the organization I worked for only thrived because I had built a team. I didn't have to do anything. I was sleeping most of the time. But the team that I had really held the work for that whole period that I was really on the go slow. And eventually in 2020, I did get a job. The job that really, it felt like this is the job of my dream, and I left this organization and moved into this other space. And suddenly I was very unhappy. I thought I got the job and I was just not satisfied. And when I started to ask myself why I was so unhappy, I realized that I was losing bits and pieces of myself that are really active in using my voice and in bringing communities that I wanted to bring along together. And so one time, I was spending time with a group of coaches that I used to work with, and one of them was listening to me rant about what's not going right. And she said to me, why is it that you know what to do and you're not doing it? And I realized that because I'd moved into philanthropy, which is really sometimes a really close space, and I had this huge sense of responsibility in how I felt that I needed to serve girls and young women, and I constantly felt guilty for wanting to choose myself to leave something that, even though it looked glamorous, I knew wasn't working for me. So I made the decision to leave. And when I left, I found myself suddenly that the only work I had to do was pick my kids from school, drop them from school. It felt like my brain, something had happened to it because I was really despondent in things had not worked how I thought they would work. But then I started to ask myself, when I started to plan my retirement in 2018, one of the things I wanted to do was to build a girls' fund. And that girls' fund was really anchored in figuring out how do you move money to the grassroots, because most of us can occupy a space up here and we can sometimes lose touch with where we came from. And so I went back to that. My other dream is really to become an ambassador, and that is a political decision, so I'm still waiting for it. Yeah? So I said, let me go back to the girls' space, and I was still actively involved in it, but I picked up my idea of I want to build a girls' fund. And people that had funded me before came and said, what is it that you want to do now? And they opted to put funding in just an idea that I had on a piece of paper to move funding to girls and young women across the African continent. I've been doing this the last year and a half in East Africa. I started in East Africa. And one of the ways that I've really been able to do that work is finding networks of girls that's already come together based on whatever they feel passionate about, and saying that philanthropy says you must be registered, you must have a track record of getting funding, but I'm going to take a chance on the work that these girls are doing because I understand it, because I've been part of that ecosystem. And so in all of this, the one thing I have learned is don't think that when you're getting a break, it means that you have to stop dreaming or forget everything that you are holding because life is not working out as it should. And once you identify your field of influence, give it your all. And with time, things align and you get to thrive and bring others along to continue thriving in the things that they are involved in. Thank you.
Thank you so much, Purity. A fascinating storyteller. May that ambassadorship find you. Because you don't need political people to make the decision. I didn't? Don't worry. There are other things on my CV you will hear. I'm trying to make sure I don't appear what? Arrogant. It doesn't matter. I am what I am. How are we doing, ladies? Yeah? Yes? We're okay? All right, let me ask you to get on your feet for just 2 seconds. I want you to stretch. I want to make sure the blood is flowing in your bodies. Okay, you can put what you're holding down. I want you to put your hands above your head and stretch. Take a deep breath. Whatever sound comes out is appreciated and accepted. I know what can happen sometimes. Just make it musical when it comes out. All right, turn to your left, stretch, say hi to the person's back. You can pat the back of the person. Some people don't know where their left is. What is happening, ladies? Gentlemen, turn to your other left. Say hi to the person behind you. Wonderful. If you can touch your knees, please try and do so. If you can touch your shin, try and do so. I'm not sure what the status of your health insurance is, but if you can touch your toes, try and do so. Isn't that a nice stretch? You notice I'm not doing any of these things. Please take your seats, ladies and gentlemen. All right, it is 11:27, and we are going to gain time. Tell your neighbor we are going to gain time. Do you see how yummy the conversations are? You kind of want to continue discussing and hearing what everybody's sharing. I love how open and honest we are having discussions about things that affect our daily lives. Our next panel is one that is going to help us deepen our conversation around the themes explored by Purity in her interlude. But also it is going to have what we call a manel. You know what a manel is? Yeah, but it is also going to be moderated by a very powerful lady. So in this session, we are titling it Impactful Male Allyship. How do we leverage men's power and influence to advance gender equality? So I'd like you to give our moderator and speakers a round of applause as I welcome them on stage. Samburu Washiko, please start making your way to the stage. Regional representative of Bill and Melinda Gates Foundation. Please just come and access the stage when you're ready. Data Emmanuel Gordon, who is the Executive Director for Men for Women in South Sudan. Welcome, sir. I'll ask that you take that seat and everybody else will continue on that side. Dr. Job Makoyo, Country Director, Jacaranda Health. Please join us, Job. Dr. Chris Baraza, we are ready for you, Chief of Party. Hey, Chief of Bash at AMREF. I like that title. I think I'm just going to take it. All right, and please welcome the moderator, Renee Ngamau, co-founder of Checkups Medical, who will lead this conversation. I think we have one panelist that we are waiting for. Is that correct? And he is just walking in. Samburu Washiko. Nice to have you. Please take your seat. Ladies and gentlemen, Impactful Male Allyship. Enjoy. Okay.
Good morning. What an amazing conversation so far, hey? Would you agree with me? Where's the hotel? Who can I get from the hotel? You, gentlemen over there, you look very strong. Yes, you, come. And the one next to you, both of you come. Come quickly. Come quickly, quickly, quickly. Rush. By now you would have been here. Come, come, come. Yes, run. Clap for them as they arrive. Look at these strapping young gentlemen. Put this podium down, because when we have this podium up, all of you are not part of the conversation. You're watching on Viusasa. For those of you who do not know me, allow me to introduce myself. My name is Renee Ngamau. I am and have been many things, but I view myself primarily as a champion for women and children. My background is in law. Like June, I am an advocate of the High Court of Kenya. I actually started off in oil and gas, which is bizarre because I am now squarely within the women's rights movement. I work with formerly imprisoned women and women who are in prison, looking around the issue of how do we stop recidivism? And the question, how do we stop recidivism, brought me to a startup to start a medical outpatient delivery system and health financing system where we support families and businesses to access outpatient healthcare from their homes and to access financing for healthcare by WhatsApp on the go. Why? Because I, like you, have been invited to every harambe where someone needs money for medical bills. If you ever have, just raise your hand quietly. Thank you, I see you, my sister. Thank you, my sister, I see you too, yes. And usually I'm number 1 or number 2, and then they write next to it 10,000, and then they write in brackets paid, and then they write M-Pesa number, and then they put a question mark, so that my entire family knows that now I have to provide an M-Pesa number. In other words, I'm being shaken down. And then I thought, why don't we just solve this? Why don't we just solve outpatient healthcare once and for all? We can't solve it for everyone, but we can for some. And so why I'm interested in this conversation is because I understood this very quickly. That if we do not have men in the conversation around healthcare, then it's incomplete for 2 reasons. Number 1, like it or not, our men still hold a lot of the value against which loans are given. They hold a lot of the permission, especially in the rural areas, for what kind of healthcare you will receive. Number 3, they are also consumers of health. So the women are in the gym or in the shamba. If the men are by the roadside or they are at the bar, when they get sick, who's going to have to care for them? Say it out loud and proud. And so if we don't have an inclusive conversation, not just about allyship for how they can support us, but how we can work collaboratively, then we won't have solved the issue of healthcare, particularly women in healthcare. And so that's the conversation I'm going to have today with these fine allies of ours, who I will ask to introduce themselves and to answer one question right at the start. So even as you say your names, which I know June already has, I'd love for you to give us your short perspective on the following. I'm going to make a fairly controversial and generalized statement, and I do underscore that it is generalized. Men are the biggest beneficiaries of patriarchy. And if you think about historically, what has been deemed as normal is what happens or what men experience in the world. And then women have to fit into that, whether it's medical, whether it's financial, whether it is economic, whether it is social. The male version is the norm, then everyone else fits into it. So based on this rather controversial statement as a kickoff, I want to ask you, starting right from the end with Samburu, do you think that it is reasonable for women to be asking men to participate in tearing down the very same structures that allow for you to be in the positions where you are, and for women in a position such as yours to be considered still a novelty? Let's just get them started on the hot ones, right? Yeah. Go right ahead.
Renee, thank you so very much. Will you allow me right from the outset to recognize our team from WomenLift, Amy, Nora, for fantastic dialogue that is essentially a reflection of the global becoming local. I said to Nora earlier, it's so critical that this conversation doesn't just stay in Dar es Salaam, where we really kick things off, but find ways of bringing it to our countries in the region, and then over time, hopefully Nora will find a way to take this to the grassroots. Renee, I'm actually going to turn the question on its head. It's not controversial at all, what you're asking. It's akin to asking or stating that under apartheid South Africa, the minority white community was the greatest beneficiary of a dysfunctional system like apartheid. It was very self-evident. And in much the same way, it's very clear that men continue to be beneficiaries of this broken, dysfunctional, patriarchal system. And it's not unreasonable at all to seek out progressive, committed, truly interested men who can participate in the process and the journey for tearing down a system that truly doesn't work for society, doesn't work for families, and very importantly, doesn't work for economies. So the conversation I think we should be having with men is choose what the motivations, the drivers that are going to bring you on board. Is it because you aspire to have a much more stable family? Is it because you're doing this because you have aspirations of having a society that is driven by the value systems that we're calling for? Or are you driven by the bottom line. If you're essentially participating in this process because of fundamentally economic reasons. The reasons and the drivers are endless, but there are men out there who can't be recruited into this really, really pressing journey towards steering this down. And my offer to Nora and the team is going to be exactly that. Next time we are convening, please feel free to lean on us to ensure that the audience doesn't feel as lonely and as cold as it currently is. I sat at the back there, and it felt very imbalanced, right? I'm feeling a little more at home on this panel. But Nora, there are countless men who would want to be a part of this conversation. There are countless allies out there who would want to be part of this conversation. And we're directing messaging, we're directing asks, we're directing even commitments at men who are not in the room. So how do we make sure that this doesn't become effectively either an echo chamber conversation or a dialogue of the deaf, just because our target audience is not in the room? I'd love to partner with you on that. Thank you.
Thank you so much, Samburu. Chris, your take on what Samburu has now very well categorized, and I'd never thought about this, as akin to apartheid and breaking down an apartheid system. How do we address a patriarchal system and include women as normal, not as the exception?
Thank you so much. My name is Chris Barasa. I am a medical doctor. I'm a gynecologist, for that matter. I have to emphasize that, because I'll come back to that. And it will bring me to why I'm here. I'm also a son to a mother who survived a patriarchal system, but ensured that I take care of women the way I do. I'm also a father to 3 children, a boy and 2 girls. But most importantly, I'm a husband to a woman who is in this room. Where's Lillian? Yes.
Hi, Lillian.
So thank you so much, Rene, for that question. And I want to agree with Samburu that we've actually witnessed a patriarchal system over and over for many years. But just borrowing from what my mom used to do, I think there's one thing that she did that I want to encourage all the women in this room to actually think about, to break that system at that level. My mom understood my dad very well. And whenever there are things that could lean towards patriarchal system, because my dad was retired high school teacher and very disciplinary, for that matter, she could quickly retrieve to the most powerful person in my dad's life. That's his mother. Because she knew if he talks to his mother about certain things, when my grandmother talks about certain things, then my dad will definitely humble himself in certain ways. So why am I talking about this? I'm talking about this because I think it's important for us to understand that the structure that we have can be approached or addressed in subtle manners once you understand where this is coming from. And the second thing is that men generally have a privileged position in the society. And for instance, myself, I was brought up, I'm a third born. We're 8 of us. My elder siblings are girls, okay? But from a very early age, the point that was being driven into my mind was that take responsibility. So I could take responsibility even over the ladies, for that matter. So we are drumming this from a very early stage, that you are a third born, yes, but you are the man, so you need to take responsibility. But how do we turn this around? And one of the things we can actually do is understanding that we have this privileged position. How do we enable the women that we are staying with to actually take leadership, for that matter? And I will give you an example. Lillian, allow me, because I haven't asked you for permission for this, but allow me to make this example. That we made a deliberate effort for us that my wife will take leave of absence from work for 6 years to carry out what I used to call her reproductive career for 6 years. So let's bring up our 3 children. And that was important because I was struggling to do other things. Then we made a decision that the first 2 years of any child are very critical. So how do we ensure that our children are brought up with a good foundation? And she made a sacrifice and said, I'll take a break from work so that I can take care of these children for the next 6 years. But what I thought I should do in appreciating the sacrifice that she did was now to build her up, okay? So one day she just woke up and she realized I've already enrolled her for a master's program. I was like, yeah, we've been talking about this. So I filled the forms, paid school fees, and said, you can do online classes as you take care of the children. So that's an enabler, because I'm positioning her so that once she finishes her reproductive career, she can compensate for the 6 years, quote by quote, that she's lost because she's gained something in the process. The second thing I'm very deliberate about, for example, Renee, is whenever there is a chance, and she asked me, can you be able to talk to so-and-so to sort me out on this? And I'll challenge her and say, I'll give you their number, please call them. So that I don't go ahead and be the one telling someone that, you know, can you do this for my wife or for my child or for that matter. I give her the number, and I link them up so that they can be able to take it up. So I'm supporting them, but prompting up for a leadership position, prompting up through my networks that I have for them to take it up by themselves. I could as well do it by myself, but I don't do that because they need to take it up by themselves.
That's really wonderful. So first of all, ladies, make friends with your mothers-in-law. Lillian, we have your number. Job to you. Still on the same issue. Men as beneficiaries of the patriarchal system, how do we overturn this on its head? Practically, pragmatically, today, in today's context here.
Thank you so much, Renee, and good morning, everyone. I'm really delighted to be in front of all these beautiful women and leaders in the society. My name is Job Makoyo. I'm a medical doctor as Chris. I think we're even classmates, and happy to share the podium with him. I work for an organization called Jacaranda Health, where our mission really is just to ensure all the women in Kenya have access to quality health services, because that's a challenge that are still suffering. I think I was born in a family of many ladies. I'm the firstborn, and I had 4 sisters. One unfortunately died earlier this year. And I'm the firstborn. And I think naturally for me, made me, value being in a space where I'm surrounded by a lot of women. Because my dad was a civil servant, and you understand how civil servants, you are always on transfer from one station to the next. So I grew up with my mother and my 4 sisters. And that really influenced how I related a lot with ladies and women, and even informed my career choices. I've had an opportunity to work in sexual reproductive health organizations, some of the large SRH organizations for the last, I think, 12 years. And for me to be the country director right now, it's actually being propelled by women to be in this role. I'll tell you that for a fact. That I think And it is true, actually. I think 3 of my referees are only women. Like anytime I do a job application, and see, I mean, so I've really gravitated towards that. And just to mention a few of them, Joyce Wanderi, I don't know if she's here in this room. Some of the really good mentors I've had. Sophie Hoda, who was the country director at Maristop, so I used to work. She's at SIF now. And I'm seeing my boss here, who really supports me a lot, in the work that I do. I hope that translates to a good bonus. So definitely we live in a patriarchal society. I come from a community called Kisses, and you guys have all these stereotypes about Kissy men, right? Kissy men have been stereotyped a lot. And Kissy men, and also an SDA for that fact. So you can understand the combination, right? I mean, it's not an easy one. So luckily my socialization, my upbringing has made me break those barriers myself, right? And even with my dad, despite him being a Kissy, a church elder, being a father of 4 daughters has mellowed the kiss in him, right? So I've seen these patriarchal structures being broken down. And one of the things I'm seeing is that, we don't really need to ask men to break this down, right? Because look at the generational change and what is happening right now. Some of these things are happening organically, right? Because there's a lot that is happening, the shifts that are happening within the generation, the Gen Z's movements. We are seeing a lot of these things changing, right? And over time, women voices are growing. They are fighting for their rights. They know what they need, and we're actually seeing women grow up into leadership position. So there's a lot that we can do. I know there's a lot that needs still to be done to break down these structural barriers, just to ensure that we are elevating women in the society. But still, as men, there's a role to play. I think one of the biggest challenges is that men still don't see this as a problem. And if they see it as a problem, they don't know what to do, right? And it's also an opportunity for women themselves to come out and guide the men in terms of, hey, this is what I need you guys to be doing about what is happening in the society right now. Yeah, thank you.
That's brilliant. That's really brilliant job, and so many things that you've talked about, including this organic change. And I'll come back to that together with a question that had been, actually I picked from the earlier panel with Professor Ronda about institutional change and organic and that interface. But I'd love to hear from you, Data, in terms of just still on this issue. I think it's evolving now in conversation to how do we break down patriarchal systems. We're hearing a lot about the power of the mother, the power of the home, the power of backgrounds, the power of practices in the household and how that translates in adulthood. But I'd love you to take it from there. From adulthood, then we go into workplace, society, culture, etc. How do we break these systems?
Thank you. And I just want to say thanks for the invitation to this very important engagement. I'm called Data Gordon. I work for Men for Women. We empower women through empowered men. And I want to underline a say. It says you cannot empower an oppressed wife who comes back to a primitive husband.
Say it again for the people in the back of the room. Say it really loudly. Say it for camera. Look over there.
You cannot empower an oppressed wife who comes back to a primitive husband. And that comes into a question. So first of all, and I want to tell all of you, men feel the burden of patriarchy. Men feel the burden of masculinity. Because even within masculinity, there are levels. We've leveled ourselves as men. There is the hegemonic man, the complicit man, up to down, the marginalized man. So we have our own categories. If he wants to come to my level, I fight him. that is something, and that is the burden we as men feel together. And as you say, all what they have said correlates the same, like even personally. For us, we are only 2 boys, born 2 boys. And key thing just to tell you is, I was told to cook way back in 1997. Yeah, I look younger, but I'm older. In 1997, when my mother made it clear that you need to learn how to cook because you do not have a sister. Now, when you come up to institutions, the family is an institution. Being an institution in the family, how we upbring our children makes us to either promote patriarchy or break patriarchy. I remember my firstborn was graduating, and he said, "Dad, I need a gift." And I said, "What is the gift?" That I need a bicycle. And the bicycle must be blue. Then I'm like, "Why blue?" And then the mother told me, of course, he knows blue is for boys, pink is for girls. I said, "It's okay." We went. He was graduating from nursery, and as we went, I went to the nearby supermarket and bought a guitar. I bought a pink guitar, and it was wrapped pink. And during the process of giving the gifts, I gave him. He did not say no. We went home. He was very happy. He didn't even complain. And I told my wife, I'm like, you know what? It is us to start changing this. As an institution in the family, we have to start changing this. In fact, he has to start cooking. He has to start sweeping and doing all, and respect above all. Now, I have my follower, who of course started the reproduction system quite earlier than me. He has a daughter. Yeah, I was a little bit down. He has a daughter who is 14 years old, and she's under my care. And every time the daughter will be like, my son, he's called Ian. Ian is the head of the family. I said, no, it is you. You're the responsible person here to take care of everyone. It's not that because Ian is a boy, he has to be the head. No, you are a girl, but you are the head of the family. If we are not there, you take over that. So that also brings into our upbringing. So in the institutions, and I'm happy that there is a mentorship session coming in. From my own organization, I report to the chairperson board of directors, who is a female. And she is one reason why we formed Men for Women, because they kept pushing on that. And even when I started working in telecom a few years back, my first person who was mentoring me was a female. So what do I do? For us is we need to be accountable as allies in what we do, in promoting the breaking the patriarchy and making sure that women can see that, yes, you are an ally, not just on podium, but even in what we do. So in the institutions, are we intentional with our policies? That it's not because of funding that there should be women leaders, no, but it is because we must be promoting women leaders intentionally, not say that we can attract funding from the UN Women, from whatever funding institution. Yeah, so that for me is a deliberate approach that within the organization I do. Yeah.
Thank you so much, Data Gordon. And I think taking what, first of all, you know, the entirety of your institution is very much about male allyship. But taking that now to spaces where male allyship is either tokenism, like you mentioned, you know, just quick, we need the funding. Let's find someone. You look fine for the, you know, come and sit here and say that you are the CEO. Or it is so fraught with politics, like the earlier panel had spoken about with Palana and Professor Rhonda and Dr. Angela, that it dissuades women or exacts such a huge toll on women that we almost have to choose family or career. career growth, or mental well-being. How do we, and I want to direct this question to you, Samburu, how do we address institutional biases and systemic challenges within the institutions to create an environment that is truly inclusive, not just tokenistic in its nature? Samburu. And by the way, there'll be mics. Where are my gentlemen? I think they left because I traumatized them at the start. I want us to have roving mics. I want this to happen. This should be a conversation, shouldn't it? Yes? Excellent. So we'll have some roving mics, and just put your hand up and I will point out to them, and I'll keep roving my eyes so that I see if you would like to ask our panel a question. Samburu.
Sure. Renee, I'll try and keep my responses brief to really support you with this aspiration around a conversation. Very inclusive dialogue. And so let me start by pointing out that the question I get asked the most, almost every week, is how does the departure of Melinda Gates from the Gates Foundation affect the institution? That question comes, generally speaking, from a really good place. It comes, I think, from a reflection and a recognition of the role that Melinda Gates played in setting up some of the key, not just institutions and structures, but really embedding this notion of gender equality within the institution. And so the reflection, I think, is oftentimes that the departure of Melinda ends up leaving a really important institutional gap at the Gates Foundation. I should hasten to point out that a huge amount of work has been done following Melinda's departure, just to ensure that this gap is being appropriately anticipated and actively addressed. We're very fortunate at the foundation to have a CEO. Some of you may have interacted with the foundation CEO, Mark Sussman, who, without hesitation, very proudly declares himself to be an ally, and a very, very strong, frontal, committed ally. We also have a board now, as you might be aware, at the foundation, that has really come on board in championing this mission. Renee, perhaps a more direct response to your question would be, it would not be possible to set up the proper institutional structures without very deep individual level and then institutional level introspection. Male allyship is fundamentally about introspecting and truly appreciating one's privilege, one's influence, one's power, and thinking very carefully about how that power is either exerted in support of this mission or can be used as a weapon for suppression. It starts with that. At the Gates Foundation, you'll often hear our leadership truly open spaces up for this kind of reflection, a recognition that the foundation does occupy at a global level, and including in the global south, enormous amounts of institutional power and influence that can either help shape agendas, shape conversations like this, or can serve as a force for retrogression. And so if you reflect, for example, on the fact that the Gates Foundation is the 7th largest contributor to an institution like Gavi that is responsible for upwards of 90% of vaccines that get distributed globally, that's enormous amounts of power. If you reflect that the Gates Foundation remains one of the largest contributors to the WHO, if this is a conversation about women in health, WHO is, of course, the preeminent institution globally that determines and shapes agendas on health at a global level. The Gates Foundation is a really important contributor to the United Nations systems, institutions such as UNICEF, not to speak of academia and implementing partners whom we call grantees. Renee, until we reflect very deeply and own up to this amount of power that an institution holds and be very deliberate and intentional about stating that you're going to use this power for good, and in this particular case, to advance the gender equality course, then that conversation really hasn't started.
Powerful words. I think there's two things and two directions of travel here. Number one is owning the power. Number two is understanding what are the issues. What do women want? What do they need? How do we translate this power into practical solutions for everyday problems? And I know that's a huge question to ask and not one that we can cover in 28 minutes, certainly not if we could. But I want to throw it to you, Job, to an extent. I'm going to challenge you a little bit. So take a deep breath, Doc. And the challenge is this. With the power in the space that you hold, not just as Kenya Country Director for Jacaranda Health, but also in all of the social and other spaces you hold, what do you perceive as being maybe one or two of the catalytic challenges for women leadership in health, which if we changed, would then open up the spaces for women to show up in leadership in health spaces and in other spaces? So I know it's a bit of a big question, and I'm going to ask each one of you that, and then I'm going to check in with the audience. So no pressure, gentlemen. I'm going to check in with the audience to see what would you say are those catalytic changes, which means if we change this part, then it will unravel the rest of this. Does that make sense?
Yeah, thank you so much. Wow, that's a really loaded question. I think some of the things that really need to happen is, and I'm picking it up from what you clearly said, is that, like in the last question, how I finished, is that men don't really know how to support women, right? And what needs to come out clearly is how do then women themselves, even including like this kind of forum that we have, share their aspirations and, show their ambitions toward becoming leaders in healthcare. Most recently, I was having these conversations with my friends, right? And, I was just asking them, what is your position in terms of supporting women and elevating their voices within healthcare? And, the data that is out there that, in healthcare, 75% of the global health workforce is women, and only 25% of them are in leadership. People didn't know about that. And, for someone like me who've been working in the SRH space, most of these organizations I've been working with have had women leadership. So probably in my own small circle, I probably see that there's no problem, right? But there is a bigger problem. When I was sharing these statistics with my male friends, they didn't believe it, right? And then there was this question of, are women ambitious enough? Do they really want to grow? Because men feel that the patriarchal system itself has kind of locked down women, that their role is to be family providers, to take care of the family. And therefore, most men feel that, okay, women probably are not really interested in these roles, right? So ladies and women have to be vocal themselves and show a lot of this interest. The other thing is, how do they get their voices out there in the room? And us as men, we have to, in whatever space we work in, we have to give an opportunity to elevate the women that we work with. Like, for example, when you are out, okay, this is a manel, at least Renee, you are here with us, right? I mean, I've had an opportunity where I've been requested to go into speaking forums, and I'm like, no, let my female counterpart go and represent the organization. Because why? I also want to give them that opportunity for them to go in and, represent the organization and show their abilities. Or else it will be, oh, Job is the face of Jacaranda Health. He's the only one who's always going out into this conference. So those are some of the things that I think need to happen for that to happen. I'll give you an example, and this is just personal. When I was during my courtship and when I was getting married, I remember I went for a counseling session with my wife, and there are two questions that we were asked separately. One of them was like, "Oh, so Job, what what do you think is the role of the man and the woman in the financial contribution within the family? I said, I think I'll do 75% and let Kwambox, who's my wife, do 25%. And then I was asked, so how many kids do you want to have? I said, depending on the economical situation, I wouldn't mind have five kids, right? That's me. And then Kwambox had the same question, right? Separately. And she was asked the same question. Oh, she said, money, 95% him, 5% me. Kids, 2 kids, right? And then we were all brought to the same room after that. And the pastor was giving us this feedback. And, you know, of course I was shocked with the money thing. She was shocked with the kids. And I remember the pastor saying, like, sorry, Job, if she wants 2 kids, she'll get 2 kids, right? She's the one in control, right? And the pastor then turned to Kwambox and told her, by the way, if Job wants 5 kids, he'll get 5, 2 with you and 3 with somebody else. Right? You know, you can understand. So this, and that brought in the question of, and what the pastor was basically trying to demonstrate is, as man and woman, do you have these conversations? Do you guys support each other? You know, are you allies in your relationship? Are these conversations that you're having? You know, if it comes to kids, you want 5, she wants 2, probably you guys get into the middle ground and have 3. I just have 1. Anyway, so right? So these are some of the things that, you know, are really important, even in these discussions, because they also start from internally within our family situation before they translate into the work environment. Thank you.
That's excellent. I want to ask you the same question, Dr. Chris. What is, in your view, the catalytic change that would propel more women to leadership in the health space?
Yeah, thanks. Thanks, Renee. And I think I'll give my feedback based on a real life example in my institution, AMREF. I hope that's fair enough. It's a health institution. Yeah. So when I joined AMREF about 3 years ago, our staffing in terms of sexual or rather distribution was 60% men, 40% women. As we speak now, we are at 56% men, 44% women. I'll come back to that later. When it comes to senior leadership, the topmost leadership in AMREF, when I joined AMREF again about 3 years ago, we were about 65% men and 35% women. But now, as we speak at AMREF, we are at 55% women and 45% men. Senior leadership. I expected a bigger clap, or louder clap for that. Yeah. And how has that worked for the last 3 or so years? It has been a deliberate journey by the top leadership. And I want to applaud our group CEO, Gigi, there you call him, in his absence. When you see Gigi walk out of a forum where there's no gender balance, that's exactly what he does in AMREF. I'm sure you've seen that at a global forum where he walked out of. And that's the message he passes to all of us in leadership. That don't go into a room, in a meeting, and it's not well represented, and you continue chairing that meeting. Please ask why that's the case. It's acceptable if probably have people who have said they will not be able to attend. But if that's the design of that engagement, then please ask why. And that's the message that has come to us over time, such that the leadership at AMREF level, we are very keen towards noticing some of those things that may pass a common eye. But there are 4 things that we've deliberately done through our HR and business development team. One is having what you've talked about, we had a session where we asked, there was a bit of a questionnaire that was passed across the organization to just find out what do women in the organization wish to have in terms of promoting that kind of leadership and growth within the organization. And that gave us very good outcomes. One of them was the formation of the AMREF Women Elevation Network. So we have an AMREF Women Elevation Network that is very critical in terms of supporting women. And it's a mentorship program, coaching program that elevates women. We've also formed a male one, because we realized these women are moving too fast. So we've also formed a male elevation network. We are calling it MEN. We are doing very badly, though, because the women have moved very fast ahead of us. The second thing is deliberately developing programs in collaboration, in partnership with other entities. So we have the Women Leadership Program in partnership with Oxford University. So it targets specifically women in middle-level management, low-level management, and we've partnered with Oxford, and they get trained or coached into senior-level management. And two of the ladies who are at the high level have actually gone through this and grown through the system to be where they are as we speak. There's a third one. Right now, we can't talk about AMREF without talking about climate change. So you have Women in Climate Change Leadership Program, because we realize actually that a lot of climate change discussions are being undertaken by men, both at global level and even at AMREF level. So we've identified that niche and asked ourselves, what are some of the climate change issues that women should get involved in? So we have that. And then the last one is we are very, very particular discussing diversity, equity, inclusion, and belonging as a core enabler towards our achieving our strategy for 2030. So, and that discussion, all of us in management and leadership, we've actually been dogmatized so that it's part of what we are discussing on a daily basis, because it's part of our strategy. And our strategy, we are very deliberate in changing some words to say specifically, our mission actually talks about specifically targeting women and children, so that all of us as an organization, we actually work towards achieving that intervention. Thank you.
Thank you so much. There are a number of things that I'm getting. Normalizing leadership, Job. Noticing and creating the spaces for women and holding them. And then creating institutional fora so that women can actually elevate, is what I'm getting from the two of you, as some of the things that can be done. But I want to ask the audience, because I think no one understands where the shoe hurts like the wearer. So we're going to try this exercise. I know we've got just a few minutes. I want you just raise your hand and yell. Do we have mics? We have a mic over there. And do we have another mic over there? We've got one. Excellent. Okay. Thank you so much. What do women need so that they can be able to move up? As you see the hands stop moving really quickly. What do women need? What do women need? Go, just stand up, say, this is what I think they need. No long speech. I want them to hear and the world. What do women need?
They need for men to recognize that they know something. When men walk in a room, they occupy it, it's assumed they know. And then they weigh up women and wait for the first 5 minutes for what you say. So we need men to know we know, and we don't need to be weighed up.
We know and we don't need to be weighed up. What do women need?
Women need men to
Move
change.
the mics.
Women need men to change their perspectives. So as women are growing up, you're empowered. But when you get to the workplace, they look at you as a homemaker at the workplace. So from empowerment as a child, but then you come to the workplace, you're asked, okay, serve tea for the guests who are coming. So it's like reverse roles. So women need men to change their perspectives of women at the workplace and look at them as equal professionals.
Change your perspective. Get your own tea. What do women need? Next one with the mic. What do women need? Who's got the mic? Stand up.
All right. Women need flexi time, and we need hybrid work environment so that we can balance our other responsibilities properly. Thank you.
That's excellent. What do women need?
For the women sitting in positions as tokens, I think they need a system to ensure that they break the, whatever has been set within those systems, because we are already sitting in it.
To break the systems, what do women need?
Men listen, but we need them to hear us very well when we are speaking.
To listen and to hear. Who's got the mic next? Pass the mic on. We're going to do this. I've got 2 more minutes. What do women need?
Women need equal opportunity as men.
Equal opportunities as men.
Hey, women need to know that we have the knowledge and capacity, so we need to have a level playing ground. Thank you.
I think what do women need?
Women need granulosity. For example, when you see women as aggressive and they're considered to be, that's to be aggressive, too aggressive for the workplace. But the same thing in a man is considered to be forward, it's considered to be something to be praised. So there has to be a balance to the granularity in the workplace.
Granularity, there's a fantastic one. What do women need?
Women need to be looked at as fellow professionals, not flower girls in offices, and people who can do it.
That's excellent. I'm going to take 3 more.
Women need men to know that we come with passion. So when we are passionate about an issue, we are not being petty, we are not being emotional, but we bring passion. We never leave it behind. We are very passionate about everything we do.
I love
and
it.
We show it.
Passion. What women need?
Women need the opportunity to take space, to thrive, to make a difference, and to be recognized.
Oh, that's fantastic. Last one. What women need? Okay, second to last one, you, and then the mic behind. Go.
Women need no mansplaining.
No mansplaining. Woo, say it out loud for the women in the back.
Men need to know as being feminine, it is our strength, not our weakness. We don't need to be men to be strong.
We don't need to be men to be strong. What do women need? I opened a Pandora's box here, didn't I?
Women need men to actually accompany a woman when she's meeting a male political person. Do not leave them alone. Make sure they're taken care of, because that is a real situation that happens in this environment, and I believe a lot of people know.
Sometimes women need protection from other men. What do women need?
Yes, women need to build confidence and to recognize that I'm not responsible for your opinion about me.
Damn, what do women need?
Women need men to understand that we are highly emotionally intelligent to handle any work under any kind of pressure, while also handling our home responsibilities.
What do women need? If the mic's not working, move another mic, or say it out loud and I will repeat it.
Women need empathy from men.
Women need empathy from men.
For example, understanding the various aspects of our biology that could affect us at work.
Say it again. Women need
empathy from men. For example, understanding the various aspects of our biology and the processes that could affect our performance at work.
That affect our performance. What do women need?
Women need recognition from men, especially for the work that they've rightfully done, not men taking credit for what they haven't done.
Good.
What do women need?
Good pay. Women are not the cheap leadership option. We are equal to the pay, we are equal to the work.
I'm going to stop there. I know that you're burning.
Burning.
Do women know what they need?
Burning.
Do women? I know it's burning. I know. I have seen all the burning ones, and I knew when I opened this. Here's what I wanted to say to my fellow panelists. This is not a progressive issue. This is not a someday it will happen organically. And I told you I'd come back to that organically. I knew I'd had it in my back pocket. It's not a someday may be good to have. We're not men with vaginas. It's a health conference. I'm allowed to say that, aren't I? Yeah, we are in a health conference, right? I can't say that anywhere else. I wouldn't dare. We're safe. I'm safe here. It's a safe space. And so the recognition that emotion and passion and waiting before we speak, because aggression for women is not, ambition in women is not aggressive, is not a failing. It's not a failing of biology. It's not a failing of culture. It's not a failing of how we've been socialized. It is a legitimate form of expression. And therefore, to be an ambitious woman is not to be an abrasive woman. Also, on the other hand, to be an ambitious woman is also not to be a flower girl or a trade-off between can I be married or be the CEO. And it's not a trade-off between I am the CEO of my place of work, my husband must be sat on. He has not traded his masculinity for my power. My power resides with me. And I want to hold that now and to come to you, Data 4. The last question that I will ask before I ask everyone to kind of their last reflections. And I saved this one for you because I wanted women to say what it is that women need. And then to come back to you because you are a champion for male allyship. It is the entirety of what you do with your career. Based on what you've heard, how do you move not just your institution, but the entirety of the conversation around institutionalizing women in leadership to reflect the concerns that you've heard on the floor? What needs to happen next?
Quite an interesting question. And to be very honest, I like the voices, what you really need. And you don't just need, you demand, and you also work for it and to get it for yourself. Because when you wait for us to give, the typically traditional masculine man will never give you. Will never. But the other man, like maybe some of us here, will give you. I'm not campaigning, eh? Yeah, all of us, sorry. All of us, apart from her. Yeah, so at an institutional level, and something that did not come out, she mentioned something, but she sugar-coated it. Something that in the institutions I've worked with, there are females, I'm so close because I work with, on issues of gender equality, I'm so close with females. You find that some of them that we work with, they have menstrual cramps, for example. And most institutions, to be specific in South Sudan, we do not have an MHM policy, right? Which makes it quite difficult for women in the workforce to be able to benefit from anything related to menstrual health. But we've taken it as an institution intentionally, especially within menstrual health, that if you have menstrual cramps, you do not need to come to explain to me that I'm not feeling well because I have menstrual cramps. You just excuse yourself, go home. That within the institution is there. And I hope, and I'm happy that I'm meeting him, the chief of party for AMREF. Men for Women gets money from UNFPA through AMREF. And we work closely with AMREF South Sudan. And I think within that, if you can also be able to put this perspective into place within AMREF South Sudan and with the partners that AMREF works with, I think we start to build small and then it goes bigger. Now, I also mentor civil society organizations. I have had you, okay? I've had you. Within IMAP, engaging men on accountable practices, we use the women voices within the 8 weeks to impact on the men within the 16 weeks. Now, this, I call it voices, that in my interventions with the border riders, which is a common thing within the region, because we engage with them to be also allies. We also have conversations around social norms transformation, promotion of women leadership, and many others. Also on menstrual health, the men-to-men groups, this is a voice that I'm taking back, and believe me, Maybe next time you might not see me, but you might see different faces coming for this conversation and being male allies. I promise you this.
Thank you. I'm going to look for June and ask for 3 minutes that I will divide into 45 seconds each for each of my panelists to say their last burning remark. Would that be okay? Thank you so much. Right, so starting from the end, Samveru. Parting remarks on one way in which male allies can continue to use their power, privilege, and influence to drive meaningful progress towards women in leadership.
René, let me start by acknowledging the exercise that you just put us through. That was really powerful. Fantastic reflections came through. Our sister here, we were listening and we heard you. Sheila, I do not need to tell you how closely I've walked this journey with you. There are women in this room whom I have drunk incredible amounts from. I've drawn from their reservoirs. I have drawn from a cup that never stops. Sheila is one of them. I recognize our former cabinet secretary, Madam Cicely Karaoke. She's another one. And so, René, that was really powerful. I walk out of this panel today and this room actually very energized and inspired, reminded of the power, privilege, influence that we occupy, not just as an institution, but at a very individual level. I happen to lead a team, the East Africa team at the Gates Foundation, that is predominantly female. With that comes huge amounts of opportunity. It's a very hardworking, hard-driven team, but there also comes significant amounts of opportunities to really shape this team, constantly looking for opportunities to raise them, to lift them, to encourage their growth and development. But at an institutional level, the thing that really inspires me is how the Gates Foundation has, over the years, I should not pretend that this has always been true for the Gates Foundation. It hasn't. I shouldn't also pretend that we've reached the destination. We haven't. But the commitment to the journey is very real. So all our investments at the Gates Foundation today are either gender intentional or gender transformational. If your investment does not confirm, if it doesn't demonstrate gender intentionality and gender transformation, it simply does not get approved. If an investment comes to me for review and it doesn't have those very clearly stated inputs within it, it doesn't see the light of day.
Thank you. So I'm going to now need another 3 minutes because he ate 1 and 45 seconds. So add 1, 2, 3 minutes, one for everyone.
Thanks.
Go.
Thanks, René. Mine is to just say that we need to go to the bottom of the pyramid and get back there. Why I'm saying that's because I'm reminded when I was around 34 years with my firstborn, I met my former classmate who used to be either number 1 and I am number 2. We used to interchange, and both of us were carrying babies. She was carrying a grandchild while I was carrying my firstborn. So what that means is basically that we have a lot that we lose at the bottom here. So how do we get back there to identify some of these people that we can easily lose a generation about? And Nora, thanks for this. I think what you're doing is to build that trust back. And there are 3 things that we must actually focus on. Is whatever we are doing logical, is it authentic, and is it providing for empathy? Thank you.
It's fantastic. Thank you so much.
Awesome. Just to say thank you for this opportunity to share our experiences and our thoughts. I think 2 things I want to say is that us as men, we recognize that allyship is a journey and not a destination. It does require sustained investments and commitment from men. And 2, allyship is also about us men decentering and stop being on the spotlight, right? We, at this point, need to stand aside and let also women take control. We also need to have their voices heard, So we need to eventually pass the mic to the next lady, to the next woman, to elevate her voices. I think you guys saw me passing the mic to my boss.
We did. That bonus is coming through.
Okay, thank you.
On a light note.
Yeah. So we all recognize that men are stigmatizers, men are perpetrators, men are the blockage for women's success, but we will not only leave them there. We need to change these men so that they themselves can challenge toxic masculinity and gender stereotypes, so that they themselves can amplify women's voices and support efforts towards gender equality, so that they themselves can be allies, so that we have more women in leadership, especially in health. And I just want to close again by saying, you cannot empower an oppressed wife who comes back to a primitive husband. Thank you.
Ladies and gentlemen, Samburu Washiko, Dr. Chris Baraza, Dr. Job Makoyo, Data Emmanuel Gordon are 4 male, not just allies, but champions for meaningful change on this continent. A round of applause for them, please.
Thank you so much, Renee. Gentlemen, before you leave, I'll ask that you take a photo. We need to capture this moment. And I'm about to, with permission from Data, change his quotation to say, even for the unmarried ones, boyfriends, partners, situationships, no. Thank you so much for sharing so openly. May there be many more like you all. And ladies, thank you for sharing. You know, there's a difference between what we need and what we want. I'm so grateful Renee started with what we need, because the what we want list is so much longer. And I want us to be able to, have they smiled well, photographers, our media team? Teeth are required for this session, yes? Thank you so much. Thank you. You may take your seats. So much to learn, so much knowledge. Renee, thank you for giving us that boost. I want to give you another boost. It's time for us to go for lunch. Just to grab a few bites, because we need to come back and have a few more panel discussions, and I don't want us to have to shorten the conversation, because I think the conversation is rich. I think the conversation is so necessary. So what I'd like to do is shorten lunch. Can we try and do that? Yeah, the restaurant is ready for us, so if we can just go grab something for sustenance, because there will be tea and bitings later on, so leave space in your stomach so that we're not sleepy. And make sure that you meet at least 5 people as you're lining up for lunch, picking your plate, and having something to eat. We'll be back here. It is exactly 12:36. We'd like to be back here at 1:15. I think we can try and manage that. Is that okay? So have an accountability partner with you. Lunch is at the Lada restaurant, and there will be meal vouchers that will be handed out to you as you exit. Please pick one, because lunch will not be accessible without it. Once again, 1:15 is our intended time. We will begin because all our panelists are here and you do not want to miss out. I'll see you shortly. Bon appetit, and see you back here at 1:15. Thank you.
the next title, the next promotion. But now, as I have gone through this journey, I have come to realize the importance of understanding the difference I bring does not have to be what others define. It also is based on what have I defined for myself as success. What have I defined for myself as leadership in my current career path? And that for me is a blessing. Just understanding that I don't have to stick to the norms and giving myself permission to take a step back, reevaluate, and make intentional decisions for my career, for my life, social life, family life. And it really makes me more patient in my life choices. My experience of working with women from different countries was beautiful, especially our mentorship group, because my mentor is from a different country. And just understanding that challenges may be different, but when you have community with you, when you have different perspectives, different lived experiences, that advice makes you feel like it's a warm hug, especially for a woman. I've loved it. The session we had with cohorts from Asia and the US were lovely, because I came to realize that there are experiences that are shared, not just that we are so different from each other, but as women in leadership, the experiences that are shared. And I really look forward to having that community continue. The experience they have, the advice they give is really from an informed point of view. And so I don't have to experience everything myself, because I can benefit from their experiences. Now that I've completed the leadership journey, I'm really looking forward to implementing. So what I'm looking forward to next is really going full throttle in the direction I want my career to advance in. And that's sexual reproductive health, especially adolescent sexual reproductive health matters, and looking at policy change in that direction. That is what I really want to make a push for, and I'm hoping in the next few years you will hear my name in some of these policy changing areas.
My name is Dr. Cordelia Katurebe, and I work with the Ministry of Health in Uganda in the AIDS Control Division, where I coordinate HIV care and treatment. And for this course, I belong to the 2022 East African cohort. For me, it's really been a rediscovery, and this was not my first leadership journey, but I came to this course to learn, and indeed the rediscovery of what I am as a leader, but most important, the key areas that I need to improve as a leader has really been what has changed a lot, and the practical steps that I need to take to improve on my leadership journey has been very inspirational to me during this course, and it's really my take-home message that I've been able to gather. My favorite part of the journey was really the small group discussions that we used to have at the touch points, and in here.
Ladies, once again, 1:15. I love that you're networking, but do so as you walk, please. 1:15 is when we will begin. Please grab some lunch, grab your 2 broccolis and a piece of chicken, and come back. We'll see you at 1:15.
My biggest, not just surprise, was I just wanted to understand what is it about women. Typically, I have grown up with boys, and I've been in really a male-dominated society, and I just wanted to see what is unique about women learning together. How best can they visit their best potential? And I think we managed to get that. And the description from the beginning that this would be a safe space, I think really came out during the journey. And for me, that was really a surprise and good, yeah.
My name is Dr. Elizabeth Onyango. I'm a public health practitioner at the Ministry of Health in Kenya. I work in the Department of Non-Communicable Diseases. I oversee diabetes, cardiovascular diseases, hematological diseases like hemophilia and sickle cell, rare disorders and kidney conditions. I am in the inaugural leadership journey for WomenLift 2022. That is the first cohort in East Africa. I remember when I started off, we had to go through some assessment, and through those assessments, a lot was revealed concerning myself as a person, my identity, my behavioral tendencies and competencies in leadership. And out of that, I discovered my areas of strength, my areas of weaknesses, where I needed to improve on. And together with the support of the WomenLift faculty, the mentors that we were assigned, including the coaches, identified some of the areas of improvement. I realized that I needed to really work on, especially when to do with resilience. I scored very poorly on resilience. It was revealed that I was a very reactive person. I didn't have this patience on how to deal with situations, yeah. So I had to really shift my mindset to see things differently and to learn how to be resilient, how to be proactive, and how to really listen to other voices, other opinions, and shape how I lead. There are so many other competencies that were tested, but even the ones that I was performing well, I believed there was room for improvement, and I've seen myself really improve. And if I were to assess myself now, I'm a different person from when I started. Also, I was able to identify how I influence others, my influence style, leadership influence style, and I realized I was weak in negotiation. I'm able to inspire, I can be assertive, I can bridge, I can rationalize, but when it came to negotiating, getting a middle ground, getting a win-win situation, I was very poor at that. So I realized I had to work on it. I can't say I've reached there yet, but I'm progressively working on trying to just understand other people's perspectives and just being able to negotiate, see ground, as even I allow others, yeah, to take their space. Yes. For me, it was a total mindset shift in the way I had understood leadership. But there's so many lessons. Through so many engagements, I realized that for you actually to go up, for you to grow, you need to really hold others up, down, and round. I thought that leadership is just upward looking, but you also, as you look upward, you have to carry others along. You also have to benefit from those around you. Again, I realized that that women face different challenges. Some of them I was not really aware about until maybe that time when I met women from other institutions, those who've been in corporate, those who've been in the NGO world, civil society, bringing in their experiences. And so some things came to light, and I became more sensitive and more aware of what is happening. There's a lot I can say. There's quite a lot that we learned. Of course, there's some new concepts which I didn't even know existed.
My name is Emily Njuguna. My background is in medicine, particularly pediatrics. I have been a clinician for many years, but I currently serve at an international NGO called PATH as the Senior Technical Advisor for our Integrated Maternal Child Health and Development Unit, supporting the African region. Actually, I would say that I was influenced to apply. So I was nominated by one of my friends, and she said, you know, I think you'll really benefit from this because I see leadership qualities in you, and I think this would be a good fit for your career development. And I'm nominating you to apply. One, I had never heard about WomenLift Health until I heard about, you know, the advertisement went out. You know, and so I applied and said, you know, let's see what happens. And I think from that, I've come to realize that sometimes you don't need to know too much. Because, you know, if I had known about the, you know, requirements of the journey, I would definitely have applied. But then, you know, I think I would have thought about it too much. And then maybe not applied, so I don't know. But really, I was influenced by my friend, and I'm glad she did. The leadership journey was absolutely transformational for me. The person I was at the beginning of, you know, this leadership journey, and now I'm a completely different person. You know, I've learned about myself, my leadership traits. You know, we did a leadership assessment, and I was able to see what others think of me, but also evaluate what I think of myself, you know, and work through some of the blind spots that were there in my leadership. But I've also learned about the skills I need to be a good leader. I've learned about networking and the importance of that in growing myself and my career, myself as a person, really. And I've also learned, you know, the importance of relationship and a support system with our male colleagues, you know, building male allies. And I think that's part and parcel of being a good leader. You know, you need to learn how to handle yourself as a person, to lead others with, you know, diligently and with good tact. You need to learn how to network. You need to learn how to build relationships that matter with men. And so this journey has equipped me with so many skills and resources to help me to be a better person and to help me to be a better leader. You know, when I think back to this leadership journey, and I think about even just the friends that I've made from this cohort, how can I step out being the same when I've had stories from amazing women from this cohort, and how they've been able to surmount some of the challenges that they've faced before. That's both from coaching as well as mentorship, our mentorship groups. So there's been a lot of learning, a lot of rewiring, reframing in my mind that has happened around leadership. And so I think I'm a better leader. And I think I have foresight into what I want to do in the future. I have a clearer goal. My path is clearer going forward. So this journey really has been invaluable. So I've done leadership courses before with other institutions, and a lot of this leadership training modules and courses tend to be very theoretical. But the East African leadership journey through WomenLift has helped me to be able to interact with other women in real life and get to hear their stories, practical examples of how they carry out their leadership. And that's been very different. Again, the networking has been different because, again, you know, when you do online courses on leadership and management, etc., it's not the same as having coffee with someone, you know, and discussing your challenges and discussing, you know, your experiences in healthcare. It has been very different. The other thing that has been very valuable to me has been our mentorship groups, you know, interacting with such a accomplished woman, you know, and getting to hear her story about how she got to where she is now. And then the coaching sessions, one-on-one coaching sessions, have been very instrumental in helping me to unpack all those layers that I didn't think were an issue to me, that were actually affecting how I carry out my leadership. So that's why it's unique. It's unique because you get to network, you have opportunities for mentorship and coaching, you have access to so many resources. And I think the other thing that I must mention is that you also have access to the alumni group. And particularly for my leadership project, I actually tapped into the alumni and the other cohorts, that's the India and US cohorts, to help me with my project. So I've really enjoyed that as well. You can't come out of this leadership journey and not feel indebted to pay it forward. I think about how I've grown as a person and the kind of skills I have now and the knowledge I have now, and I can't help but want to give back. I have discussed with my friend just maybe a few minutes ago, and I was saying that, you know, I can't wait to meet with younger girls and younger women in healthcare, particularly, you know, the ones who have just finished school, are unsure about, you know, what trajectory to take in their career. I think those are the ones I feel I need to tap into, because I struggled, you know, figuring out, you know, what do I want to do? How do I do it? Who do I speak to? You know, and I think giving someone else a sounding board would be so invaluable. And hopefully, you know, we can also share the information that we've gotten in our socials, you know, and say, Nora taught me this and Miriam taught me this. I think that would be very, very beneficial for all of us, all the women in healthcare. And the other way I want to pay it forward is just to finish my project. I was looking at resilience in healthcare, among women in healthcare, and I'm hoping that that project can also be a way to give back. As I, you know, develop a well-being curriculum for women in healthcare, hopefully that will be my way of giving back, you know, saying, you know, the challenges that we have are many, but there's a way you can sail through this, and this is what you need to do to keep your well-being intact.
So my name is Esther Luanga Walgwe. I work with Population Council Incorporated. Population Council is a global research institution that focuses on sexual reproductive health and rights. And I'm the resource mobilization lead for our international programs. And I belong to the WomenLift Health East Africa 2022 cohort. I feel like there are opportunities for me to pay it forward both within my institution and externally to my institution in terms of ensuring the advancement of women's leadership. Within my institution, I think there's a really, really, really good opportunity to intentionally look at how we are currently advancing women's growth at all levels, junior, mid-level, and senior, and see how there are opportunities to develop programs that can look at women's development. First of all, assessing where are our women today, how are we supporting them, and then seeing how we can leverage internal and external capacities to build women's capacity within the institution, but also advance them. So say through professional development programs or intentional mentorship and leadership programs. I think we have several women leaders in our institution. I'm not always sure that they are as well resourced and supported. In my existing institution and at the Population Council, we have a fantastic diversity, equity, and inclusion and belonging agenda. And I think as that agenda moves forward, really working with that team and those in that position to see how we are not only looking at DEI from a broad institutional cultural perspective, but also looking at specific aspects in terms of inclusivity so that women are not only represented, but really enabled to grow and thrive. Male allyship is essential to to the advancement of women's leadership. Without it, we can't shift. I think that within most institutions, most leadership positions, the holders of funds, the holders of decisions are men. Men sit at the table. They get this automatic seat at the table, whereas women kind of have to nudge, push, shove, crawl, climb to get there. Males, I think in 2023, in several contexts, recognize that women bring something to the table, but they don't always actively take on or intentionally take on the responsibility of facilitating that. So male allies are key, they're essential. I think that men have an opportunity to recognize some of the inherent biases that exist within institutions, whether it's this bias that, when we have children, we are not as focused, we are less competent, we are maybe perhaps more complacent because we cannot focus on our children and the work. But I think recognizing those type of biases exist, and then addressing those biases with women, and thinking both not only of the biases that guide their decisions, but also how those biases impact our policies within the institution, and supporting the change of those policies to enable women to participate. The support of women for other women is beyond essential, and we think it should happen. You would think it would happen automatically, but I think sometimes we are our own, I'm not sure what the word is, detriment, I would say. Perhaps because as women, you do need to kind of work a little harder. And perhaps there's this view that if you're not succeeding, it's because of your own lack of effort or lack of incentive or intellectual capacity and so on and so forth. So I feel that as women, especially women in leadership positions, to do a couple of things. I think recognize where the world is today. I feel that women, perhaps in more senior leadership positions who may have grown through 10, 20 years ago, faces certain barriers. Whereas there's some similarities and barriers then, there are differences today. So it's important that women in leadership positions who are well placed to support from the needs of women today. So allowing for that open dialogue, which has those conversations to say, what is it that women are facing today? And how can I, as a woman in that position, enable that? Either through mentorship, and I think I've seen women hesitate to take on mentorship roles because of concerns about time and dedication, or concerns about not wanting to show a preference for one individual over another. But I think recognizing that it's our responsibility to, if you are in a position, allow those who are coming behind you to grow as well, and to support that, so that we all, what is it they say about the sea rising? We all rise together. WomenLift Health program is that it's so impactful. I mean, you look at the women in this room coming from diverse areas within health, and who are smart, intellectual, amazing women with so much passion for the work they do. And when you look at programs like this, I mean, the reach is limited to what the program can take on. So I think, for one thing, leaders in positions need to recognize that they have to take a role. They can't, I mean, there are several women's programs out there, but they can't rely on those. Some of that building has to happen within institutions themselves. So firstly, at the leadership level, leaders in institutions, executives need to recognize the role that they play, because they do play a role. So at the top level, there's the role that they play in terms of the culture that they set. And this can be reflected not only in the diversity of leaders within an institution, and diversity not just in gender, but also in ethnicity, and also in terms of inclusivity at the top. So not bringing people on in a tokenistic way, which happens all the time, but actually putting diverse females into leadership positions and resourcing those positions adequately with the staff, with the funding, with the mandate to have an impact, and making sure that those individuals are reflective of the work that those institutions are doing. So I think that's one thing that's, I think, really key. I think from a policy perspective, we're living in a world where there's growing recognition for the importance of quality of life, right? And work-life balance, and that has to be recognized. And then we have to recognize that women do have multiple responsibilities that should not, that don't necessarily impact their work or decrease their ability, but can if an institution's policies are not flexible enough to enable women to effectively contribute. So anything as simple as flexible work schedules, and looking at those human resources policies to ensure that they are enabling for women to actively participate in an institution. And then I think just broadly looking at their programs, so whether it's sponsorship and mentorship programs or programs that allow for open dialogue where women can come together and share and learn and also push initiatives within an institution that can advance change, I think would be very, very instrumental.
My name is Evelyn Opondo. I am a human rights lawyer, a reproductive and gender justice advocate. I work at the International Center for Research on Women as the Africa Director. I'm based in Nairobi, Kenya. My journey with the East Africa Global Health cohort has been very fulfilling. This opportunity was first highlighted to me by one of our cohort members, in which to me really speaks of the power of network. This journey has given me the opportunity to really introspect. It has really opened my mind to more of self-awareness of who I am, reflecting back from where I come from, what are the values that have shaped and continue to shape who I am, the positions that I take, and also looking at what are my biases, what are my strengths, and how do I navigate all of these things? How do I show up so that I know what are my likely pitfalls? For me, one of the greatest things that I have really enjoyed in this journey, other than the fact that I now understand myself better, there's a clarity about where I want to go that I did not have previously. And I am working with this diverse group of women and that bring different skill sets and have diversified my network. I am a lawyer. I am working with a group of medics, a group of researchers, and all of us together contribute to the health ecosystem. One of the things that I have really liked about the journey is the fact that the experts that help us are also diversified. I have a coach, I have a mentor, we have a facilitator, and we meet them individually, but we also meet them collectively so that we are learning from each other, we are supporting each other, and we are reminded that our experiences are not unique. What I also like is the fact that even though we have a very context-specific cohort, we are also globally connected because we are also engaging with cohorts from different regions like the US and like Asia. And that helps us really solidify our relationship as global leaders, but also still very locally connected. I have also really liked the fact that, we have looked at what it is that makes one a true leader. And for me, one of the things that I have come to really value is the importance of effective communication and how that plays into what it means to be a true leader. And so as I go into the world, I'm confident and I know that I am ready. I feel like there's a fire in me that I did not necessarily realize before, but I feel I'm ready for that global space, which is where I want to be. The WomenLift journey has opened doors for me. I am in a steering committee, a global steering committee that's looking at, what are the areas that needs more research in women and health. And this is an effort by the Melinda Gates Foundation. WomenLift has also given me a platform to voice my opinions through writing and through engagement at global forums. And I am looking forward to taking up more opportunities, because one of the things that we learn through this journey is how we challenge ourselves to take more tasks and to open ourselves, and importantly, to voice our views at different levels. So I am leaving this journey more confident and knowing that my voice as an African woman leader matters, and it's time to be heard. During my free time, I enjoy walking. One of the things that the leadership journey keeps challenging us is the importance of balancing life and career. My health. I have come to appreciate that my journeys intersect, whether it's my health, my family, all of this contribute to who I am as a leader. So creating me time is important for me, and I'm trying to balance all of these things so that I show up as a well-rounded human being and a leader.
So our objective really is to work with communities to design and implement programs that will impact on them and how they practice appropriate health behaviors. I'm proud to be a member of part of the inaugural East African WomenLift cohort 2022. And it's been an awesome, awesome experience. It's an experience that came, I would always say, timely. It was timely for me because I was taking up a new role as a leader, leading a team. And it just taught me to be more impactful, to be more strategic, to communicate better, and to also identify opportunities within my team to help them to grow. And because of the experience I've had with WomenLift, I've actually intentionally brought up the women within the team because somehow, by coincidence or not, there are a lot of men who are working within the team. And you find that many times the women would be silenced, they wouldn't speak out as much. But I've given them an enabling environment, helped them actually even lead some kind of mini teams within the project that we do. And I think it's just a way to really bring them out and help them to reach their full potential as leaders in their own sphere. My leadership journey really came from the premise. There was a time when I wanted to get some women to apply for a position in this organization that I once worked for. And so when I put it out in this group that, look, there's a position there, apply for this position, so many of the women just didn't apply. What happened was when I talked to my contact in this organization and asked her, so how many women have applied? She said, Grace, on the first day, we had like 50 men and 2 women. On the second day, 100 men and 5 women. So I remember going back to the group and asking, what's happening? And there were so many questions like, are you sure? Is it legit? Am I qualified? Those who are interested would call me on the side. Do you think I'm qualified? Do I have the skills? And then I realized, women, we have the qualifications because we're going to school the same way these men are going to school. But they're coming out. When these opportunities come out, they they don't doubt themselves. But here we are, we're asking ourselves, am I good enough? Can I really do this? And yet we actually have that experience and opportunity. So my objective really is then to work with students who are in the final year, because I think getting them to have that mindset, to look at themselves as people who are capable, I think that kind of training needs to come early and not come later on when they might, it can come anytime. I always say anytime is good time. But if they start early, then there's actually a better opportunity to even reaching the skies, so that we can try and meet that gap of women in leadership. I think we think about it later when we should be thinking about it early. I think it's also the health sector. I think today morning, this evening, during the talk by our guest speaker, when she asked in the various sectors, why are women missing in the banking, the marketing, the design? We have women taking up leadership positions, but in the health, it's just not happening. So really the objective is to try and understand more, what is it that is holding the students back? Now that was actually the first part of the project. The other project was then now to talk to people who've qualified 2-3 years later and find out, okay, of those who actually look like they have potential or they're actually heading to some leadership positions, what is it that's making them think that way? And we know that when students finish university, they're thinking about getting married or getting children, or the things that they look and think, maybe let me do this first before I do that. But I think you can actually do both, and balance it out. And maybe they just need people to mentor them and really to let them learn, how can you balance this? First of all, one thing that this course actually has taught me, perfection shouldn't be the enemy of good. Yes, I love my things to be up to speed, but I realized that sometimes it was holding me back from moving forward. And yet, moving doesn't mean you're not doing as good a job. You're actually doing it better because you're bringing in more people with you and accepting other people's contribution to whatever it is that we are doing.
Dr. Grace Mihelso.
What excited me about the leadership journey was just that it was so timely. I had gotten this position where I'm a leader, and here was this opportunity where I can learn from experts. I of course did my research, found out what WomenLift has done, in the US, who has been mentored, and I said, gosh, this is just exciting. It's just right. Being mentored by women, strong women who have reached the pinnacle of their careers, but they're also telling us that just because you reach the pinnacle doesn't mean you stop growing. You can still grow. I think what has excited me most as I've taken the course is the resources. Excellent. They're there, they're available. And, the things that we can use, you're not just a leader within the work front, but in other sectors that you're doing. So the things that can be applied in very many other sectors. And I've shared them with some of my peers who might not be doing the course, but when there's something that really strikes out that they can benefit from, it's available for them. So I think the resources, the people, and of course the networks, it was exciting meeting people. Some of them were classmates who I haven't met in a long time, or people who I've worked with in other fora, other sectors, us coming together and just discussing some of those challenges, which I realize are not unique to me, but also getting inspired that, hey, look at this one, she started like this and she's reached there. What did she do? So it's just an opportunity to learn from each other, build from each other. And of course, networks. I mean, I'm going to get a job through that network. I know it.
My name is Helen Barsosio. I'm a medical doctor and a clinical research scientist at the Kenya Medical Research Institute at the Center for Global Health Research, where I lead the maternal and newborn health studies within the malaria division, and it's a consortium that brings together 3 organizations: KEMRI, Centers for Disease Control, CDC Kenya, and Liverpool School of Tropical Medicine. So I belong to the East African inaugural 2022 cohort. At the time I applied for this leadership journey, I was nominated by a senior scientist from Stanford, Professor Desiree Labor, and she was a collaborator. We met briefly. I talked to her about my struggles in growing as a scientist in my center, and I needed a little bit of help to really get there. It was also at one of those inflection points. I wasn't sure that I had chosen the right path, and I was almost giving up on it. So WomenLift was exactly what I needed. I just didn't know exactly at that particular point that's what I needed. So I applied for it, hoping that I would get new focus, rejuvenation, just new direction. And maybe I thought WomenLift would have been the point where I could change my career or move to something else. At that particular point, I came in with a lot of questions and without a lot of answers at that particular point. My experience in WomenLift has transformed my life, and I know that's an understatement when I say that. It's a gift that I needed at exactly the right time in my career, and it has changed the way I think. It has changed the way I view research. And let me just give a bit of a background. The career trajectory of a woman scientist is tough. It takes you up to 20 years to reach the point of senior leadership, and I'm at my 11th year. And I'm looking at another 10 years of growing, and I thought, I don't have 10 years, I don't have 10 years. I need to shrink this timeline, but I also needed clarity of purpose, the why I do what I do. That part wasn't clear. I knew that I liked working with pregnant women. I knew that having women walk through their pregnancy journey safely was important. And I knew that I was obsessed with it without actually knowing the why. So this leadership journey has helped me clarify why I'm obsessed with women, why I'm obsessed with pregnant women specifically. Why do I want to fix or solve adverse birth outcomes? Why do I want every woman to live their pregnancy with a healthy baby? And I needed to know that because it's what has fueled my resilience at this point. And it's given me greater clarity about who I want to collaborate with, where I want to write, which grants I want to lead, where I want to work, and specifically it has to be Sub-Saharan Africa. Healthy pregnancies for every woman, and allowing and focusing research in that particular area. It's also not as widely researched. We tend to do research on family planning, on other things, on infection and others. But this particular group of disease, this particular group of conditions, adverse birth outcomes or poor birth outcomes, why are babies born stillbirth? Why do women have miscarriages? Why are babies born too early or too small? Because if they're born too early or too small, they tend to die within the first month of life. And a lot of it is things that started during pregnancy. And we need to understand it holistically. We tend to solve it in terms of little silos. We look at infections and etc. But we need to look at a woman as a whole, the system where she is, the community where she lives, and others. And I'm really excited to really focus on this now, because I have clarity for why I want to do this. And a lot of it comes from the women in my life, my grandmother who had multiple adverse birth outcomes, my mother, my sisters, and WomenLift has helped me get there. So there's the group talks and the mentorship groups where everyone really talks about their story in the mentorship groups. And then you realize, oh, you all have the same problems, you all actually have the same insecurities, you also have the same aspirations. And just affirming and reaffirming each other within our mentorship groups has been very rewarding. And the coaching. I mean, I have to say 50% of this journey is the coaching. The coaching and the touch points, oh my gosh. And just learning to see yourself through every touch point. It's literally like a mirror. And you get to see, oh my gosh, that's my trigger. Oh, that's exactly how I think, and maybe I need to rewire how I think. And then going to discuss that with your coach and said, we had this touch point and this is what I felt and this is what I saw, and I don't know why I reacted the way I reacted or in a certain way. I think the journey has been quite long for me, and if I knew what I knew now, I would have started early. So really 3 things. Mentorship. We need to get women to come into science, and then to help them stay in science, which is what I realized from a leadership project. We're very good at hiring women. We have very pro-women hiring practices in research. And a lot of women are joining health, and it's reflected in our medical school. It's reflected in where women are hired. You'll see more nurses who are female than male. Our health workforce is largely female than male. But something happens at the point where women need to get to leadership. And if women do not lead, even in research, then we don't design interventions that suit us, because our products, our drugs, how we design different programs really affects our daily lives, and we're not present in places where those decisions are made. So mentorship, one, but most importantly, sponsorship. That you need senior researchers to mention your name in places where you're not there. You need them to mention your name to funders. You also need them to write grants with you and to teach you how to write grants. What I learned in my few years in research is grant writing is a different language. While you might speak the same English, but how you present a case and how you present an argument for a grant is quite different from, say, how you publish a paper. And those are almost very two different languages or way of writing and expressing yourself. But without these 2 things, mentorship and sponsorship, it's very hard to progress in science. So how I want to pay it forward is I want to be an active mentor. I also want to be an active sponsor. When I was looking at how I got into WomenLift in itself, I was nominated by a fellow senior woman scientist. My first grant application was supported by a female scientist. My second larger grant application that I got in was also supported by another senior female scientist that I would not have been able to get here on my own. And that's the one way I can pay it forward, just support women who've come into science to help them stay in science.
My name is Ines Bouquet. I work as a country director for Chemonics International, and I'm part of the 2022 East African Women Leadership Cohort. I think inclusion has to be really part of all their decision. We need to ensure that there's inclusion across the institution, wherever it's regard to skills and knowledge. Inclusion wherever we are developing like job description to ensure that we actually alleviate all the gap, right, that are around bringing more women in leadership position. Trust, people that has trust in me, put trust in me as a woman. When I talk about inclusion, I would just remember when I got a position and I was expecting. So I was already feeling it's a barrier to me. But then I had a director of the organization who actually made me feel that this is just a condition, right? Not a disease, right? So that trust that people has put in me is what has brought me to be what I am today.
My name is Dr. Jacqueline Kitulu. I am a general practitioner. I'm in private practice. But besides that, I am chair of the board at Rocket Health Uganda. I also sit on several other boards. I sit on the board of PATH Kenya, E+ Kenya. I also most recently sit on the board of Farm Access, and I'm immediate past board member of the Kenya Medical Practitioners and Dentists Council. I belong to the inaugural East Africa cohort 2022. The influence of WomenLift on institutions and the places that I now sit. For me, I think the most important thing is busting that myth that women leadership is just leadership like any other. And that understanding that for women to lead, there has to be an intentionality in ensuring that women can bring the great assets they carry in diversity, in inclusivity, the very many vast assets that they bring to the table, one has to be intentional about that. And many ways in which that can be done. And indeed, even as I think about doing it in the institution where I am, it's in advice that I can give to any other institution where they're intending on having women in leadership. So, of course, there are institutional policies, and institutional policies that encourage women to lead must be in place. Through career progression, through the human resource instruments, there must be a concerted effort to ensure that women have a space in that institution. Therefore, providing an environment in which women can comfortably lead. And that goes back to what I was saying, that leadership for women is different. There are different aspects and things that they have to juggle, and yet we can create a balance and make sure that the environment encourages them to stay in place. Now, moving on to the women themselves, there's also a lot of capacity building that needs to be done. And it doesn't have to cost. I know immediately we speak capacity building, it's always the query of how much is it going to cost? There are certain endeavors which can be done within the institution. And that one major one is mentoring. And mentoring from within the institution or without the institution. And within that mentoring can be both from women who those women who are aspiring to leadership can look up to, women who can mentor them, but in the same way from mentored by men, because we must build male allies. In this leadership journey for women, it's not going to be just about women. We have to have men who understand what the challenges are and are willing to mentor the women, as well as other women lifting up fellow women. The second idea is really around coaching. And again, so for those women who have moved on to a management level, to another level, the coaching experience is a great way of bringing out the best and, helping women achieve their highest potential in leadership or whatever else they are doing. Of course, that has cost implications. Most coaches are not for free, but the value that coaching experience would bring to that woman and what should bring to the table in leadership in that institution cannot even be measured, really. And then finally, there's of course training. Part of the issues that we have discovered and within my project as well was that there are several areas that women feel they are perhaps not very adept at, and trainings which encourage building courage, confidence, public speaking, presentation, and many of these actually can be budgeted into HR budgets for training. So in terms of those efforts around changing institutions, in creating a suitable environment for women to lead, I think even just those three simple measures are good enough to transform the women in the organization and bring them to the table to lead. In public sector organizations, we are very lucky. We have gender equity policy, and all public sector organizations are encouraged in terms of their performance contract that they have to gender mainstream. So already there are even policies at a higher level which just need to be translated into the organization. So that's sort of an imperative in public sector organizations, but can very well be translated into private sector organizations. So the WomenLift Health leadership journey has also provided different opportunities for me. 2 months ago, I had the opportunity to participate in the G20 Risina Dialogues. This is a global dialogue forum, and this was happening in New Delhi, India. In there, I made beautiful connections with a whole lot of other leaders, not just in the health sector space, because again, we're talking about the intersectionality of our leadership journey. And subsequent to that, I have just received an invitation from the Kigali Dialogue Forums. They would like me to also sit there and present. In this same week as well, through linkages of people I've met in there, I have been invited actually tomorrow to speak in an Africa series for Cornell universities about science and policy making. So the opportunities actually begin to grow. And I think that's part of what this journey is, the connections we make, the opportunities that come out, And then the confidence that we build within the program itself, that authentic self that we realize who we are and what potential we want to achieve, I think just opens our eyes to the millions of opportunities out there. The world is there for our taking. The opportunities for women to lead are so many, and you just need to step up and step into that space. Step into that space half ready, a quarter ready, a third ready. Just step into the space, because the support for you once you're in the space is enormous. From women around you, from men around you, the opportunity to mentor you, to coach you, programs like this that just build and get you to understand yourself. There is so much. But I think the first step is step into the space. My favorite food is matoke and groundnut sauce. It has been all my life.
My name is June Musau. I work for the Financing Alliance for Health. I am a country engagement and support coordinator, supporting Kenya and African countries that the organization operates in. I'm very proud to be a member of the WomenLift Health East Africa Leadership Journey, Cohort 2022. Several impact things I see from the women who have graduated today, and most critical is the fact that we have an opportunity to build other women to be women leaders in global health. And so I see us coming together in communities of practice and agreeing on how we are going to work with the women who are going to come after us, how we are going to work with women from other countries that have been part of the leadership journey. And so it is building other women, and especially younger women in the ecosystem, to be the leaders we want to be in health. One of the things I will do, especially in my workplace, is to develop fellow women who are working with me. I know they didn't get a chance like I did when I was nominated to join the program. And so I'm going to pick bits and pieces from the modules that we studied, and I will share with them what I feel is really going to help them to take them to the next level. And of course, I have women who are younger than me in profession, younger than me in the ecosystem, and therefore I'm going to really hold them hands and help them move to the next level of leadership in whatever level they are in, because I'm one person who believes in building fellow women. I really like the mentorship process, because when we began with our mentor, we began with talking about our experiences, learning from each other and sharing our experiences as leaders and the challenges that we face as women leaders in health. And what I like about Professor Harriet is the fact that she used our own experiences, she used our own leadership journey to try and show us that we can actually make it as leaders in health. And whenever you posed a challenge like, I feel like giving up as a woman in health who is a leader, Professor Harriet would always be there and actually encourage us to go for it, because she believed in each of us in that group. And we have agreed with Professor that we can always keep that group and continue growing each other, and she's willing to actually work with us in the journey towards realizing who we are as women leaders in global health. I think what excited me most is the fact that when I first joined, I wasn't sure I was going to stay, because when I looked across the list of other women, I saw doctors, and so I thought I was in the wrong group. But what has excited me is the fact that I've been able to connect with these doctors. I actually feel like one of them. Those connections, the warmth in the group of the cohort.
All right, ladies, I'm going to ask that we settle down so we can begin the afternoon program. I hope that you enjoyed your lunch. I know the dessert station confused us. Great selection, yummy, yummy things.
And you're doing a great job.
Design practical solutions for financing of community health.
All right, please take your seats. If you're out in the foyer taking your selfies, we need you inside.
Looking for your hair. Very good moderation, as expected. So, good job. You make me cry every time. Oh, thank you. Hi, ladies. How are you? Thank you. I'm going to ask that we start going in. I want to
Ladies and gentlemen, I'm going to ask that we settle down. We have such a wonderful afternoon program. I do not want us to miss it. So if you know that you have not yet settled down, please start to do that. I'm going to ask that as you walk into our conference room, please occupy the front seats. Please occupy the front seats so that we have a nice looking backdrop for our photos. And also that you can be closer to the conversations that are happening. We want to begin our program. Our panelists are here. Remember, if you're taking all those amazing selfies, do use our hashtags WomenLift and hashtag EA Dialogues 2024. You can also tag at WomenLift Health. Tag their account so that we can repost, reshare. If you're going to be one of our speakers today or have been one of our speakers, please come and sit in the front so that we can continue to celebrate you and thank you for the amazing testimonies that you've shared. On this side, we can fix the seating situation, I think. I can see bags, so people have booked their seats. This is what has happened. All right. Please try as much as possible to join us in the front. We're going to move into the next part of our program. As much as it is important to wait for those who are on their way, you know, we were talking about leave no one behind earlier. I think they will have to join us when we catch the train. That is the new hashtag, you catch the train. Because our panelists are here and they are ready and I don't want to delay any further. If you've joined us, as we had already begun, welcome to our East African Regional Dialogues for WomenLift Health. We've had such a powerful morning, wouldn't you agree? And I really liked how you were all networking. I gave you a challenge, try and meet 5 new people. 5 new people is not difficult, but think of what that could do to your network. And as Philana told us, If you need to make that call at midnight, 2, 3 a.m. to say, I have my interview tomorrow morning at your organization, you know, when you see me, give me a hug, yeah? Or talk to somebody. Let's be those people, yes, who start to actually implement the things that we've discussed today. So our next panel will be speaking to us about the topic from adversary to ally. And this theme has sort of come up since the morning. People who we assumed were going to be against us or who were actually an obstacle in our career movement, who have then transformed their behavior. They have found the Lord of allies, yes? And this is about reframing harmful narratives to normalize women supporting women. So, of course, while male allies bear a great responsibility, as we saw in our previous discussion, in addressing our gender norms and stereotypes that harm women, we also need genuine support for the women in the workplace. And this can often, as it does, take the form of peer allyship and female allyship. We have a powerful, powerful, powerful panel who will lead us in this discussion. So allow me just to mention their names, and as you hear your name, please come and take your seat. I will ask that you reserve this seat for our moderator. So, Dr. Kaendi Munguti, please come up. Ladies, we normally clap for our sisters when they're coming up. Senior Research Fellow at the Institute of Development Studies at the University of Kenya, better known as our lifelong learner. You remember that in the morning? This is who said it. Honorable Cicely Kariuki, who's the former Cabinet Secretary of Health, but more importantly today, the founder and CEO of Reimagine Impact Associates. Karibu sana. Dr. Sylvia Vito, Africa Head at Eva Pharma International, a dope human being and a good friend of mine, as all of you will be by the end of today. Wouldn't you like me to say you're a good friend of mine? Continue taking selfies with me and tagging me. I will say that you're my friend. Akako Kirapa, Health Team Leader and Health Advisor, Foreign Commonwealth Development Office, Karibu Sana. They will be ably moderated by our force of nature and our host today, Dr. Nora Obudo, East Africa Director of WomenLift Health. Please welcome these amazing ladies as they take us through this session to address harmful narratives about women's professional and personal and interpersonal relationships. Karibu.
Hi, everyone. We have another panelist, so I'll be standing right here. So inviting Dr. Catherine Kyoputangi from APHRC. Please walk right through. Senior Women Allyship. This is a very important topic, adversary to ally, because we've had these discussions around adversaries. I can speak to an experience I felt that I had in one of the organizations that I worked in, where there was an issue that the car you drove became an issue in terms of your engagement, or how you dressed became an issue. And these stories are there. Are these stories there, or they're not there? Okay, do we have mics? Because I need to hear these stories from you people, because you know it's there. So if the mics are there, what has been your experience with senior women, in whatever way you define it, whether it's more than 20 years experience, more than 40 years experience, or your supervisor, what has it been? Because you said they've been that kind of experience. So if you have the roving mics, I just want to quickly get some 5 people to just speak to what it is that they feel that they've experienced. Mics? Anyone hand up to go? Oh, don't worry, the gentleman is there.
Thank you. My name is Brenda Luanyi. I'm the executive director and the founder of a women's rights organization called My Body, My Body. I'll really take back my 2 years ago, that is in 2022, I worked as a programs officer under leadership of a senior woman, of which I respect her. But the exploitation that I went through while working there was not worth the journey. I'll really love any young woman to go through. I wanted to do my master's. She told me, you want to come and compete for my position. So do not go back to school. I will do reports. My director by then will rubbish my work. When I sent to the donor was okay with it. And I was like, why are you doing this to me? Then I left and I started my organization.
Okay, great. And that is her experience. Anyone else's? The mic could go there. Oh, someone, she wanted to speak? Go ahead, and then we'll take it to Caroline.
My name is Nancy. I work with special needs children. So I'm working with special needs mothers. And today I had a conversation. I'm trying to link them with the government, with the stakeholders, with people who can support them. Let them go and work. Let them be professionals. Let them bring those special needs children. But the same women whom you're assisting, they're the ones who will fight you, you know? So you are like, I'm giving you a solution to link you with the Ministry of Health to get free therapy. I'm linking you with KISE. I'm telling you, guys, come. Let your kids be assessed. So what am I saying? We need to support each other. Let's work with this ecosystem. Because maybe God has brought that person at that particular time for you to be psychosocially supported. So that's the challenge.
I appreciate your experience. To Carol, on that end? So we are on the third one, then the fourth and the fifth, yes?
Yeah, my experience is different. I had very bad hyperemesis while pregnant. And so my experience is a support that I got from women compared to men, especially women who have gone through it before. So they helped me cover shifts at work. They ensured that I was not doing those night calls. And they really supported me even in regards to seeing the doctor and all that. So in terms of support from women, I think that's something I'd like to highlight.
Okay, good. And that's a positive experience. To the lady at the back in yellow.
Yes, mine is just two perspectives. A positive one, when I wanted to do a study, there's a senior person I always wanted to meet. I could not manage. But now I met Amanda who told me, that is the only person you want to meet, I'm taking you to her. When I got to her, I was pregnant, almost to deliver. She was like, Lois, you're the person I've been looking for. And that's how I was taken up. Now, another one is a point whereby I was pregnant and I did this interview. So 2 months to deliver, I'm given the job. So the lady in the office, when she saw me the first sight, she was like, how could they have taken a pregnant woman like you? And there were we did interview 3 people, so I was taken up. So she was like, who will work? Thank you.
And the last one here. Oh, would I have? Okay, I'll take one more so that I've made sure that the room has spoken across all.
Hello, I'm Melissa. I'm in global health. I've had the privilege of working with very supportive women in my career journey. And I think one of the key things that I've taken away is how to give feedback. And my senior expert, let me just call her that, used to say, Melissa, you know you got this. You got this, Mama. You know how we do it. She'll give you very good reviews. Then she'll tell you, by the way, we need to work on 1, 2, 3. Some of the things that I still carry on as I go on with my career journey. Thank you.
And that's a good way to take feedback and give feedback, because there's been challenges in how, as we had this morning, how feedback is taken. Lady in blue.
Good afternoon, everyone. My name is Kaltum Abdallah, and I come from a very distant country, Sudan, a country that is at war currently. I would like to share my experience with fellow women. I came to Kenya in 2005. I literally grew up here. And honestly speaking, I have just come across nothing but good women in my life, all through my academic and professional life. And I would like to mention one of them. She's late, Madame Ogada. I met her in secondary school, and the first time she looked at me and she said, "Where did I leave this daughter of mine? Where did I give birth to her and leave her behind?" And right from there, she picked me, and she empowered me, she nurtured me, and later on I became a peer counselor. And currently I founded an initiative, a refugee-led women organization that is empowering fellow women and girls in the refugee camp in Kakuma.
Excellent, passing it forward. And the last one, the lady in red.
Good afternoon. My name is Elizabeth Oluoch. I work for Mildme International Kenya as a director. I just want to say I'm proud today to see one of the people that really shaped my leadership journey standing in the podium. Dr. Noro Budo used to be my boss. And if there is one boss that I am grateful for my growth. Right now, I'm a country director. Those days, I was a program officer. She mentored me, she pushed me, and I'm excited to be where I am today, but I'm proud to also see you there. Thank you.
Thank you. That was not expected. I was waiting to hear about this really not nice bosses, but anyhow. I will start the questions then. We've had the experience, there's been bad bosses, those who are not pushing you forward, are suppressing your movement or not guiding, and those who have been ready to guide, give constructive feedback in a very nice and structured way, and so it was not taken positively by the receiver, and so it's not taken that it's a competition or bringing someone down. And so I want to ask the first question to all these panelists. Are women really their own worst enemies? And what is the genesis of this narrative? So I will start with Catherine. Oh, Mike. You didn't have?
Thanks a lot, everyone, and thanks, Nora, and thanks for the opportunity. And I heard the feedback from the audience, and it really makes me sad that this is the reality. So I can't say that the narratives are false. I think what I can say is that the narratives need to be a bit more nuanced, because I don't believe that men behave better than women. They are nasty men, they are nasty women. I think that's my firm belief. And as you've heard, there are good women bosses and there are bad women bosses. So the source of the narrative, I think you have to ask yourself, the reason it's called a narrative is because it is formulated, framed, perpetuated. And you have to ask yourself, what is the origin of the narrative? And you've heard the story that as long as the hunters tell the story, then we always assume what happens between the hunter and the hunted. So the narrative is formed and framed, but it's true. What I would say is that in many instances, we expect individual women to navigate institutional and cultural systems and sort of be this person that managed to navigate whatever toxicity exists in an environment. My belief is that women bosses are toxic in toxic institutions. If the institution is not toxic, I don't think one woman will be the only person that is toxic and everybody else is nice. So institutional systems, institutional cultures encourage certain behavior, and women are in the same system. So they behave in ways that are normalized and perhaps accepted in the institutional setting. Because if you have a toxic woman boss, chances are that there are many other toxic managers in the same institution. And so it's not that she's unique, it's just that women are put under a microscope, so when they behave in certain ways, then I don't think there's a saying that men are their worst enemies. So it's like, yeah, we need women are their worst enemies. So of course it happens, it's true, but I think we should look at the systemic and institutional systems and cultures that enable such behavior to be perpetuated, rather than expecting this Herculean task of individuals surviving in a toxic environment and behaving differently. Yeah.
I will let Dr. Kaindi come in later, and Honorable Cicely. I'll pass that on to Akacho and what her thoughts are around that.
Thank you for that. I think for me, I was going to say, yes, it can be both men and women, because I think we develop that narrative based on what we had in the morning, that if a woman attacks me or gives me feedback, I take it so personally that I will carry it with me forever. Then I come up with that story that women are bad. But now if I had a male boss and he told me the same thing, I would take it positive leadership. And so I'd say, yes, we are the ones who have perpetuated that narrative because we are also the ones who don't prepare. I mean, we're not saying it's easy, but you have to prepare, especially if you're trying to get a good job or traverse to the next level of leadership. I don't think you can just go there because, oh, you're pretty or you're beautiful. You have to go there and do better. I mean, I think that's the advice I've been given, that you have to accept also that people see you as a woman. That one I know you may not see yourself as a woman, but people see you as a woman. And because of that, you have to really come prepared. And I think also, maybe to give grace also, maybe to those women leaders. I think as I'm also in this space, I'm learning that you may meet, for example, I may meet Nora today. She's in a good mood, she's looking beautiful. But what if she's having personal issues at home, I don't think me as the junior, I look at Nora as maybe a mother, as a wife, or as a friend even. So I think at times we should also extend grace to the leaders because we have to face it. The woman is carrying very many hats. She may be your boss, but she's also dealing with issues in the house. She's also maybe taking care of sick people. She may also have a different job in the evening, you don't know. So I've had to accept, I think, yes, we have the narrative that we are our worst enemies, but we can also be each other's best friends. Yeah, thank you.
Thank you so much. I'm seeing us talking about system issues, toxicity that will actually position a woman to behave in a certain way, that not necessarily that she's being, not an ally to others. And I'm also seeing the addition on empathy that we need to have and giving grace to each other. Sylvia, what is your take on this narrative?
Allow me to take the contrarian view.
Yeah.
I am sick and tired of the narrative we are our own worst enemies. There are bad human beings in this world. So when a woman is being bad, she starts by being a bad human being. Those days of saying, because the woman has failed, all women have failed, I'm tired. I don't even give it the microphone. I don't augment that story. I take it that if Sylvia has failed, she has failed first, and what do we learn from it? Instead of sitting back and saying, see the women, see what they're doing. We have to be the ones who stop that story. We as women leaders who look up to others and who have others looking up to us, let's remember, you come to the table as humanly possible as you can, bring in your core competence, do your best, come with the good human values, which is integrity, goodness, humanize your leadership. Then your femininity will be able to be the second thing. Because I think for a long time, there's an expectation because you're a female leader, there is a way you should show up. And yes, we've got to be conscious that there's a second layer I need to add on as a leader who happens to be female. I need to be sensitive to the needs of my people, both male and female, but more so the women who I work with. But that being said, if I sat with a colleague who is a peer and I got feedback, even if she was female, I'll take it that I'm being given feedback by our colleague first. Because then if you wear the lens of, oh, how can you be a woman and you give me this kind of feedback? Yeah. Who else do you want to give you that feedback? So that's number one. Let's not give this narrative the microphone. We need to dial it down by stepping up our excellence. Because we are leaders of excellence, we empower excellence, and that's what we are bringing to the table. Yeah. When we fail, and we will, human beings will fail, let it just be that. Failure is failure. You learn and you move on. Don't stay stuck in that place, or she failed or women failed. It just so happens that we also need to be cognizant of what you call the glass cliff, where there'll be certain roles that will be given to women because you're like, she can take it, and if she fails, this is how society has framed it. You will hear now the stories coming out around how we are failing to do certain things. So be conscious of, if you take a particular role, reflect upon yourself and see, do I have what it takes to win? And if I don't, where can I seek the help that I need? Otherwise, if I fail, I have failed first as who I am, and I should not drag down the entire women and women in leadership that we're actually not good. So those are usually my perspectives, and whether you meet good bosses, bad bosses, they're human first. So let's humanize leadership then as women, let's wear the lens of being cognizant. What are the unique differences that we bring to the table? What is the consciousness that we need to have? Because we'll not be treated the same way as our male counterparts. So please, just the consciousness is what I want us to focus on and dial down that voice of we are worst enemies. They are bad people, and some of them happen to be women.
Thank you very much. Powerful. And so then we come into this space because we have Honorable Cicely and we have Dr. Kindly, who have grown in their careers. So these are the senior women, and I'm sure you are very few. What was your experience around that?
Thank you, Nora. Let me take this opportunity to just say that I'm very pleased to be here today amidst the generation that is going to quieten the negative narratives around women in leadership, and in particular, leaders in healthcare who happen to be women. If you think that sitting in cabinet or rising to sit in cabinet exonerates you from being exposed to these negative narratives, you're wrong. Because they're as real as we are human. You will find a woman who happens to be a leader, who isn't necessarily the best example for various reasons. The societal context that we find ourselves having grown through, the lean mentality of how competitive, especially the workplace is, and therefore once I sit there, I have to defend my space, as my young sister here has said. And so it is real. Is it the norm? No, because there is an equal measure of perhaps twice or thrice as many good leaders who happen to be female or women who will hold you and get you to the other side. So what we do, now that is a reality, one is to be aware that it's real. It's documented, it's researched, it is practical, and if you happen to be in the public space where I've spent most of my time, it is twice as prevalent, because that is where, for you to get there, there are 6 of you in cabinet, a cabinet of 25. And so you begin to say, once I sit, I am welcome, so I will sit. I don't want a young one coming near me. So what do we do now that is a reality? A couple of the discussions and points that we'll be sharing going forward, but for me, the most important one is that let's appreciate it is there. How do we deal with the reality? Part of what it is we'll be discussing, including how do you become now your sister's keeper? How do you create networks? If you're in a place of privilege, how do you use the privilege and the power that has been given to you to develop the next generation without seeing them actually to be a threat, but seeing them like a teacher? A good teacher will say, I am teaching you so that you can grow beyond me. As my daughter, I am teaching you so that you can go where I never managed to reach. So we need an entire mindset shift. And we can only get there if we are self-aware. And that is where, once I left the bureaucracy, personally, I thought my calling was to go and learn a little bit about emotional intelligence and the space of emotional intelligence, leadership, and especially women. So that the more aware you are about you and the environment that you're operating within, the better you are prepared to be able to respond, and not to blame, but to respond and being a solution finder. Thank you.
Thank you very much, Honorable Cicely, for that. Kindly, over to you.
Yes, so I'm also happy to be here this afternoon. Let me begin by saying that let me tell the young people here, because most of them are younger than me, that it gets better.
Yeah.
It gets so much better. Yeah. In fact, I was telling a colleague of mine, when I've had a bad supervisor or leader and they are a woman, most of the time I never stop to think, oh, this person is being nasty to me because they are a woman. I always think like, this is a bad leader. And so when you get there, that is really, of course you have to get to where I am to get there. But when you get there, that is really the epitome of the appreciation, as she said, that definitely we live in a context, that there are social norms, as we saw this morning in the discussion. Some of us grew up in times when being where we are today was not expected. A village girl in Makueni in the 60s, growing up there, how do you get to sit here and talk about your experience? But we had allies and we had people. So let me just assure you, it gets better. Don't worry about it. I think she has said, drop the mic, drop the mic. A bad leader is a bad leader, whether they are male or female. But I say this, one of my biggest beliefs is the fact that to those who much is given, much more is expected. Yeah. So if you have that opportunity, and I can say here proudly because I can see Dr. Musuva, I met other people here who I've worked with and they said positive things about me. When you are given a responsibility, when you are in a position of leadership as a woman, then it behoves you to be that person who lifts others and ensures they become better than where you were. So for me, I want just to say I concur with the conversation. Let's drop the mic on this thing. It doesn't matter. We know so many bad men leaders. Why are we worried about bad women leaders? Any bad leader, I agree with you, is a bad leader. So don't worry about it, but believe me, today I had an epiphany, that awakening. I told somebody, how is it that all these women who have been my supervisors and have behaved badly, I have never even paused to think that they are women. I just thought, you are just a bad leader. This person is not sensitive, is not self-aware, is not supporting both men and women in the workplace. So for me, I want to say it does get better, and any leaders who don't lift people, whether it's the woman who put you down or a man, is really a bad leader. But also let us be accountable so that the people we work with, and especially young women who we have worked with, can look at us and say, wow, I'm so proud to have known that person. So that's what I would say.
Excellent. Thank you so much. And we're hearing it from the senior women, and I'd really like to bring you back into that conversation around the institution. And so when a young woman finds herself in that kind of space, if you're a senior woman ally, what would you do to support a woman in such a toxic environment? Because they still have to navigate. So what would you advise the young or the mid-career woman to navigate? I guess bad leadership, whether male or female.
Wow, that's a hard one. I'll give it a time frame. There's time t is equal to 0 when we get this situation, and then we have to ask ourselves, are you going to be in the same place time equal to 5? Maybe whether 5 is 5 years. So I think ultimately, institutional cultures are a function of how individuals behave. Culture are the things we do over and over again until they become the norm. Therefore, we can do different things and create a different culture. And when I say we, I mean every single person. So if I'm somewhere in the middle and I encounter this person, I have to ask myself, who can change behavior and what behavior can they change? Mm-hmm. And then over time, if everybody is behaving a certain way, then you create a completely different culture. So if there's a toxic culture, I think it's important to say what toxic is an interpretation. What is the behavior this person does? Do they shout? Are they dismissive? And then figure out ways in which that can be communicated, supported. So those little cumulative behaviors start changing. But of course, ultimately, I have a firm belief that our problems are our problems. And there's no fairy godmother, godfather who's going to come, swoop into an institution and change it. Mm-hmm. And therefore, I think what you're saying, once you occupy a position of privilege, you don't have to be at the top. That you have to ask yourself, what are those things we can change? And to recognize that constantly, that there are things you as an individual can change. Do you have a policy on harassment? If you don't, is it impossible to ask, why don't you have a policy on harassment? And make sure that there's a policy on harassment. Is it impossible to do that? If there's no policy on XYZ, is it impossible, wherever you sit in an institution, to say, why don't we have this policy? And can we have this policy? Maybe it's impossible for you, one person, but amongst all your colleagues, there's that one bold person who can always be the spokesperson and say, we need a policy on harassment. And once it's there, then, So our problems are ours to solve. And some of the problems are created by the things we do every day, the way we behave, and we create an environment that now, in the end, becomes normalized, and everybody becomes a victim or a beneficiary of that.
Mm-hmm. Thank you very much for that. And I'll then circle back to Cicely on this, because you have more than 3 decades of experience in public and private sector. and you have most recently begun your work as an executive leadership coach. So how have your experience in male-dominated, which you have been, spaces influenced your views on allyship and women supporting women?
Let me say that the difference between being in the public space and the private space is really minimal when it comes to women leadership, because they are few in whichever case. But I have seen deliberate action and interventions on the private sector. I guess there is more flexibility than there is on the public side. But I've also seen resistance in terms of, bringing in new formulations of doing stuff in the public space, as it were. But I can tell you, in whichever space, you are not immune because of the realities of what it means to be a woman in leadership. Very competitive environment, an environment where, indeed, in my own case, it came down to me documenting it in a memoir, Breaking the Illusions. Because Breaking the Illusions tells the story of Cicely Kariuki all the way, because in the public eyes, and particularly the eyes of men, you ain't good to take on senior leadership position as a woman unless even though you are as competent as the men next door, they will be the first to get the position. And you only get there because you are associated with so-and-so, that big family, that tall man, that, you cut the corner. And therefore, you are not immune. And so I told my story through documenting, so that if I'm not able to reach the next Dr. Koi, you know that it's coming your way. If you haven't arrived there, then you haven't led, because it's coming. But the beauty is that the voices are becoming many, louder, sustained, consistent. But perhaps because we still have a long way to go in terms of getting to the point of gender parity, we got to change the formula somewhat for us to say, what else do we then need to do to accelerate, to have more voices that are consistent and louder? And therefore, the experience is really just what we are going through right now. It just happens that we are many in the room. But I was just going to cycle back and say, when we talk about a female leader who is wanting in terms of a bad boss, it takes the women around that leader to actually poke them and say, how did she get here? Who does she think she is? So it really takes the environment, and therefore the more we can be in terms of the takers of the advice and the experience that we are, and us on this side with the experience that we have lived, the better for us to converge faster and in a more certain way, so that then we take off with the critical mass that we require.
Thank you. And this is around, again, how women are surrounding each other. So I want to ask Sylvia and Akacho as well on this. In the positions that you are in, how do you think women should surround or come or support you? Or what are you expecting from the women in terms of how do we move together as we go upwards?
From my perspective, number one, let's humanize leadership. And I've said it again. Remember, you're human. You have your vulnerabilities. At any senior role or even non-senior role, allow yourself to be surrounded by people you can be vulnerable to, because you're going to struggle with one thing or the other. I'm a mother of an autistic child. I'm a single parent, foreign, and all those things. I'm a senior leader. I can't do it all. I need a network of women that can support me. I start by being vulnerable to my nanny at home, so she understands that what she does for me enables me to show up at the workplace. Anyone at the workplace knows that I will not show up before 9 o'clock in the morning. And when I show up at 9 o'clock in the morning, it's because my work started at 5 in the morning with my children. I'm not apologetic, but I have an ecosystem that understands my sessions begin after 9 o'clock. I'm not going to show up at 7 o'clock. And I will not take a meeting at 6 o'clock in the evening because I want to be a mother. I believe being human and excellence that I stand for is excellence as a mother, as whatever else it is as an employee. So I've set up systems in place and I've made it clear to anyone who is my peer, my colleagues, and those who work with me, before 9 o'clock, after 6 o'clock is a no-go zone. And things work. As long as I deliver excellence, it's how I deliver. My unique strength is in how I deliver. I'm not there to tick the box for anyone. So that's number 2. You need to allow yourself to have this ecosystem of also other women and men who will call you out when you're nakedness. When the emperor is naked, somebody has got to be able to tell you, here, Sly, umechoma picha. They can be women, they can be men, but you've got to be malleable and open to support and feedback, because all of us, we are human first. You're going to struggle with one thing or the other. So are you the type of leader that does not listen, that does not take feedback, that does not allow themselves to fail and even to succeed at the same time? So you've got to also have this cohort of people who will cover your nakedness, because sometimes, more often than not, I get into a job as the Africa head for a manufacturing organization. I've never manufactured shit in my life. Forgive my French. But I know how to lead organizations. So the first things I do is surround myself with people who've had the core competence in manufacturing in Africa. They happen not to be from Sub-Saharan, but I spend time learning because I'm not going to let down this continent. So they say that, oh, the other narrative you hear is that Africans can't do it. So it keeps moving from one level to the other. So you've got to surround yourself with the group of people who are going to help you show up as a competent leader, show up as a competent employee for that matter, show up as a competent mother, as a sister, whatever it is. You must allow yourself. You must also, humanizing our leadership is about our storytelling, and I think Cecilia alluded to it. Let's share what it has taken. I spend time with young girls in a school called Daraja. We build a program called WISH, Women of Integrity, Strength and Hope, just to tell them it will not be easy, but you can do it. So we come in and we share our stories so they don't think that excellence falls from heaven. Excellence comes through failures, through struggles, through success, through small wins and big wins. But if you don't share these stories, when will they ever see what leadership looks like? Leadership looks like I lose my cool, I'm menopausal right now, sometimes my moods are off, and guys know, oh, you need to back off. But they know that it comes from a good place. Yes. If I'm in the office and it gets hot, I take out the fan and I'm done with fanning myself. I'm like, can we increase the AC? Because a few of us are on the other side having climate change. But at the same time, I also encourage intergenerational support. I look out for the younger girls and say, they're in the way of the family way. Can we create environment that allows them, number one, if you've just delivered, you can't go out of station, I allow them 1 day in a week to work from home. But you're working. So maybe it's your periods that are disturbing, whatever it is, but you need a day where I can work and no one is on my back. So that is what humanizing leadership is. There's no one-fit-size solution, but ask yourself, as a human being, what would you have wanted done for you as a mother, as a sister, as an employee, as a leader, as a change agent? What would make you thrive? And put the shoe on the other side and be human to the person next to you. There would be women and there will be men at the same time. That is how we win this game.
Mm-hmm. Thank you very much. Akacho.
Yes, I think based on what she has said, I think we really need to clap for ourselves today. I think this is amazing, just seeing this group here and having such brilliant minds in one room. I think we've not had this, I can't remember the last time I saw brilliant women like this, so well done. I think what I would also like to say is all of us who have been here, we have been through the journey. I mean, I don't think, people like to look at us and be like, wow, I want your job, and people really admire our titles, but we have really worked, to be where we are. We have cried, we have been through pain, we have had people telling us we're useless. I even remember being told, someone was telling me I had faked some work I had done because they couldn't believe that I'm the one who did it, So we have gone through everything, But I think, like Sylvia has reminded us, we remain grounded. And your grounding may be, going to the village over Christmas. You need to ground yourself sometimes. I think for me, what I do, I'm actually a mental health champion. So sometimes I actually go back to the community. I'm quite a keen person in the environment. So, and I can see my mentors here, my mentees. I've really been sharing with them about mental health. Yeah, so I would say also what we, I guess, as leaders also expect from you is, one, show up. I think that has been told. Secondly, I think also do it afraid. I don't think everyone talks about how scared most of us are. I mean, for me, fortunately, I started doing public speaking when I was quite young, but public speaking is the second most scaring thing after death, for those who don't know. So you can imagine, if sometimes you have to put yourself out there. You may have a soft voice, you may not want to be seen, but you have to talk. I know we've also been told, how do you show up? Sometimes showing up is actually just being there. You may not even have to say something, but the fact that somebody has seen a woman in the room, you're representing all the women you see here. Secondly, understand personalities. I think that's one thing I've really come to understand, that we're all different. Some of us are very loud out there. Some want to be more quiet, introverted. But doesn't mean that introverts don't work. I think that's a misconception we have, that, quiet people are lazy, or quiet people. But, to Sylvia's point, maybe this person is really going through a traumatic time at home. As much as you're the leader, find out about your team. Find out people outside of the office, outside of work. For those who are able, you can also do team building. I'm lucky I work in a place we're able to do team building. We even have days we actually go out and bond as a team. So those are things I recommend. Get to know the people in your team or the people in your workplace. And then thirdly, also work on yourself, you as a woman. Of course, we all get tired. We are also encouraged to take our days off, whether it's that day off you're saying, or if you just know you cannot meet people, you have that liberty. No one is forcing you to meet people when you're in a bad mood. Or also, you can also delay. Sometimes when you have to make a decision, you can delay it even if it's for an hour or two until you have sound mind and can respond, or consult. I think we've all accepted we're not all experts here. You'll always find somebody. I think when I also started working with the government, I was told, there's too much information, but there's someone who knows the answer. So go look for that person and humble yourself. At times it could even be like an admin person, someone you think is so junior, but humble yourself, talk to people, and remember you'll always find yourself down there. I don't think people are always living high in the sky, You'll always find yourself humbled at some time in life. So just ground yourself and, remember the girls who are also looking up behind you and the girls coming after you. Yeah.
Thank you so much. Thank you so much, Akacho, for that. And at this point, I'd really want to welcome the voices from our audience. If you have any questions to our panel here, please say who you're directing the question to as well. And we address it. So mics are everywhere. We can ask questions around how
Nora,
senior women come
just
through.
a small comment as we wait for the questions from the floor. And this goes to the Fourth Estate. June, where are you? And the friends from the Fourth Estate.
Yeah.
I think a lot of it is, what stories do our younger sisters and brothers read about leadership? I remember this because the media is very guilty of perpetuating what they want to perpetuate. So we have to be intentional that whatever is being written, are we going to be the masters of this story? Can you ensure that at whatever level you are, you're influencing what the media is putting out there? Because if you leave it up to them, they'll augment. Sensational stories are the ones that sell. The failure of that, and you'll hear, hey, another woman, whatever.
Going down.
So I think the media plays a very critical role in terms of shaping the narrative. But we need to be a part of that. No longer are those days that for you to be in media, you've got to be trained. You are a master in your own field. Show up. When they want people to speak, show up. When there's something great that you've done, or a big achievement, or a big learning the organization has gone through, get them on board and let them tell this story, because they can reach more people further. I remember when Top 40 Under 40, it happens every year. And I was tired of reading the profiles of the top Under 40 women. They're all corporate this, corporate the other. And I said, there are girls and women who are doing amazing things in the slums. I spent time in Kibera and Mathare. And I took it upon myself, called Nation, and I told them, I have a candidate, I need you guys to interview 4 ladies in Kibera and Mathare. They're doing amazing stuff. They're building toilets. When you're telling us about corporate jobs are the ones which are changing the scene of Kenya, these girls are actually building toilets and making a difference. And eventually, One of them got nominated to 40 Under 40. She's called Winnie because she builds ablution blocks in Kibera. She works in Mathare to encourage and protect young girls from early predatory sexual activities in the slum in exchange for money for pads. So we need to augment this. Otherwise, if I sat back, who would tell Winnie's story? So let's be a conduit to work with the fourth estate. Let's give them the content that they need so that these stories can go further. I just thought to throw that out there.
June, you have the right of reply. Thumbs up. There you go. Any contributions from the panel on that, or we can move to the questions here? Cecily.
Nora, I couldn't agree more. And I do think now the media has actually come to your phone. It's on your laps right now. So we ought not to be even fighting for space to go to Citizen TV to tell the story of where we are at. Let's not run away from social media, a very useful tool, but all the same, a tool that is also being used by people who want to misbehave. But if you flooded that, every day you are saying something positive, we'll be able to kill the narratives that we really want to kill. Thank you.
Thank you for that. Questions from the panel to these women? Wow. Let's start from there. Mike.
Thank you very much for that very inspiring talk. Mine is just a concern as women, mothers, and everything else we are in the society. The issue of work-life integration or balance. Sometimes it has been seen that the women who get to the really top levels are the ones who sacrifice 5 hours every day, go home very late, come to the office 3 hours earlier. Some of us are still nurturing small babies. We want to be up there. How do you balance that? Maybe from your wisdom, we'll be appreciative of that.
Great. You'll decide who takes that up. Next question.
Good afternoon. I'm Sharon Jessica from Kisumu County. My question is that as a modern woman, we are really trying to bring women into the leadership space. But then we have other women, the older women, who still have the culture that the modern woman is being too much. FYI, I'm a feminist, and I really fight for women to be in these spaces. But then the older women, some still feel that we are being too much, we are saying too much, we are being too tough for this generation and for the men. How do we deal with this?
Good. All right.
Thank you so much. Good afternoon. My name is Catherine Chacha, Women in Global Health Kenya. There's a study we currently did on state of women in leadership in 3 countries. That was Kenya, Nigeria, and India. One interesting factor was most of the women that were interviewed in Kenya, and they were in leadership spaces, they did not understand the policies or guidelines or structures available that can protect them. So how do we encourage, because even at the highest level, we have a gap where women do not understand. Like example, the sexual exploitation and abuse issues, they do not even understand there's something there to protect them. So as women leaders, how do we come up to strengthen such things to ensure that we know what protects us and what we can be there to talk about? Thank you.
Okay, let's start with that set of 3 questions. One around work-life integration. Who would like to take that? Kindly would take that. And then looking at being a modern woman, you're being too much ambitious. Cecily will do that one. And the next one is, how do we encourage women to, you have a challenge, there's a policy to protect you. You're not even aware of it, so how will you engage it and use it to support you or, address a challenge you're facing? So, Dr. Kainde.
I think everybody has alluded to this since morning, really. The whole expectations and you telling us about setting boundaries for yourself when you show up for work, working sometimes remotely. And it's not even just the experience of being expected as women. There are women who are single mothers who have to go through this experience. I think the point you're raising is a concern for many of us because the expectation is that you should succeed in spite of or despite of everything else that's happening in your life. But I think what is coming out today in the morning discussions and the conversations here, if I talk for myself, for example, for the longest time, I have been a teacher, a professor at the University of Nairobi. I've worked for USAID and other organizations where you are expected to do certain things. But I think, again, the point is that the expectations will always be there. But again, we should not, for me at least, I try to set boundaries, as you have said, and where necessary, be able to explain yourself if you're not able to do certain things because of family commitments, bringing them up. Will they always be respected? Maybe not. Will people see your pregnancy as a negative thing towards your career? Why did you employ that pregnant woman? All these things are always there, but I think we all have the ability, and especially for you younger women, to look at those of us who have gone before you and really learn from those role models who can be able to support you to say, this will always be here, but it is possible to try to find that work-life balance. Will it maybe tilt more towards work? Maybe. Will it tilt more to life, to your family? Maybe. But you have to find what really works for you and your family and also your career. I don't think there is a perfect answer in terms of how do I say I'm balanced 50% for my work and 50% for my family. It's really finding what works best for you. So that's what I would say.
All right, Dr. Catherine has an addition.
I wanted to chip in the work-life balance is. In my culture, they say that work never gets finished.
Sorry?
That work never gets finished. So don't try to finish work. When you finish work, there's more. So just like put it in your head and know you cannot finish work. Yeah. That's the first thing. The second thing is that there's a concept of task shifting, which is much more common in the healthcare sector, but it's to focus on the things that only you can do, and then find somebody to do. If somebody can do something, there's no need for you to say, this is my thing and I'm going to to put my stake and it's my baby and I'm going to hold it very tight. If somebody else can do it, let that person do that. So you progressively cascade responsibility. The key thing is to ensure that at every level, if somebody is taking up high-level tasks, then there's somebody who steps in. People keep stepping up, and you ensure that all levels are fully staffed so people can take on more responsibilities. But work-life balance is a cultural thing, and I'll just give you my own example. We stopped emails after 6 o'clock and on weekends. I don't receive any email from 5 p.m. on Friday until Monday morning from any of my staff. None. Mm-hmm. That's a cultural thing, and it's a choice. The only emails which come in are from partners from the east coast of the US, wherever it is. For them, it's not yet 5 o'clock. But I don't receive any emails the whole weekend, and I only get emails on Monday. The second thing is somebody said, emails actually are the things that almost kill us. They said they went on holiday, and they said all emails that are sent during this period will be deleted, and any important emails should be sent after the holiday.
Back.
And then they forwarded all these emails to a folder. And then when they came back from holiday, they waited. They found 2,000 emails in that folder. And they waited for the important ones to be resent, and only 12 were resent. So they deleted the rest. So I have about 3,500 emails, 35,000 unread emails, 35,000. And the sky still rises and sets. Because, yes, some of them are like, hey, somebody, oh my God, this is noted. All of them are there, noted. These are the 35,000. So it's the thing like, I don't have to kill myself. I have to pick what is the most important email that I need to respond to. And then the rest, if it's really important, it will be sent again. If it's really important, maybe the second time. If it's not sent the third time, maybe it's not that important. And then we'll see what rises and falls. It's very basic to frame it that way, but really you have to understand what is the most important thing that only you can do. Focus on those things. Find people to do the rest. Delegate, empower. Show up the structure so it doesn't collapse and all the work is being pushed downwards. And then set boundaries. I think somebody talked about the boundaries. Set boundaries. I don't respond to emails on holiday, not one. And I come back and I still lead a thriving, amazing, successful institution. So it's possible.
Thank you. Thank you. Boundaries, I think, is what we're communicating. To the second question, Honorable Cicely.
Thank you. Let me chip in on this one because there is no one size fits all, really. I mean, you want to be a cabinet minister responsible for matters health, and you know that, the call will come through any time that there is a fire in Gikomba, And, so no one size fits all. I think what we are doing here is sharing the journeys, depending on the environment that you are in. But in my experience, quitting is also an answer. Because if you're not...
Quitting is an answer.
Quitting is a solution, because if you're in an environment that you are not able to get the balance, which fits within your value system and what it is you aspire to be as a leader, really, it's not death, right? Yeah, I have jumped out on 2 occasions because, this is not the space. And therefore, while I'm not encouraging you to quit, it's just that sometimes you cannot move the mountain, depending on the culture you find, the environment you are in, and therefore quit, and the next job will be waiting. But let me also say, here is where the conversation below the technical knowledge that you have comes in terms of your ability to negotiate pacts that help you to balance. This is where conversations around delegation become important. Get yourself an ecosystem that gives you a support network that will work for you, so that when you really must be on the other side, attending to a sick child, work is going on. I do recall a female boss. She's in the category that this lady spoke about once upon a time. And so I was called, and my son was being rushed to Gertrude because he had had an accident, hyperactive. And here I am busy doing stuff that was quite urgent. Can I go to my boss and I say, you know what, sorry, I'm working on this press release. I must stop and go. My heart is out through the mouth. And she said, no, how are we going to do this tomorrow now? Just finish. Baby will be fine. That is a place you quit.
Yeah.
And
100%.
particularly when it's a woman. Yeah. This is where we learn the issues of prioritizing. And this, I think, is what my sister here has alluded to. And therefore, there are many options for you to be able to maintain, because at the end of the day, it is you we need as a human leader. It is not the structure, it is not the organization. But here, again, is where you come in to be part of creating norms and standards in the workspace that respect and give you a chance or a semblance of balance, unless you're in cabinet and you're the Minister for Health. But let me come back to the second question from Sharon. The old people from Kisumu all the way, and it's the same in Embu where I was born. The old people, and you should have added some or most of the men, think that you're being too much, because they would want us to maintain the status quo in terms of being within a patriarchal structure where 70% of everything goes to them. And therefore, you pushing, there will be noises and narratives telling you, hey, stop. Where I come from, they say, don't come too much like a teacher. Usikuje sana. But who set that standard for you when you come too much and when you don't come too much? Who set? The same society? And therefore, as we were all growing up, the unconscious bias, the stereotypes of where the woman belongs and where the man belongs keep giving us some echoes in the background. And therefore, the onus is on us as leaders who have been privileged to go through school and to be employed to help break the stereotypes and this bias. My mother, 2 years ago, I went off, resigned from cabinet office, went off to run for an elective office as a governor of a county I love. My brother was running as a deputy governor in another county where I was born. My mother, who is over 90, decided to dedicate her prayers for my brother. And so when she called me, she had a problem, because she said, I don't think we took you to school, so you, 1, resign from cabinet. Number 2, compete with your brother, who is a man who should be going into politics. Number 3, I don't think we took you to school to be on those podiums and those tracks making noise like you never went to school. And I told her, dear mom, I'm coming home and we'll have a conversation. We had a conversation, I traveled up country. And I told her, you know what? If women do not sacrifice and offer themselves to change some of what's happening in the governance spaces, particularly in politics, never you complain about your grandchildren not having a job. And she said, oh, you mean that is what it is? And I had to educate her all over. And by the time we were done, she said, aha, I'm convening a prayer meeting for you now. So I'm in this season where she's praying for me every day because she saw it from another angle. Sharon, what am I trying to say? Sit with this, your grandmother. Let her understand. Time is gone when the women belong to the kitchen because of obvious dynamics. Let her appreciate you're equal to the boy. Let her appreciate, in fact, you have a better opportunity to change her well-being and that of your village in Kisumu if it was you today being the governor or the CEC for health responsible in that space. Let her see. She may not understand the statistics, but use the statistics. A woman leader is able to see and deliver much more than my son, who I'm very happy with, for obvious reason, and it's documented. It's very documented. He's given me 2 grandchildren, so I'm very happy with my son. And so am I with my daughter. So I think it's a conversation that we need to speak and speak and speak. Like a broken record, speak some more. Mm-hmm. And here is where the media conversation also comes in. Thank you.
Thank you so much. We will get to the last question. And because of time, then I'll ask you for your parting shots. And we can continue conversations beyond this. Because of time, we must be sensitive to time. Because there are workshops that are supposed to take off from now on. So last question around women who do not understand policies that are there to protect them. How do we get them into the space where they know that these policies are to protect them? Akacho, you want to take that? Or yeah. Sylvia?
I can take it, yeah.
Sure.
So firstly, I would say, I think the point about speaking, the places probably where we have those policies around sexual exploitation, I think one, we need to strengthen awareness, because I think from what you've said, it's evident it's not open. For us who are UK supporters, in the UK, it's a very big, you can even lose your job. It's a very big, serious issue. And we actually even do due diligence until the partner level. And so I think maybe a challenge we can have here also for our government is for us to probably sensitize more about our policies around sexual exploitation. I think there are very many women leaders here also. You can talk to us here on the panel, the other alumni who are also part of these global institutions where we have, we call them SEA policy. And also, I think you also need to document. Sometimes the organization could do it anonymously or through HR, assuming the HR is objective. But I know in cases, if you feel like you're not comfortable to go through the HR, there are usually committees, we call them safeguarding committees. So those safeguarding champions are able now to document your case, and then it can be escalated now to more serious disciplinary areas. But yeah, happy to discuss further for more details.
All right. Because of time. Or it will be brief, Sylvia?
No, I was just going to say that encourage a speak-up culture, because sometimes policies are only limited to the reality of that time. Mm-hmm. I work with a very young group of people. Half my team is between the age of 23 and 27. So the policies that were set up by somebody who was in their 50s might not be applicable to them. So we've got a speak-up channel where they not vent or whatever. You speak up, what do you think needs to be done differently for you to really have a better quality of life as an employee within our organization, and whether you're young or old, all alike. And we go through the speak-ups to inform our new policies. So this is intergenerational engagement in policy shaping, which is what we try to do, because we are cognizant some of them are really outdated. So spend time. We call it going to listen to the sound of the river. Go there, spend time with a critical mass of your employees. And if they're all young, spend time with them. And if they are not, spend time with the youth of this country. We spend a lot of time in Kibera and Mathare. Go hear how the youth of this country really behave, and that will help you determine how you treat your employees. So I think intergenerational engagement for policy shaping should be the thing that should inform what is critical to make us win at the workplace and for organization. And make it a policy so that when Sylvia leaves, it doesn't become a thing that Sylvia did. It becomes a thing that our organization does and shapes then the culture going forward.
Thank you very much. All right, Dr. Catherine Kebutangi, 30 seconds, parting shots.
Parting shots. I think what I'll say, I'll go back to where we started. This is not about women. This is about people, and this is about institutions. So even when we think about how to make things better, we shouldn't think about women-specific things. It's human-specific things. And then women sort of tend to get to benefit from some of those things. Things like promotion guidelines, things like equal pay, things like safeguarding. These are things which affect every single person, but when they exist, then of course, everybody benefits. When we make it about women, then of course we perpetuate the narratives that it also becomes harder to form allies within an institution because they can say these are for women. But if it applies to every single person, if we fix the culture, fix the systems, fix the processes, the policies, then actually women benefit more from strong institutional systems than men do because men are already far ahead. So we manage to pull women and then they catch up.
Thank you. And I think that's the individual approach to support women. And when we get into institutions, because men are working with women, then we must approach it to take care of both. Appreciated. Over to you, Dr. Kendi.
Yes, thanks again to go back to what you said in the beginning, Nora. I think the key is that really we have to debunk the myth of women are their own worst enemies. And again, as I said, in my own experience, over time, once you already, after a while, you appreciate that really it's not about men or women. It really is about human beings and individuals. And where we need to be critical, we are critical. But I also feel like as a woman, and I will not shy away from this, I have responsibility so that the challenges that I've gone through in my life, my daughter doesn't have to go through that. The other women who come after me don't have to go through those same challenges. So it is my responsibility as a woman leader, as a woman who has privilege, as a woman who has an opportunity to be able to lift others and make sure they are in a better place than where I was in the 70s and 80s and the 90s. So I agree with you, it's not about women, but again, to my mantra of to whose much is given, more is expected, we as women have a responsibility to make sure we leave the world a better place and we lift these young women here in all the work we do and everything and make sure that they are successful. So thank you.
Thank you, Dr. Kendi. Honorable Cicely?
Thank you. There's a special place in hell. So I want us to flip this because I think we are the generation, the older, the younger, my grandchild, even my mother praying for me because she didn't understand that our privilege to discover that special place in heaven through supporting the next woman. It is about all of us. We need not to be in government, in cabinet, in corporate to bring the difference that we yearn for. And it is for this reason that I'll continue to advocate anytime I have a platform, through the media, through the social media, whichever platform that I have, because I know I have a responsibility given the privilege that I've enjoyed in the past. I'll continue to mentor young women, but they need to be available. They need to be available. They need to be present. I'll continue to write so that then the next person who is not in this room can also be able to read. But I also continue to, with a little bit of love, nudge you to be present and to take up the opportunities. Each one has a responsibility because it's about all of us. Thank you, Nora, and your team.
Thank you. Sylvia?
Before she goes on, we almost needed the AC, the air conditioning, but I'm a little bit ahead of her. And it is for this reason I'm setting up a series of webinars targeting sectors, especially the technical side, where I have been, both experiential, but also to bring in the new knowledge around raising our own self-awareness to be able to then show up in the manner that we want the next generation on the people around us to show up. Next 2 weeks, I'll be with you.
Excellent. Sylvia?
Mine is around excellence. And to what has been said, those whom much has been given, much is expected, and the reward for good work is more work. Please be excellent in every single thing that you do. That's where it begins and ends. Because if you're not delivering, and then you try to look for these other excuses, unanionea, hamtuelewi, apana. Please, excellence in every single thing you do. The small things, the big things, be excellent. Try to deliver excellence in your relationship. Be intentional about relating with others who are both your peers and those who are looking up to you and those that you look up to as well. Be excellent in your job. Trust me, to be very difficult. They will work very hard to look for those excuses to bring you down, if at all that thing exists. Because at the end of the day, somebody will always find fault in what you're doing. But if you're bringing your A game, then I'm going to be petty as well. And pettiness is a good thing. I know we talked about it earlier. Pettiness is a good thing. I am petty about every single thing in my life because you're not going to bring me down on all the hard work we are doing and then you think I'll let you get away with it. I will be petty all the way. So be excellent, be intentional, support each other. And by the way, drop loud the things that need to be lauded and the things that don't need, by the way, turn down that volume. But let's remember excellence, 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 because that's what leadership is about. What is that one thing that you're exceptionally good at? Run with it. People will struggle to bring you down when you're excellent at that thing that you do. And it comes from every area of your life. We'll never have it perfectly well, but just know, I believe you can have it all. I believe you can be a mother, a sister, a daughter, a wife, a great employee, a leader. You can do it. You can walk and chew gum at the same time. We are not the first people, so girls, let's go out and do it. But lastly, is just to encourage us that we live in a very interesting times. We've got the younger ladies also looking up to, and men as well, and boys. I'm a mother of boys. They're looking up to us. So let's make sure we model that which we want to be proud of. Okay? It's very easy to castigate others when atuonea, lakini wewe, how are you showing up? When matters that are relevant to this country and to the continent, are you a part of that conversation? Are you so behind, you're waiting to be informed? So I'll always encourage us, let's try to be exceptionally good at the things we are doing, and remember, we are human first. And when you're dealing with other people who are not so great, you're dealing with a human in them, not their gender, male or female. Thank you.
Akacho.
Yes, mine is just be an outlier. Do it afraid. Just break the boundaries because you are living in a very unique time. I don't know if you've read the book Outliers, but read that book. That for most people, you have to do your work a minimum of 10,000 hours, for you to be considered an expert in what you do. So focus on your work, do your work with excellence, and don't be afraid. I think in the morning we talked about people shrinking themselves, but challenge yourself this year. Go beyond your boundaries and break that barrier. Thank you.
All right. Round of applause. And I think we come to an end on this, and I think I will not summarize this any further, but we are saying that we are dropping the mic on bad narratives, on that narrative that women are their worst enemies. We're doing what? We're doing what? We're doing what? And with that, we are ended on this session. Thank you so much for your participation. Pictures. And your teeth are needed, as June would say. Please come forward and we can have our picture.
All right, as the teeth are being displayed, a round of applause, ladies. This was such a great conversation. I think the lunch helped. Thank you so much. Usually panels after lunch are problematic, but I think the curation was perfect because we have so many nuggets. And I feel like Dr. Sylvia, I have to speak to her as she's standing there, surrounded by Honorable Cecilia Nakacho. So I am not a journalist, guys, but I have heard, because I hear we were told you must listen and also hear. So I have heard, and I will take this message back to the entire fourth estate, which I do not control, but I do have a show, and Sylvia, as I said, is a good friend, so she is allowed to hold me accountable. I do host a segment every Wednesday called Jam Masters. The show is the Jam, June and Martin. You listen to it while you're in the jam, in the traffic. Are we together? But Jam Masters came up from the point of view of us having extremely talented people out there who have great big titles, but we're interested in the human behind the title. And so I'm now telling all of you, if you are a great human behind a big title and are willing to share your story, please attack me in the corridor. Give me your contacts and we will organize an interview for you. That much I can do. Yes? So that we start to change the narratives I'm committing to doing that. We have multiple Wednesdays in the year. If you'd like to be a guest of ours, please see me. Secondly, speaking of seeing, one of you is not seeing. You left your eyes, okay, at the dining area, and I know it is because of the dessert. Those things confused all of you. So if these are your eyes, please come and see me so that I can return your sight to you. And on a light note, yesterday was World Sight Day, so this is important, okay? Now we're going to go into our final, penultimate, such a good word, penultimate session for the afternoon, and it's going to start in 4 minutes. 4 minutes, because it is now 2:56. Now, how many of us registered for the workshop on authentic leadership? I think when you were registering, you had the option. Are you here? Can I see your hands up? Authentic leadership? It cannot be 5 people, surely. After the day that we've had. Authentic leadership? Are we now not interested? We're not sure if we want these positions? Yeah, if you're in that group, we're going to ask you to make your way to the first floor. We have a wonderfully set up room for you. This is the conversation on authentic leadership, lead from your values. We have our protocol and ushering team who will help you identify where you need to be. And just to position this section, we have 3 workshops that are going to be running over the next 1.5 hours, so that allows us to reconvene here at 4:30. And these incredible conversations will be guided, so we have leaders in each of those rooms who will take us through these conversations, and they've been developed specifically to help facilitate the sharing of knowledge, but also building of skills, all right? And they have an East African context, so it's going to be really exciting. So if you registered for authentic leadership, I'm going to ask you to start making your way so that we can give ourselves enough time. We have a team outside ready to guide you, but make your way to the first floor, and the rooms are clearly labeled. So please start making your way over. These are your, please clap for her. You were able to see, was this pen also yours? Excuse me? Is this, you left it? Yeah, you see, pens are precious commodities. Thank you. And enjoy your session. We have a second workshop topic called conflict dynamics. Conflict dynamics? Conflict dynamics, if you're here, thank you for raising your hands. I'm going to invite you now to also make your way to the first floor. Conflict dynamics. These are really great topics. I think especially after this panel, we need to know how to manage that and do it with grace. How do we build better relationships? Dr. Vito said you must be excellent in your relationships. So how do you handle conflict? I used to be conflict averse earlier on in my life. Now I'm looking for it. I am a middle child, so I feel like now I have my space and I want to make everybody know I am here. So conflict dynamics does not mean conflict is bad. There's good conflict as well. So how do you build better relationships? If you are in that workshop, please start making your way up to the first floor. I'll give you a few seconds. Please make your way up. Your team is already up there waiting for you, so I don't want you to lose out on the sweetness of the conversation. And for those of you who are wondering, did I register for the wrong thing? Please fear not. We will have a brief summary of all of the discussions before we close for the day. So you'll hear some of the highlights from the different rooms. So fear not. We shall impart some of this knowledge before you head out for the day. Okay? Is that everybody? So the rest of you are here for... What are you doing here? I'm just wondering. I've given you 2 options. What's going on? No, please take advantage of these conversations. When you have your tea later, you will be able to share and network. We do have one final workshop. Those of you who are already standing, just exit. Exit. Our final one is on peer allyship. Okay? And that is basically a conversation that clearly a lot of you would like to stay for. How peer allyship in the workplace could create pathways to leadership for women. Now, on an information note, yesterday was World Mental Health Day. How many of you are aware of that? And what was the theme for this year, 2024? Mental health at the workplace. And I think it's important to position these conversations in the context of mental health, which we now recognize as such an important part of our daily being, and being able to notice in your teams what it is that's happening, and being able to address it. And I notice that we don't all have the vocabulary or the tools to be able to deal with it. So look for help where you need to, okay? So if you are staying for the final workshop, which is Sisters Keeper, how peer allyship in the workplace could create pathways to leadership, then this is where we will be having that final workshop for the same period of time. Now, we will formulate this particular workshop a little bit differently. It will begin with a brief panel discussion to position the conversation just for 30 minutes. And so without much further ado, as we wonder what it is to really be our sister's keeper, these next round of speakers are going to delve into the role of peer allyship. So I'm going to welcome our last panel for the day, and I'd like you to give them a warm round of applause because they have traveled from Uganda, from Tanzania, and from South Sudan, as well as Rwanda, to be with us. Dr. Doreen Ondo, please make your way to the stage, ladies. Let's appreciate Dr. Doreen Ondo as she comes. She's an obstetrician, gynecologist, or obsgyn, as we like to call them. Please take your position. You may sit on the second seat going to the left. Stella Mujaya, a public health consultant all the way from Tanzania. Let's appreciate her as she comes. Karibu sana dada, it's nice to have you. Dr. Jane Keliki Mara, who's a technical officer, Reproductive Health Association of South Sudan. Welcome, 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 our sister. And Marie Grace Sandra Musabwasoni. Bienvenue. She's the assistant lecturer at the University of Rwanda. Welcome, sister. She also has a wonderful gadget that took a great photo of me earlier. Thank you for being here. So I'm going to hand it over to you all to have your discussion on how to be your sister's keeper. Are we ready, ladies? And our moderator is another force. Tell your neighbor, force. And before she comes up, or as she comes up, I'm going to ask, if you have sat all the way there, please, for the benefit of these, our panelists, please move to the center. I'm going to give you a minute as we welcome Dr. Jacqueline Kitulu, who will facilitate this workshop. Karibu sana daktari. We have a chair for you, do not worry. You could stand, whichever works. If you are on the far right as well, hi my pharmaceutical sisters, I remember you. Make your way over to this side. Please, please, please come to the center so that you can focus. I feel like knowledge travels this way. Not this way, not this way. So if you want to grab it, approach the middle section, okay? Over to you, Dr. Jacqueline.
Thank you very much. Good afternoon, ladies and gentlemen. I can see a few gentlemen. Good afternoon. So welcome to this session. How peer allyship in the workplace could create pathways to leadership for women. So I'll start by introducing myself and introducing this wonderful East African panel. So I'm Dr. Jacqueline Kitulu. I'm a practicing family physician. I do see patients. I've seen some this morning. But other than that, I also sit in several other spaces. I am currently a director for a holding company, HHIBV, that runs 3 hospitals and over 40 clinics in East Africa, so in Kenya and Uganda. So the hospitals being Kampala Hospital, Nakasero Hospital, AR Hospital, and the AR clinics. I also sit on several other boards for Path Kenya, E+, and a number of global advisory places. So I do both things. I work with the patient, and I also work in private sector right now, but I've also sat in public sector spaces in the NHIF board for our country here, in the Kenya Medical Practitioners and Dentists Council, and yes, and I was the first female president of the KMA. So I'll turn over to my panel and ask each of you to introduce yourselves so that at least people know exactly who's holding this discussion.
Yeah, thank you very much. Good afternoon. It's a very great pleasure to be here with you, and greetings from Rwanda. So my name's Sandra Musabgasoni. I'm a lecturer from University of Rwanda. I'm basically a midwife and a nurse educator with leadership and education specialty. Before I enter into my leadership role, this is what I do as a midwife. Thank you.
Hello, everyone. I'm really honored to be part of this discussion, especially because I'm one of the recipients who has truly benefited from peer allyship support. My name is Stella Muja. I am coming from Tanzania. I am a public health specialist. I'm currently consulting. I just started consulting March this year, but before that, for 5 years, I was serving as a country director for Palladium.
Good afternoon. I'm Doreen. I was part of the 2023 cohort of WomenLift, and I really benefited a lot from that. I'm really privileged to be here. I'm an obstetrician, gynecologist by training, although currently I'm more into public health. I support the prevention of mother-child transmission program in Uganda, and I'm really passionate about women, most especially the young women, and more recently, the older women. I've come to appreciate that there are quite a number of experiences that the older women have, so I'm picking more and more interest there. I've also been very privileged to be able to work in different fora or spaces, starting from the clinical work and NGOs, and more recently at the government level. Thank you.
Good afternoon to you all. I'm pleased by this East African dialogue of today. It's actually my first time attending a dialogue, as well my first time of being a speaker, but I believe I will make it. Women, oh yeah! Oh yeah! I'm really so much happy because as being a South Sudanese, since then, I was listening. People talk globally, not knowing other countries are left behind. Allyship has never been our words in the country. I don't think if it is existing, but I had a few experience I'll be sharing. I'm called Keliki Jane. I'm working for one of the civil society organizations. I've worked for 15 years in humanitarian setting, but throughout my journey, I've been very unfortunate. I will share that later when I will be giving my allyship experience. Thank you.
So thank you very much for those introductions. I think now we are more familiar with each other as we go into the next session. So I think many people wanted to stay for this session. It had that catchy title, Women Are Their Own Worst Enemies. And I hope at the end of this session we can bust that myth, right? Or maybe it's true. Is it truth? Is it myth? Let's see. So even as we start off, as I turn to my panel, I don't know, what does peer allyship look like to you? How have you experienced it either as the giver or the recipient of the support? So we can start, just to my left, Sandra, and go on to the other as we go down the line. and just share what it means to you.
Yeah.
Yeah.
Thank you very much for the good question. I reserved myself to speak about my experience as a leader, as a woman in leadership, because I wanted to highlight that this allyship was not known or is not even applied. So apart from being a lecturer at the University of Rwanda teaching, I lead different committees, and I also lead other international organization committees because I'm a board member of the NIH of Liverpool School of Tropical Medicine in the UK. So you can imagine how a woman from Africa can be part of this big association. And recently, I was called as an expert to knowledge translation for WHO. But to reach there, I'm sure that I have that experience with many of us here. No one lifted me up to go there. No one said, Sandra, go there because you can do it. I marketed myself, and I reached there. With the other different, because I'm also a community opinion leader in my country, I also lead different local government organizations. So this kind of allyship, we used to confuse it as mentorship and coaching, and yet all those three have their own explanations. So I was somehow mentored, but in a professional background. I say that I'm a midwife and a nurse educator, so I was mentored on how to practice midwifery and nursing practices. But no mentorship about how I can lead effectively before I joined WomenLift Health Leadership Journey, because I'm also a fellow of 2023. So you can imagine how this kind of allyship was not even recognized. As a recipient, I said that. But as a giver, if I can say that I did it without knowing that I'm doing it, because my role was always to encourage my fellow women to take at least the very short readership within the university, at least to read the module. You can imagine to ask someone to read the module, so to be the module reader, it's even a problem, even to accept. I can't do that, do it. Do it as who? As a woman. And I'm encouraging my fellow to be this. That was not easy. And again, I used to extend some opportunities for professional development and try to challenge the status quo by fostering that women can be there and work in the university background, and even in the local government, as I said, and internationally. So I did it as pushing without knowing that I'm really an ally to that team. And I remember that allyship ties with actions, behaviors, and practice that reader take or put into action to be able to support, to amplify, and advocate with, not for, advocate with others, really to uplifting others who are left behind. So it's not obvious a practice that I can say in my context, but this is the beginning because I have that experience. Thank you so much.
Thank you, Doreen. And indeed, I think, Sandra, even as I take from you, it is something you are not even aware of. Even as you are the giver, you are not aware. I think we are beginning to bust some of the myths as we go along. All right, we can move on to Jay.
Thank you so much. So when I look at my career and the people who have been able to supervise me throughout, 70% of them were actually women. That's why I say that I am who I am today because I've been propelled by women. So when you talk about allyship, for me, if I am to use, the Gen Z language, hashtag, what comes to my mind, number one, is being intentional. For me, that is a very essential aspect when you're talking about being a peer allyship, because that differentiates you from providing just a casual support. It goes, there's so much that goes beyond when you're intentional, like the goal setting, the action plans, etc. So number one, I would say hashtag being intentional. Number two, observant, maybe for lack of a better word. I say that because, and I think this also pertains to all. Even as a leader, you need to be observant, because if you're observant, then that's when you can be able to identify the inequalities that are existing in workplace. That's when you can be able to identify the strength and be able to identify potential areas for development. So that's one. And then the third one is having an action plan. I feel that is very important if you're being an allyship, to have a plan. It may not be like a very beautiful plan, but there has to be a plan if you're planning to be a good ally.
Thank you, Stella. Indeed, intentional. We are coming from a point of even not being aware that what we're doing is being an ally, and moving on now to, intentionality about being peer allies in our setting. Yes, so let us hear what you hear what peer allyship is to you in terms of a giver or a recipient of the support.
Peer allyship to me is those things that we do to make other people feel safe, to feel heard, to feel appreciated. You are an ally when you are trying to get somebody to be the best version that they can be, seeing that which many other people are not able to see in this person. And I've been privileged to have people see that in me and help me to grow. So for me, that's the quick summary. Trying peer allyship is basically trying to create that environment of growth so that one can be the best that they possibly can be. And I believe each of us is in a position to be a peer, to offer that peer allyship to different people in different spaces. So as women leaders, just imagine how powerful that would be if we were intentional, like Stella has said, about being an ally to another woman. Thank you.
Thank you, Doreen. And what I'm hearing there is almost carrying it forward. You have received, and now you need to do the same for others. So you're intentional about moving it to the next level. Jane.
Yeah, thank you so much. I would like to start by defining the word allied. An allied is a person who is not in a marginalized group of women who need to be pushed to a certain level. And when it comes to allyship, this is now an act of an individual as a collaborator to a marginalized group who might need to push that particular marginalized group to a level where he or she is. Now, to my experience, in the beginning I said I've been very unfortunate that I've never experienced it until when I joined WomenLift Health. And WomenLift Health, this program has made me to a certain level. Today they are calling me a technically. It's because of this WomenLift Health. I had a network. Of course, they form a network as a team. I always do ask a lot of questions in our network. And as well also, they try to give me some of the aspects of being a good leader and also aspect of managing project and the management of the leadership, which I will be taking off. Then sometimes back, I don't know if Dr. Makoyo is here, he might have forgotten me, but we have worked together in the same organization. He sat here in Nairobi, we were in Uganda, we were in South Sudan. Actually, they are the people who normally empowered us. One time he talked of myself. In the organization, most of our leadership are taken up by male. We have few women, but they are in the lower position. Dr. Makoya was acting as a collaborator for myself to take over a certain position of quality of care. And then Wanjiro, who was also here in this country, came in actually advocating for myself to take a certain position. But I mentioned for you earlier on that in the country, this word allyship, I think, never existed. Or might be, we knew, but because of a certain factors that we don't want women to take leadership. We are so much driven up by a cultural norm of which if a woman is in a leadership, we don't appreciate or we don't take their contribution as a positive. So we really don't have so much experience when it comes to allyship. But it is something very important when I joined this program of WomenLift Health. And I can't leave this stage without saying thank you for WomenLift Health organization. And always, whenever we are in a meeting, I do advocate, next time, please, WomenLift Health has to be taken to South Sudan. And the program like this need to be organized in South Sudan so that the women and as well as men will also know that there's important of women to take up leadership. And this has to go even up to the political, where women can take a leadership in political aspect. Thank you.
Awesome, awesome, Jane. Indeed, it's never too late to come up to be in an environment where you can feel allyship. And I'm so glad that WomenLift Health has been that eye-opener for you. But you also share important aspects of allyship from men, from women, from those around you. As we go into specific areas, Sandra, maybe I can start with you. So can allyship be institutionalized into workplace culture? What steps can organizations take to do this? I think from your experience, you've mentioned in your teaching and all, what impact do you think this would have on supporting women to grow their organizations?
Yeah, thank you very much. I think my answer is yes, 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 yes. It can be institutionalized because they are women, they are men, they are working for a common goal. So to be able to implement this allyship at the workplace, we have an example. I'm recommending organizations to use this WomenLift Health Leadership Fellowship. It's a 12 months journey, which is really powerful in helping women. But I would suggest also if this can be applied also to men, so that they can work hand in hand in organizations. And not only that fellowship, we have also to implement different workshops, seminars, to encourage people to know really where they are, who they are first, to know themselves, and then help others. We do have different suggestions for steps that they can take in. We can also discuss on promoting authentic conversation within organizations at workplace, whereby mutual attempt to be honest to each other. We've seen from morning what really women need, and we heard what men are doing to us as women. So that's kind of mutual relationship and respect is also needed to be applied in workplace so that this allyship can be positive to us and to support through thoughts and feelings in that conversation. We would also suggest that they can take a part of encouraging leadership-led initiatives within the workplace and appreciate what women are really doing to be able to reach that common goal that the organization has set. So saying that because this is for women to not succeed, really we need to to wash out because we can do better even than men. And again, it's good also to use the community-centric approach within the workplace in order to include everyone. Otherwise, if you want to ask in one corner and ask another corner, it will not be positive. So using that approach will improve that conversation, and that can work in order to support women. So I want to highlight this process of really including allyship within the workplace, and ask leaders what they should do to be able to raise up the employees. They really need to help the employees to understand intersectional dimensions of diversity. This starts from me, who I am. If I'm a woman, do I really need a man to work with? If this, I will make sure that what I have to do in my responsibilities, also him has responsibilities to accomplish so that we can reach to that common goal. But when it comes to woman, this is very forecast because women were left behind for so long. So we need this kind of push-up, showing them they can do, because some, women, they are reluctant to serve the purpose because they know, I'm not born for being a leader. Who is born for being a leader? Anyone can be a leader, and even a good leader in that process. And again, we talked about stigma and discrimination, also biases that the society has for women. We need to break that we need to break that silence of keeping women to not doing this, you can do that, not there. We need to build that context in our workplace and encourage women to join leading. We can also move on to not really doing mentoring, because mentorship, sometimes it can take long time without meeting, but allyship, peer allyship, it's like mother to child or a sister to sister. In the morning, I know how you worked up, how you are doing during at midday. At night, you find this kind of peer allyship would help to even include men and also increase productivity within the organizations. This is what I can say.
Thank you. Thank you, Sandra. And a lot of what I'm hearing is that it has to be an inclusive process. I know the majority of those who are listening here are women, and yes, there are men who are there on the technical support, and I hope they're listening to this. But in the institutions are made of men, of women, and it has to be an effort that is working around cultural change, because that's a big aspect, but has to be inclusive. We can't just be women working on our own. Yes, Stella, in your opinion, what's the most essential pillar of peer allyship?
Yeah, thank you so much, Jacqueline. Allow me to kind of personalize my response to that. Instead of talking about the pillars, I would rather focus on the actions.
Absolutely.
You know, as I mentioned, being a benefiter of peer allyship, I had some reflections. What did those people who supported me do to make me who I am today? So there are a couple of things that I've written that I feel like they are very important, and it should serve as a reminder, because what you're doing has impact on someone. It can have an impact in their growth, etc. So one of the things that I have noticed to those people who was able to support me, they would stretch me out of my comfort zone. But the most important aspect in that is that they would be present. So presence for me is very important. As you're stretching someone out of your comfort, or out of their comfort zone, you should also be present. I would give an example. My supervisor back then had really encouraged me to apply for a country director role. And back then, you know, the country director role were for Muzungus, for those who are Gen X. And then, you know, later time in Tanzania, then it was for foreigners, like the Kenyans will be leading this portfolio, etc. So I was asking myself, is this a role that I can be? I don't see myself, but she said that, Stella, you can be able to do that. So, you know, I drafted an application, but then she was there. She was present. She was there to encourage me. And she even gave examples, gave me affirmation. Stella, you started a parentified role at the age of 19. You were taking care of your siblings, you were taking care of the extended family, you know, you're raising 4 children. You are the COO of your family. You know, those are all the skills that really, you know, requires you to be a country director. And so I drafted my CV, and then she said, let me review your CV. And then she went ahead and reviewed the CV, and she told me, but Stella, you did X and Y, but it's not there. Why? So, you know, the important point that I want to make there is that as you are stretching someone, as you're supporting someone, you're stretching someone out of their comfort zone, making sure that you are present, you know, to affirm, to provide feedback. Another thing is, what I notice is there's an importance in sharing goals and open communication. My supervisor was very clear of the goal, like, I see you, this is where I see you. And so even as I am doing what I'm assigned, I know where it will take me, and it is a motivating factor for me. And then another thing is, being empathetic and very understanding. This is also very important. We all make mistakes. So as you know, as I was making mistakes, she would say that it's okay, you can do better next time. So these are very important, actions one to have to ensure that you're supporting someone. Be respectful. There are times that I would go to the meeting with them, with the supporters, and then they are the experts. But they would call upon me to share my opinion. And I was a program officer back then. But then, after sharing my opinion, they would build off from what I just said. So very respectful of my opinion, regardless of the position that I had that time. Another one that is dear to my heart is acknowledging and advocating for visibility. I think for me this was very important, and this has made me who I am today. The fact that I'll be given a task maybe to write a brief. The supervisor would be there. We'll go through different versions, like 5 versions, and then it became a good brief. And then when you get to a meeting, she would say that the brief was written by Stella, but then I would like. You made a very good, the brief is good because of you. But she would be able to acknowledge me in the rooms, but also creating visibility for me. Another one is trust. As you are delegating, tasks to someone whom you intend to support, you have to bring the trust aspect in that. Not going through the test and say, how was it, or being controlling. Ensuring that what you have given, she will be able to deliver very well. And I have examples of that I've been trusted to represent maybe my supervisor in some of the meetings, that USAID meetings, and I was very scared, but I would get the support maybe from starting to prepare the presentation and say, you can go and do it, go ahead and do it, you can do it. The last one is one also that is dear to me, vulnerability. Sylvia also talked about it. I think it's important to also have that as you are supporting others, because it shows that we are human. So these supervisors who are women were able to give me space, to cry when I have issues, and they were also able to share their problems. So that made me feel like, oh, okay. So, everybody's experienced that. It's normal. So those are the things to me that are essential, and I feel like it's something that we should take on and be cognizant of our actions as we are doing.
Thank you so much for really putting that in and individualizing it and just taking it into your own life, and so that we can actually see what allyship looks like. And in fact, on the last bit, even as you shared about vulnerability and what it involves. And I know sometimes allyship, it's looked at like, it has to be certain levels of, are you at the same level, are you a superior, are you an inferior? But when you humanize it, it doesn't matter, we are all the same. And it reminds me, in my practice, I had one of my staff, she went away on maternity leave and came back, and then about 2 weeks later, she says, you know what? She said, I need to have a meeting with you. I said, yes. And she came and she said, I think I'm going to quit work. So I'm like, why? She said, because I can't handle being at work, going at home, sorting the baby, and then I have to cook. When I get home, the cooking is just draining. And honestly, that's why she was going to quit work. So I said, we are mothers. I'm also a mother, and I have children, and there are ways around some of these things. And I said, like the cooking, on the weekend you're free, so you can cook in bulk and freeze it, and then you come, on the days you get home, maybe it's just to make a starch, or even your vegetables, you can chop them up, you can freeze them. Do you know she had never even thought about anything like that? And that was her game changer. Just that coming down to a human level and understanding that, yes, it is doable. And she stayed on with me another 5 years before she went to do other things and open up her business. But yeah, that's that humanizing bit, bringing the vulnerabilities and appreciating that we are also in the same levels, that, you know, those are some of the things. And it's what you said, you know, that being personal, being present, being, you know, it's action. Yeah, a lot of it is action. So Doreen, let's move on to, based on your experience of working in health, how do you think peer allyship can be used as a force for leadership transformation and advancement for women?
Thank you. I believe that peer allyship is actually a very great force that would really help drive this transformation. Join me in a journey back many, many years ago. I was an intern. How many of us are doctors, gone through internship way years back? Yes. So I'm from Uganda, the Pearl of Africa. So join me in some village upcountry, Gulu, who were interns. There were around 8 boys and 3 girls, and I was one of those 3. Now, we were very, very close-knit together. The boys, as usual, were, you know, aggressive and trying to do everything. Now, when we were doing surgery, we were required to do a certain number of surgeries. Being ladies, we were a bit scared. So I'll take you another step back. When we were in medical school, the first time I entered theater, when I saw them cut, I saw the blood, I hit the floor. So I told myself surgery is not for me. But as I went through medical school, I came to appreciate that I actually loved children, and I also loved surgery. So that's how I ended up marrying the two, obstetrics and gynecology. I was able to get a little bit of both. So fast forward, internship. We had these 2 supervisors, surgeons, who were the total opposite of each other. One surgeon was encouraging everyone, do, cut, cut, cut. The other one did not believe we could do anything, that we were just going to mess up the students. So the boys, being boys, decided we have to cut. So we agreed amongst ourselves, and we supported each other. We would wake up at 5, arrange our patients, and sneak into theater before the bosses come, and cut, 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 cut. But remember, some of us had issues with blood and the like. But somehow, through that support, the boys were really part of our, you know, support system. They were our allies. And based on that experience, I went on to become a gynecologist, an obstetrician. I was able to cut, I was able to do surgery without fainting. So that is just a demonstration of allyship. So coming back to this, what does allyship do for us? 1, it helps build confidence. Without that support, I never would have been able to do those surgeries. So my allies were able to see the potential in me and push me to be able to do that. They encouraged me, they pushed me on, and I felt confident. A few years back, I was in a role that I never thought I'd be able to do. So one of my colleagues, we went in for a meeting, I think one of my very first meetings, and one of my colleagues, who I was supposed to be supervising, introduced me. And I turned and I looked, I was wondering, who are they talking about? Is that me that they are describing? But that feeling that I got gave me the wings to continue with the rest of the meeting. And every time I start feeling shaky, I draw back on that. That was a male ally, okay? So building confidence. The second thing that allyship does for us is sharing knowledge. As an ally, you share knowledge, and as you share that knowledge, you're holding someone up, you're giving them that information that probably they did not have. like many of the other discussions that happened earlier on, we don't know everything. You can never know everything. So, as an ally, share whatever information you have. Don't hold on to it. There's this saying, by lighting another person's candle, your light does not dim. So let's do that. Share that knowledge. You can share valuable insights from your own experiences. Yeah. Again, back to that time, long time ago, internship, we had, the theater assistants, those who I don't even think they went beyond senior 4. They learned most things on job, but I learned how to do a cesarean section from that theater assistant. She showed me, no, you cut here. She does not even know what it is. You use this instrument, you do this. But I learned from them. So sharing your knowledge helps, is part of allyship, and it can really help transform we as women leaders. Then creating networks. I don't think I can emphasize that enough. Peer allyship helps you grow your networks. My networks become your networks. The people in my network automatically become yours. So like we were told today in the beginning, don't leave this place without having at least 5 new people you meet. Yeah? Grow your networks. There's a saying, your network is your net worth. Okay? Then there are many other things they can think about, but one more that I would like to talk about is peer allyship helps provide emotional support. And women are very good at that. Some people call it gossip. But, I refer to it as offloading. When I have something on my heart, I know where to go and offload. And I also make myself available for other people to be able to come and offload. So that is the way you can be able to be an ally. And by doing that, just imagine whatever it is that was troubling me in office, or as a leader, you've had people share as you go higher, it becomes cooler, there are fewer people, you have no people in your networks to really support you, so you need that emotional support. And in the health workforce, I think we all appreciate the stresses, the challenges, the constant pressure that you're under. If you're not able to release, if you don't have that valve to release, you'd explode. So I would just like to conclude by saying that building that allyship culture is really key. Being able to provide that environment for other people to be able to thrive. And more importantly for us as women, will really help us to really push us and galvanize us forward. Thank you.
Thank you so much. I think you've shared some real nuggets there. And I love the part of, the heart part of leadership. Yes, you need a place to pour out your heart as well. And that's what you do with allies, because they are in the same space as you. They can see what it is. And you can be that person for the others as well. And even as we go into the workshop, we'll look at how we lead and, from different aspects, from the head, from the hands, from the heart. You can't exclude some of them. They're important, and that comes out so well in that allyship. I love the boys in that class. They were real good friends, huh? All right, and finally, Jane, I know there are many harmful narratives about women not supporting each other, and these have persisted for generations. Yet we also know of numerous women who have dedicated their lives to supporting other women, including you. So how can we reframe these narratives and create a culture where peer allyship is a cornerstone of women's leadership and development?
Yeah, thank you. Let me start by accepting the narrative. I concur with that narrative, because the statistic is very clear that women remain underrepresented in any other programs. I'm giving an example. There was a position that our organization advertised, and it is a regional position. We were waiting for the person to come in, the person will be based in Juba, in our office. Amidst ourselves, including myself, we are asking, did they shortlist the applicants? How many women are included? And to my surprise, everyone wanted a male to take up the position, including even women themselves. So it's like we are our own enemy. We don't advocate for our leadership. That's why I said I concurred with the narrative. However, earlier on, I said there are people who supported me to be in my class as per now, and also to be here in Nairobi for this dialogue. I was supported by WomenLift Health, and I really appreciate it, and I'm sure they might support me more, and also I would love to support more people in whenever I finished. The thing is, how can we reframe that? Yes, to reframe it, you see, there are women supporting each other, but we have not amplified our voices. We have written so many research, but it's not publicized. I heard from one of our colleagues said she wrote actually a very good research, but where are the research? Are we reading through who wrote this research and put in a place? And also, there are women who normally contribute a very good statement, and also contributes well in whatever which is coming. What shall we do to raise up women as a leader? But we have not considered that. We have not considered their option or their objectives they have given in a women leadership. And I'm also talking about, you see, we have a women-led organization, but they are not in support. So we can support some of the women-led organizations so that they will be able to help marginalized women to go up with their leadership position. And I'm also talking about, let me give a perspective of a donor. Once we have a women-led organization, we need donors to come in. We need to have a network with the donors so that they will be able to support us financially. We will be able to expand the women-led organization. We might have women-led organization a lot in this country, but in other countries, we don't have a women-led organization. If I'm to talk, how many organizations are led up by women in our country? Out of 100, you might find maybe half or one. Half means if the executive director or the country director has gone somewhere, that is when you take over the position. So long as he comes back, he takes over back his position, it's not promoted, okay? So let's have that network with the donors to help us raising up our organization as women. I'm also talking about the issue of having a network as an allied. Having a network is okay, but how do we introduce this allyship into the organization? If most of the organizations are led by male, and here you want to have an allyship, who is supporting us? Most probably, we need to introduce the allyship first into the institution so that it will be able to work well. We can have the network and have all the aspects and get some of the experiences you share. Then for you to bring it to make it work in your organization, you make sure the organization understands what allyship means and what women leadership means. And it should be a policy. I'm saying why it should be a policy, because most of us rely on cultural norm than what is supposed to be done on the ground. Because when they say culturally, as a woman, you are supposed to remain where you are, then you have no other thing to back you up. There must be a policy to support whatever you wanted it to grow up. Then I'm also talking of how to create environment, inclusive environment. There must be a diversity and also inclusiveness to all the aspects of the program. Because once, as we speak, I don't know if we are to include the persons living disability also here, and I'm also talking about those ones as per now, who have retired. There are some of the women who has been in leadership, they have retired. How can we bring them back to build us? They are most probably, they are too important. We cannot leave them out there to sit where they are, but we would rather call them back to also start building us. Then we also have the young ones who are very brave, and they have all the skills also. They can also bring us up. We join us together. That means the diversity and also the inclusiveness. This is what I want to talk about, how we will reframe the state, that narrative. Thank you.
Thank you. Thank you so much, Jane. And I think you bring quite a different aspect to it. And sometimes maybe when we are looking at allyship and we are looking in our own context, we don't realize the differences in the different parts even of the region. And indeed, coming from what you've shared, even just bringing back the older women to be part of the allies, including the men in a big way, because if there's 1.5 leadership, I've never had that concept of half, but yes, there you are. You need the men to be part of that process. So in an institutionalization that involves that, in that diversity experience from which you'll draw that allyship. So thank you very much for sharing that. I want us to wind up this panel. It was just a little taster of what allyship looks like, because we have another session where we are now going to how do we support each other as peer allies. There's that peer coaching bit. But even as we do that, I'll just give each of you 30 seconds to just give a parting shot. Just 30 seconds, and we'll start with you, Jane. Just your closing remark, just 30 seconds. What is the most important takeaway you want them to hear?
Thank you so much. My takeaway to all of us is allyship. It has no end. It's like a continuation. We have to continue pushing until something happened. We have a long way to go, but I believe as a team, we talked of having network, and we talked of having policies and institutions. We will make it. We push on, we make it to move, and we should not forget each other. Let's have that environment of having each and everyone in our plans, including the younger ones and people living with the disabilities. Thank you.
Thank you, Jane. That allyship has no end. It's a continuous cycle. Doreen?
I would like to conclude by saying each of us has a role to play. Each of us can be an ally wherever we are, in whatever spaces we are in. Ask yourself, who can I be an ally to? Who can I be able to support? How can I do that? Let's be intentional about it. Let's hold each other's hands and pull each other up. Thank you.
Awesome. We all can be an ally. Yes, Stella.
Just to add to what Doreen has mentioned, some of us who are privileged, I think it's very important to give back what we have received. So important to be allies, but I think to also be cognizant of the actions that we portray to others, so that we can make impact in other people's life.
Thank you. So Stella is still at it. Allyship is not a noun, it's a verb. It's a doing word. You have to do it. All right, Sandra.
Thank you very much. Mine is from morning up to now. And by giving with an example of American writer called Mary Robert Renan, she said, when knowledge comes in the door, fear and superstition fly out. That means the more we understand things, and the more we know about what to do, so the more, or the less fearful we do it. So we know the problem we are causing to ourselves, and we know the problem that others are causing to us. So let us build or have a strong note to be able to succeed in this way. Thank you.
Thank you so much, Sandra. And thank you very much to this lovely panel for sharing your experiences on allyship in the workplace. And I hope that for those in the audience, that you've picked a nugget or two here and there, and you'll take away that allyship is a doing word. You're going to do it. You're not just going to read about it and hear about it. You're actually going to be the ally. So we close this panel now, and I hand over to Terry for the next part. Thank you.
Amazing panelists. Let's appreciate them better. Thank you. As they step down, if I can get a few people to help me pull this down, because I honestly don't need it here, I'll be happy. It can go somewhere on the side. That is not our photo, so we can keep on with the conversation, isn't it? It is their photo, isn't it? So good afternoon, everyone. My name is Dr. Terry Kigundo. I work with WomenLift Health as the senior facilitator at the East Africa Hub. And this is my third year at East Africa. And I'm super excited to be taking us through this session here that we are calling the peer coaching with head. Put at your head. With head, heart, and hands. That is all my business that I'm coming here to do. Can you imagine I'm coming to tell you the head, the heart, the hands? It's going to be a short but sweet conversation. So the earlier discussion was all about the peer allyship. And the key message that I want to tell each one of us here is that we all know where we are going, don't we? We all know where we are going, isn't it? We have some very good goals, but along the way, life happens, and something happens, and then you start feeling like, I don't think I'm sure where I am going. I feel like I lost my track. I don't think I know. Then at some point, you start feeling like, hi, by the way, Annie, Terry, I'm feeling so hopeless. Terry, I'm feeling so helpless. I even regret taking this job and applying for this job. I regret taking that project. So we all start from a very good point, but along the way, something happens. And this short conversation that we are having this next couple of minutes, it's just your role as a peer coach in helping her help herself. Did you hear that? You're not helping her. You're helping her help herself. Because, remember we started by saying, she knows where she's going, but something happened along the way, and she lost some track. So you're helping her to help herself. This is a lot, and we don't have a lot of time. So this is just a teaser of what happens and what we can be able to continue engaging on. So for this session, for the few minutes that we have, we'll focus on what this model is all about. Jackie might be kind enough to take you to small group discussions where you practice that. Let's see. So we want to understand the model. We hopefully will get a few minutes to be able to practice it. We want you to gain self-confidence as a peer coach so that you can help her to help herself, and of course getting an opportunity to get to know each other here a little more. And that's the path I was talking about. No one ever gets stuck where they started. They get stuck where they stopped. Talk to yourself about that. That I don't get stuck where I started. I get stuck where I stopped. And that's why then the peer comes in to help you, to help yourself. I'm emphasizing that because this is not a problem-solving tool. We all know ourselves, we know where we are going, but life happens, and therefore we need someone to help us along this path that is full of corners and all that. So help her find her power, because she has it. She just lost it for one reason or another. How do you do that? You need to start asking powerful questions. When someone comes to you, and because someone will come to you, and if no one comes to you, please evaluate yourself as a reader. You must be having someone who comes to you when they are feeling down, when they are feeling a bit confused, when they are feeling like nothing is working. If no one comes to you, please ask yourself a question. So ask these powerful questions. What is happening? What are you up to? How? How have you tried to deal with this situation? How have you tried to deal with this issue? Maybe it's a boss who is giving you a headache, so you're asking these kind of questions. How? What if you tried this and that? What if you looked at this situation in a different perspective? And why? Why is this important to me? Why do I want to spend all the time building a relationship with my boss, for example, or a colleague? Why? What then? What do I need to do? Because I'm not happy with my situation and I need to move on. So what next? What can I do? What do I need to do? So as a peer coach at this level, you need to wear your observation hat so that you observe how this person is talking to you. You listen to what they are saying, but not just what they're saying, but how they are also saying it. You have to be very present as the person this person is talking to, so that then you can also be able to hear what I am saying and what I am not saying. Can you hear what I am not saying? Is that possible? Yes. So you need to be present there, 100% present. Observe what is happening. Observe my nonverbal communications. Observe what I am saying and how I am saying it. And when you're able to do that, then you're centering that particular person to the situation they are going through. And you're trying to find out, where might this person be feeling stuck? Is it in the hand? What do I mean in the hand? Maybe they are making assumptions about the boss. Maybe they are making too quick conclusions about the situation. Maybe it's just their belief system, and they have come to believe this situation is bad, and because Terry says it's bad, it's therefore bad. So try to listen to this person to figure out, where is she stuck? Is it at the head level, assumptions, conclusions that are being made too quickly? What is it? Sorry. Might it be at the heart level? When you're listening to me, you can be able to tell whether I'm feeling hopeless, whether I'm feeling regretful, whether I am feeling hopeless. You should be able to capture that. Does this person seem therefore stuck at the heart level, where they feel nothing else can be done, enough is enough, I'm so hopeless, she is so regretful that she is even into this space and all that. Might it be at the hand? Sorry. You know, when you come in as a latecomer, you have to be inducted on how to use every gadget in that room. So the room that I was up, it was moving there. This was not the arrangement. So now, my mindset, you see what you're talking about, the hand? It is the mindset. I've come in with the mindset that my presentation pointer will be the same as the one I was using up there. So I'm pressing arrows in the opposite direction. I was teaching about authentic leadership, so I'm also being authentic by sharing that part of what I don't know now. So, might this person be stuck at the hands level? Maybe she's telling you she doesn't know what to do. So for sure, you know this person is stuck. She doesn't know what to do. And therefore, you'll be exploring with her, asking those powerful questions on what she can try to do. The what if, you're trying this, what is happening, how, why is this important to you? This is a very simple model of peer coaching. Remember, as a peer coach, the message here is show up, be present, listen, observe, listen to what I'm saying and what I'm not saying, listen to what I am saying and how I am saying it. Any question up to that point? I know it'll take a minute to absorb that and process that. But I said also that this is just the beginning. We'll continue having this kind of conversations for those who will make it to our leadership journeys, but most importantly, to the power labs that we continuously offer within the region. So I will ask my colleague Annette to share with us a handout. The handout that Annette is sharing are some of these powerful questions that you can start using and asking someone whenever they come to you with this kind of questions. And then you're using these questions so that you try to figure out whether this person is stuck at the head level, at the heart level, or at the hands level. These are some of the questions that you can be able to ask the person that you're interacting with. And remember, when they come to you because they have trust in you. They come to you because they believe that you can support them to help themselves out. So they are not just coming to you because, not because they don't have anyone else to talk to, but there's something unique they are seeing in what you're doing. So we are not going to labor so much into these questions because as we continue practicing peer coaching, some of these questions just become very authentic. You'll never even need this handout to ask someone these questions. They will just be flowing and the conversation will just be on and on, on and on. But for this particular discussion, definitely you have a look at those questions. Dr. Jackie, I'm not sure how many minutes we have, and if we can practice a few minutes. 4:10. Good. It's 4:10. We are waiting at 4:30, so we have 20 minutes to just be able to practice a little bit in 15 minutes. We practice a little bit in 15 minutes, and I want you now to take a minute to think of a real life situation that you think you could benefit from a peer coach. Think of something that is currently happening in your life that you think you can benefit from a peer coach or from peer coaching. And once we do that, Dr. Jackie will be taking you to those 10, 15 minutes to have a conversation within your peers or small group, and you have that conversation there. And if you have any question about this framework, please, I'm happy to respond to it because I'll be stepping out very shortly.
Thank you very much, Terry. A round of applause for Terry. So we have just 15 minutes, and we need to practice this. So I'm suggesting you get into groups of 4s. This whole room is ours, so you can move to any section. Groups of 4s. And we might not be, if we had more time, we would have everybody practicing to be the one who is the one with the issue, and then the others would be one would be the coach, and then would turn around. But we'll do as many as we can. So I suggest, as with the people close to you, just move in 4s and just take up space in this room, and then start. immediately. Terry already left you with the question. Think of something that you need a peer to support you through. And if we can do even 2 people in that group, it will be fantastic. I'll move around trying to help. So 4s, I need you moving. And we'll have others helping us around, going around, like Dr. Koki here will come around and also assist, see what's happening in the various groups. Hi, Jen. Perfect. So now you can start up, and so one of you is the one who presents the problem, then someone else can be a coach. So just make them short issues and then try and see how you can ask, so that those questions, the why, the how, and see which part they need support. Okay. So we have a group here. I see a group right there. Yeah. Okay. Just stand the chair and you have your group right there. And just start up. Yeah, maybe, but I'm just listening. Too many questions. But what is the issue? Let someone present what is their issue, and then one of you can be the coach. You're asking those questions. What is, how. So you're just trying to help the person, help themselves. Just turn your chair around. You can just turn your chair around. Okay. So, okay. I'm wondering who else can help us support that. Because the people who are on the panel, let me realize many were very shaky. Sure. But I think we can, you can do that end. I'm here. What do you want me to do? Come, I'll tell you. All right. So who's presenting? Who's the coach? I'm the coach. Proceed. Okay. So just to go, you've done this model. Yeah. So just to help people, because you know how people sometimes struggle and they don't know. Is this what we're supposed to do, or whatever? That's all. Okay. Yeah. So just walk around. Maybe you can go to that end because I have Dr. Koki here, so you can maybe start on that other end. Separate, the love is much. Go ahead.
It's a creative four. Yeah. Head, heart, and hands.
respond to these questions. There are quite many, but we have to go with, as they asked, what is the story in your head? That is what you say to us, and you can take us hours as well, because we have a limited time. And who do you think you are?
So let me just gather you back. So we have very short time. Present the problem. Who is presenting the problem?
Yeah, she already. Yes.
Now, you're the coach. Ask now, how do you support her? How do you help her to find the answers? So what is the problem?
It's a leadership problem.
So you're going through organization politics. So you're trying to wonder how to navigate. Perfect. Yeah. Now start to ask, especially new leaders, even you.
Yeah.
Organizations and politics.
Yeah.
So start to ask her the questions that can lead her to find out. Don't worry too much about the whatever the story and things there. But just begin to ask those questions that help her find her. And some of them are, remember, what is she not saying? So you're asking it so that you can get, then so you're just supporting her to help herself.
Yeah.
Jane, so you're in between two leaders who see you as a threat. How does that make you feel as a person? One, as a woman who is having challenges with other leaders.
Sometimes that is invisible conflict, but also what made me to remain was the responsibility. That children to school. So it made me to say that as now, still applying for
You are looking for another job. Yeah.
But then for me to join also as WomenLift is also because I want to have
Sharing experience.
Yes.
Maybe if I will ask, probably before you have an idea of quitting your job, want to know how many women are you in your organizations, and can you really describe how others are taken in their position so that we can see how we can shape on your help? It's like an experience.
So now you're on track.
Thank you. Thank you.
So you see, you're helping her. Is it a heart change? Is it a mindset? Is it what physical, practically, what does she need to do?
Yeah.
You have ideas, but you have to help her from within herself.
Okay. Yeah.
Wanting to be better at the same time.
Yes. For him. Okay. Okay. So I'm telling them we are winding up. Good people, I'm being told we have very little time left. So can you start to wind up with the peer that you are supporting? Start to wind up because we need to close in the next 2 minutes.
coach, who had the issue?
One of the things that I think is a secret sauce.
Are they helping you help yourself? Yes, they're drawing from you. Right. Because I need to know exactly when we're ending.
Yes, they need to. I'm trying to chat Irene.
Okay,
Let me just go
so
upstairs.
that I know exactly what I am saying now and do this.
Monitoring that we're actually translating what we are learning. Virtual engagements from the webinars, and so I think that was the secret sauce. I value that it brought to the fore a lot of us who probably, if things held constant, would not have challenged themselves or thought differently or done that very deep introspection. I think it allowed us to identify gems from the different spheres, and it was a great mix of different individuals. My hobbies are, I love to travel with family. I love exploring new places, new cultures, new people. And I also love dancing and singing. So you will find me somewhere, either in a concert singing or dancing with my dance group.
My name is Caroline Bindio. I'm excited. I was nervous in the morning. I am so inspired by the things that I've heard today. For me, mentorship is about somebody who has walked the journey ahead, providing support to those who are coming behind. And if I look at the women from WomenLift Health and the mentorship journey that we've been through together, it has been so amazing just listening to them, trying to understand and put to practice the things that they are learning from their coaches, the things that they are learning from their the content that is being provided to them, and trying to figure out how do we put it in practice in our workplace. How do we do that in the reality of our life? We are busy women, we are working, we have a home, we have children, and then we have this extra thing that we're doing around leadership training. How do we balance all that? A lot of the things that they are being taught are new to them. There are things that are moving them outside their comfort zone. And there are things that worry them. Will I be able to do this? Can I do it? And having this mentorship group, having a mentor who they can come and talk to and say, I'm trying to balance my work and my life and my mentorship experience. I don't have enough time in the day to do all these things that are required of me. I have just been traveling, I am back home, I have an assignment that is due, I have things to do in my kids' school. How will I manage all that? And then just having that conversation and trying to say, okay, so what do you need to prioritize? What is urgent? What is important? What can you shift? And how can you use things like calendars to schedule yourself so that other people in your office can also understand when you're available and when you're not? How do you manage your work, your life at home? Who can you bring in to support you at different times of your journey? So just having those real conversations, and then also listening to other mentees and seeing how are they handling, what did they do, and encouraging them to seek help when they need it. And just saying that, one, it is okay to ask for help. It is okay to need it. It's okay to be in a place where you're uncertain, you're not sure, you feel vulnerable, you feel unable. That is all normal in every person's life, woman or man. And to ask somebody, I don't understand, please help me with this.
Hello.
is a strength,
Coaches,
not a weakness. Most of the time, we think of asking for help as a weakness. Actually, it's a strength.
Our time is
and when
up.
people ask you for help,
This was just
you
a
feel
taster.
You feel privileged
Hello.
to be
I
able
can see
to
the
help.
coaches are
So why
deep
should
in the
asking
discussion.
for help be a challenge? So if
So
I
that
look
was
at
just
the women who
you know,
I have been
giving you a
mentoring
tip of
and,
how to start these
listening to
conversations
them
with your
say,
allies.
I really
We need to
struggle
close up
being
now
on time for things,
because we need to
submitting
do
my reports
the
on
course
time, whether it is
evaluation.
in the
It's already
office
been
or it is my
projected.
assignment
So
that I'm
what
doing as part
you
of
just
my
need to
leadership
scan
journey.
it,
I really struggle with
because
that.
the rest
How
of the
can I
team
be
are
better?
the other teams are
And
all
then
going to
listening
come down
the
just
different
now.
examples that are
So
being given. How
we
do
want
you
to wind
create
up.
milestones for
I
yourself?
know this is a
How do
very
you
exciting
hive off
situation
time that
right
is,
now
this is the time
because you're
that I will
finding
be
solutions to
focusing on
problems,
this
but we
aspect
have
of
to
my
wind
job.
up.
How do you use
So
your
let's please
digital
scan
calendar
this
to
evaluation.
make sure
They
that
really need
the
your
time
feedback.
that you do not
And we need
double
now
book
to turn
yourself
our seats
for,
so that the others can
different
come
things.
and
So just
find space
looking
to
at
sit. I know no one
practical
wants to end, but we have
examples
to.
of how you can move from A to B to C. As they say, leadership, it is
Some
a
people
journey.
manage to
You
rotate
will not
roles
move
like
from A
3
to Z.
times.
But
So if you've
seeing
done
that
once,
transition,
then you
now
know
I am
that
doing this better. I did
you
this
still have
one
some more
better,
to do.
so that you can
but
be able
that's
to
was,
see,
was,
oh, I can
was the
learn
beginning
how
of
to
it.
do this.
You can do
I
that
asked
in the
for help,
workplace.
I got help, I improved. Oh, it means
Please
I can
scan
ask for help again.
the
So
QR
just
code
understanding
on
that,
display
I think makes a difference to
fill
the
in
person
that
who
evaluation.
is having that particular challenge.
Thank you, Doreen. Thank you, Dr.
Leadership
Koki,
is
for
about
assisting.
influence. It is about being able to change not just yourself,
And thank you very much,
but
everyone,
others,
for
to change systems,
actively
to change
participating and even
processes.
refusing
It's
to
about
end the session,
influencing
please.
things to become better. So if I look at what these women can do in the workplace, they can take what they're learning here and say, how does that apply in my workplace? Before, I was not comfortable asking for help. How do I ensure that the environment that I am building in my small team, in bigger teams within the organization, that I am living the behavior that I want to see, that I'm engendering, that I'm encouraging other people? Ask me for help. Give me feedback. Not just being the person who is asking others for help, giving others feedback, but also living the same way that you would like others, creating the environment that is enabling the behaviors that you would like to see within your teams and within the organization. I think leadership is also about understanding that no is a complete sentence, that women can say no, that when you are given assignments to do, you don't have to say yes to everything, that you can say no, I don't have any bandwidth at this time to do this. And to also accept that from your team, that your team members, when you provide them with assignments, that you know that sometimes it is okay for them to say no to you. And then it's also about understanding that if the environment that you're working in is not the right environment and it cannot change for whatever
Please make
reason,
sure you've scanned the QR code
when
that's on display and
young
filled
women,
it in.
these middle-level
There's one group
managers
there
are
that's very
learning these
creative.
things.
They are
These are the things
multitaskers.
that
They were
need to
discussing
use
as they were
to
filling it in.
emulate in their
So
workplaces.
please, let's just fill in the evaluation. And thank you very much for giving us your
of
time this
organizations
afternoon.
And
So the
looking
rest
at
of the team
gender
will be
and
joining
gender
us from
equity.
the other rooms and
I
we'll
would
wind
say
up.
that it is a structural initiative. We always say that structure follows strategy. There is no organization whose strategy is how will we fail. Every organization's strategy is about how will we succeed. And all the evidence shows that for organizations that have gender equity are more successful than organizations that do not. So how do you make sure that you have the right policies that are talking about how do we make sure women are getting into this organization, that we are recruiting women, that we are promoting women, that we are retaining women? That is the right decision for any organization to make. Allyship is about people who have privilege standing up and speaking up for those who are marginalized. It could be women, it could be young people, it could be persons with disability, it could be a mix of all this. My background is in technology. I'm a software developer, and this is an industry that is historically very predominantly male. When I started my career, when I was very young in the development, in software development, I didn't realize it, how few women there are in tech. Right now, yes, for sure. But at the time when I started my career, which was, many years back, I was often the only person in the room. And I always said, I don't want ever to be the only anything anywhere. I never want that to be the case. And I always want there to be others. And what is my responsibility to make sure that I'm never the only anything? When I look at the women who have gone through this first cohort, the women who I spoke to during my first mentorship and the women who I spoke to today are different people. They are confident, they know their worth, they know that they can influence, and they are not just that they can influence, they are already influencing. They are changing their workplaces, they are changing their own careers. They have their eyes way above there, and they're on their way. They have allies, they have created networks within this group of 28, 30 women. They are looking for greater networks outside this cohort. They have already started changing things. We just can't see what that is now. I bet you in 5 years, if we go back and look at where are these women, what are they doing, they'll be doing amazing things. The change has already begun. Work is love made visible. Love your work. Whatever work that you're doing it, love it. And let people see that you love your work. Yeah, do it with dedication, with love, with effort. There is nothing more that is going to get you to where you want to go than just doing every single bit of work that you do with love.
My name is Dr. Sarah Kokimuli Kinagwi. I'm feeling happy. I'm so glad and grateful to have been part of this journey. I've been able to contribute to the success of the ladies who've graduated today. It's important to integrate mentorship because we are able to talk and look at the actual scenarios that come, because you are sharing about the different challenges that they have gone through, being able to look at the whole career and be able to say, are you where you wanted to be? What do you want to? What are some of the challenges you have faced? So in the different sessions that the mentees were able to really articulate very clearly, I now have more clarity on what I want to do. I realized that I had been struggling with a few things, but after working with the coaches and getting to know their strengths, I think this is how I want to go about it. So I'd be able then to help them, so how would you go about it? Being able to actualize that discussion, because it's one thing to want to do something, but you need to have a plan about how will you actually do it. So I find that mentorship sort of brings it now into the real world, because you have to now take this training and the learning and take it to the workplace. And in the workplace, you'll meet all sorts of people and situations. So it's about now, how will you deal with that? So I find we were able to enrich the process by being able to share with them also our own experiences, because we've been in, this kind of field, and they also impacted us. I can say as a mentor, why I also enjoyed this is because I also learned so much. The main thing is actually being very intentional, and that's one of the things we covered in the final session, mentorship session with the ladies, is being intentional about what you want. Where are you going? That clarity is so important, because then you're able to know, I need to do this. This is the plan I have. And when you do that, then as an individual, you're able then to come up with the steps that you need to take to actually make it happen. And so even in the workplace, you need to be able to, because a lot of them, many of them were in a place where they have, gotten the clarity that they have been holding themselves back. They need to move to the next level. So career progression was a big part of it. So with that, you need to then ask yourself, what do I need to do? Do I have everything in place for me to move to the next level? Do I have the team that will support me and, enable me to grow? But as you do that, you need to be thinking of who are the people behind me. I think the important thing is to realize that mentorship never ends. So institutions need to have, if possible, some kind of structured mentoring within the organization, because even organizations need to think about succession and all that, when people go and progress in their career and move on, who are you building? Which team are you leaving behind? So if they can have that in place and being able to look and see what is going on, and especially with the women, as I was saying, many of them felt they had held themselves back. They didn't have the confidence, but they realized they had strengths that they somehow downplayed or felt that it was not appropriate to be able to, utilize the fullness of their strengths. And so that also for organizations, they need to be able to look and see the potential in the team. There needs to be something that it's an active process of looking and seeing, these are the members of our team and this one has this potential, and nurturing that, because it comes to the benefit of the organization. So sometimes people may step up and say, I want to step up, but a lot of times you need somebody to be able to say, you can do this. I've seen you're good in this. Can we work on this? And then now you can address whatever is sort of pulling them back. So a lot of them are going to step out of their comfort zone. So we look forward to seeing great things. You will never get things done alone. This is a collaborative working space. And it's a space where it's dominated by, of course, men most of the time. And it's a space where, as you come in, it's sometimes very hard to know where to fit in, because everybody seems to have the role that they are playing. And so when you're a newcomer and you're trying to make a name for yourself, do something in the global health space, you will be trying to figure out where can I really contribute. Everyone seems to be so much more educated than me. They have so much more experience. What am I really bringing to the table? So allyship is what allows people to look and say, hey, we have new people coming to the table. Look at this young one with potential, bringing them up, being able to deliberately reach out and bring them on board. Because if you keep on sitting where you are, then you don't build up a team, you don't build up a pool. You'll find that it's the same people at all the meetings, same people making all the decisions, the same people, but you don't get new ideas, you don't get new perspectives. And so it's important for people to recognize the privilege that they have, recognize the power that they have, and use it for the good of global health. Because the more people you bring, the more people you lift, you're able to make a bigger impact. So I think a lot of times people don't realize that they have the power to be able to change. Yes, you're sitting around the table, but you need to ask yourself, who else should be around this table and is not there? And ask for them to come and ask for their opinions. A lot of women will also hold back and not say much in meetings, because maybe you think that your perspective, is different or may not be appreciated. But allyship enables those who have the power to be able to say, what do you think about it? Being able to bring everybody around and use that to diversify the team, get everybody on board, and I think at the end of the day, when you have everyone's contribution, you're in a better place. A lot of us who are current leaders now just got thrown into leadership without really much training. You learned on the job, yeah? And you had to be very intentional about going for leadership training, because we realized I'm now in a position where I'm leading people and I'm not sure I'm doing the right thing. So this kind of training, being so intentional about it and targeting the mid-career woman, because she's the leader of tomorrow. So being able to inculcate those skills and, you know, just to enable her to lead at this time is perfect, because it sets her up. It's good that there is the opportunity to look at the mid-career woman and then now enable her to move on to the next level. And the other thing about leadership, as I was saying, many of us, you know, we learned later, and we held back. A lot of them said they held back, and the reason they held back is because they didn't think they were capable of leading people. You're an expert in your technical field, but the moment you're given people to manage or a team to lead, you feel like you're a bit out of your depth. And so having something that is targeted, because you must have leaders, and the leaders cannot all be men, yeah? We need to have women lead, and we need to have leaders who are equipped. So being able to train them at this point and have leadership as a natural progression of your career is wonderful. And being able to know that at this point, this is where I want to be, and I need to have these skills. I may learn some in this journey, some I may learn on the job. There's nothing as good as learning on the job. It's very good to learn on the job, but of course, when you're empowered, you do even better. These women are so confident right now. They know what they want. They have realized we've held ourselves back. We are ready to step out of the comfort zone. We are ready to go for those leadership positions. And so if WomenLift continues to churn out this cohort every year, we'll have a pool of women. It's actually like a mass movement of women who are ready to be part of the decision making, want to sit at that table, want to make decisions, want to lead from the front, not just waiting to be led. So I think it's just going to change everything, yeah. Because a lot of times we will wait for things to happen to us, and now we are going to be right at the table and making things happen and ensuring that there's diversity, there's gender balance, there's equity, that everything is really going on well for global health and everyone is represented. Yes.
The WomenLift Leadership Lift program for health has been fantastic. I've seen the women grow from timidity to a lot of courage and confidence, and to have had an opportunity to play a role in that makes me happy. It's very important to integrate mentorship into the WomenLift Leadership Program because the program is very intense. It is very well thought out. The leaders, developing leaders, have coaches, they have instructors to guide them on their projects that they are undertaking. But they also need
Good afternoon, ladies. Welcome back. It is 4:45. We're not doing too badly, so I'm very proud of you all for working together to make the time work. We want to go into our final session. If you can hear me and you're in the tea area,
so that is
feel free to come inside with your cup of tea or your juice or your snack so that we can proceed. If you're inside and haven't yet grabbed your tea, don't worry. We shall release you shortly. We do want you to enjoy the rest of your Friday. So please take your seats. If you've just joined us or you are already in the plenary for the workshop that was here on peer allyship,
have benefited from.
And if you hear my voice and somebody's next to you looking like they don't know what's next, please tell them that we're waiting for them inside the ballroom. Grab your cup of tea or your snack and feel free to join us. Thank you.
Is very beneficial because that's what we want to do, to multiply the seed that we are planting through this project. So the way to multiply that seed is through mentorship. And the women are getting an experience through being mentored on how to mentor others. So that really is the future of this program. You get mentored, you mentor others, they mentor others, and you create a multiplier effect. the women will have a multiple role. Firstly, like I have said, they are going to be mentors of other women, of other leaders. And I hope they will not just restrict it to women, but also to young men and fellow colleagues that may not even be women, so that leaders can be grown all around. And even as they are building the women leaders and mentoring the men, they've also been taught how to manage upwards. So they'll be speaking to the upper management when they are not the upper management, to influence how women are treated in the workplace, how women are recruited in the workplace, how women are given opportunities, and how the differences between the work demand on a woman may differ from a man because of cultural issues. So they'll be able to influence all these factors, and they'll also have been taught about looking at who are your allies and who are for you and who are not for you. And when they know who is not for you, they know how to work around that, how to persuade these people, how to make them see their point of view. So really they can work from being mentors, from working with their colleagues, mentoring them, both male and female, and also working upwards with the management that supports them and management that doesn't support them. And they've been equipped with those skills. So really, there's a lot for them to do in the workplace. The allyship is very, very important in the public health. We know that in a lot of places in the public health, there's male dominance. And there's not only male dominance, but dominance by older males. So many times the reason these people are not your allies is because they don't understand your point of view. They don't understand your challenges. They've never even thought about them because they've never been in your shoes. So what the women will do is create a space where these allies, these non-allies, can begin to be in your shoes, see things from your perspective, see things through the lens that you see them. And through that, a lot of people have good intentions, and I'm sure they'll be pulled over. But if you ignore those people that are not your allies, you'll not achieve your objectives. So it's important to know both the allies and those that are not your allies, the opponents, and win the opponents over. Early in life, I was given a leadership position, and a lot of people felt this lady is too young and she's a lady. How can she be in that position? I was able to really show through the technical expertise that I had and the integrity that I had, that the ideas that I was pushing could succeed. And that also encouraged other ladies who came behind me. So it is possible to win people over through integrity, through hard work. You kind of have to prove yourself, and then the allies can be bought over. I feel it's very, very relevant, the WomenLift.
All right, once again, we want to begin our program, ladies.
Women.
We've done well to this point. I hope that we can continue keeping
even in Kenya,
the momentum that we have gained. I really hope the workshop and the breakout sessions were productive.
But the transition
I had a chance to walk around and see you all engaging.
A different
Why are we running away?
What is happening? To the mid-level.
You're going to grab
to
tea
get you
now.
to the mid-level, you usually just need your technical expertise.
If you're in the room, please again, let's move forward unless there's a bag or a folder in front of you.
You already have your technical.
I would like to ask that if you do have your tea, settle down, you can drink and have your bitings as we continue.
Program is imparting on the women who are in the middle class,
prefect, so let me come and walk outside.
Glass ceiling and get to the very top. And one of the mottos of the WomenLift program is that you educate a woman and you change a family, you change a nation. And that is what this program is going to do. If it continues on this trajectory, we are going to change families, we are going to change nations, we are going to change the world. Because when the woman is in the leadership position, she's able to see things from many different perspectives. She's able to see from the social perspective, the technical perspective, the political and the economic perspectives, which are all part of the whole person, the whole nation, the whole family. And I hope I'll be there 5 years from now just to see where this, it's like a time bomb. If it continues the way it's going, I hope I'll be there to see it explode and really reach the whole world.
Good morning, my name is Janine Chondo. As for us, a long time ago, 20 years ago, we found ourselves in the leadership position without knowing what to do, how can I build the team, how can I be the leader that they want to see.
Once again, please join us.
And I ended up finding my ways of looking among the government employees or leaders and choose one to be my mentor. So I went to see the person and they say, you know what, I need you to be my brother in this government and I need you to help me navigate through challenges and so forth. So back to that and seeing this group here where they got prepared and how mentorship actually improved the skills, not only for us, because it, as you heard, two ways. We also learn how to be more equipped to be mentored, but also for them, I think it was a good journey. It's not one point in time, it's something that you go on mentoring them on this leadership skill, but what I found is also go beyond the work. Talk about the family, talk about the personal life, because when you see that person, you see that woman, it's about the holistic approach. Maybe the person is not delivering, not because she failed, but because that she has some issues around the family. So I think putting that into context is very, very important. Before I start engaging the nannies at home, telling them what are the goals that I have, what are the objectives I have, it didn't work. So I come back stressed. Why you didn't do this? Why you didn't do that? By the time I realized that it's a teamwork, by the time I realized that working with my nanny, even my gatekeeper, hey, I have a goal today. I need you to make sure that you don't disturb, you don't call me and so forth. You prepare everyone, your husband, your wife. And that actually is the support that accounts for 50%. So I think understanding the context and putting everyone into your shoes and understanding that you need everyone, not only
ladies, I'm going to remind us of our oath that we took
interact with you
to work together to save some time. And I think we started off on a very strong note. It's been a powerful day. I'd like us to finish on the same note. I can see some of you have joined us. Thank you.
Find themselves in
Thank you for heeding the call.
And how to set the goals.
Please settle in.
I've seen that coming. And today,
feel free to come in with
conversation between
snacks and your tea
and mentees on, what are the goals that you have for next.
What we're going to do now is hear
clearly
a summary of what amazing discussions happened in the 3 workshops.
And we're
going
that
to
are very specific.
hear some of the highlights.
To be in a board of directors.
You had 3 amazing leaders take you through those sessions, and then you had your small breakout groups, and you shared your feedback, and now we'll want to hear what happened on the first floor if you were in the plenary, and for those of you who are on the first floor, what was happening down here. So we won't keep you too long. We want to give you a bit of time afterwards to network. So that will be the priority for today. And I wonder if anyone has met 5 people. Have you met 5 new people? If you have, let me see your hand up. Who has met at least 5 new people? Okay, that's a good percentage. Keep your hands up, keep your hands up. You know the next question. Tell me their names and what it is that they do. Yes? Lady in the beautiful pink outfit, tell me your name and tell me the names of the 5 people you met. You've forgotten their names. Do you have any recollection of what they might do? Even if it's 3, 2, 1 person? Okay, tell us. She's now whispering, you said your name was who? Achieng. Her name is Achieng. She's an obs kind. Tell us about Achieng. Go ahead.
Is it evening or afternoon? It's evening. Okay. Good evening. I'm Idioro. I've met more than 5, but I've forgotten all the names. But then the one I remember is Acheng, because she came to me and said, I always admire you. Yeah, so we have been friends with her on LinkedIn, and today I've met her. Yeah, thank you.
Thank you for being honest. It's true, we forget. Who else wants to be brave and just say, I met, even if you forgot? You see, now we have permission to say, I forgot them, but they are beautiful and powerful.
Good evening, everyone. My name is Diana. I'm happy I've met so many people that I've been seeing on the other side of the screen, starting with June when she's singing, Dr. Nora inspiring us on LinkedIn, Dr. Jackie Kitulu, However, Cicely, all those people that I've been seeing, I've met them today. Then I've also made personal connections. I've met a lady called Imali. I've met Melissa. I've met Evelyn Rotich. I've met so many people. So I'm happy that, I'm so happy. I'm overwhelmed. Asante.
I like that. Well done. Well done. One last one from here. Who would like to share who they've met? How many? It's not a competition, I promise. Take it at your pace. At least one person said they met June. I was so worried, like no one has met me.
Good afternoon. My name is Sharon, and I'm glad today I met Caroline working from Cambridge. I met Hager from Tanzania, and Nina, the one I'm supposed to send a photo to. So I'm really appreciative of today's.
Good. Well, the pressure is on, ladies. If you haven't met your 5, at least try. Can we say at least we will try? Wonderful. It's also good for the networking, especially so that you can call these people at 4 in the morning. Because Filana gave us permission to call us a lady who is in a position who might be able to help and use our networks. That's the expression she used. How are you doing? On a scale of 1 to 10, have your expectations been met from this morning? Have they been exceeded since this morning? Do you feel like next time we should be here for 2 days? Eh? 1 week? Hey, I will proceed to the next thing in my program. I'm seeing Nora looking at me. But I think that's a good sign. That's really good feedback. It means these are necessary conversations. And it means that we are committed to doing better and to seeing a better world, even if it is in our homes, in our country, in our communities, in our regions, but also globally. And I think that's how most of you are already thinking. So well done. And I think I also want to highlight 2 people who came to introduce themselves to me, especially after that fireside chat where people said, I have, and I have, and I have done, and I'm still doing. So well done on the way you have begun to see yourself and share your own stories. So now we want to come back from our workshops, and I really hope you found those sessions enlightening. In the next session, we want to begin to start to put these things together and to prepare ourselves to close and get our takeaways as we move from this place into our offices. I have already sent an email to my team saying nobody should email me after 6 p.m. and the whole weekend. Unless there's a fire, figure it out. We can talk on Monday. So I'm already implementing some of the amazing things that I have learned here. And because we had 3 workshops taking place at the same time, I'm sure you're very curious to know what the others were speaking about in the ones that you didn't attend. And fear not, as I said, we took care of that. So allow me to introduce and invite up Dr. Terry Kigundu from WomenLift Health. She's the Senior Facilitator for East Africa, and she will share a few highlights. Let's give her a round of applause as she comes. Welcome, Terry. Will you stand or sit? You will stand. All right, karibu.
Good evening, everyone. Yes, we had 3 amazing workshops. And what we gave today is just a taste of what we offer and how we do it at WomenLift Health. And I want to believe that we have joined those conversations and we have also learned something. So the 3 conversations that we had this afternoon in form of workshops was the peer allyship, where we were continuing the conversation that we need each other. We also interacted with one of our modules there, which is on peer coaching. And the key message in here is that no one gets stuck where they started. You only get stuck where you stopped. And you as a peer, therefore, you will be helping her to help herself out because she knows where she's going to, but something happens along the way and she gets stuck. So you help her to get unstuck. That was the key message there in the peer coaching. The next workshop was on authentic leadership, and authentic leadership is also one of our key pillars of our leadership journey at WomenLift Health. What is the key message here? When you know who you are, then you know what you want, you know how you want it, and you show up in the way that you want to be experienced. Did you hear that? Showing up in the way you want to be experienced. So show up authentically. That was the message there. And the key takeaway in that session is also around values. Do you know what your core values are? If you know what your core values are, then you're likely to be more authentic in the way you show up. So who you are is good, what you do is good, but how you show up is most important there. The last workshop, which is the 3rd workshop, is around conflict dynamics and building better relationships at work. What's the key message here? That as long as you're reading people who are different from yourself, people who have different and diverse backgrounds, opinions, and perspectives, conflict is inevitable. Conflict is bound to happen. But what do you do as a leader? Have an open mind, be focused, and be more constructive in your responses, and avoid the destructive responses. Because when you're constructive, then you minimize conflicts. When you move to the other side of being deconstructive, conflict escalates, a hill becomes a mountain. Sometimes it ought not to have got there. The key message also in that conflict is that the way women are socialized is very different from the way men are socialized in terms of handling conflicts. We were taught to be silent most of the times. So even when things are not working out, we also continue to be silent. But it reaches a time and the silence has to be broken. At that time, most often it's too late, or a lot has happened, a lot of damage to your own health, and the relationships allowed you. As I mentioned, this is what we offered this afternoon. It's just part of what we offer at WomenLift Health and the way we offer it. And thank you so much for turning up in huge numbers. You made my time there. You made Sense time there. And Jackie was here with you for the peer allyship. So thank you so much, and keep engaging with us on the Power Labs. This is part of the conversations that we carry on with the public Power Labs that we always invite you on quarterly basis or more. Thank you so much.
Thank you so much, Dr. Terry, for that quick roundup. I went upstairs to the one that had the conversation on authentic leadership and also conflict. And the facilitator had her shoes off. You know, when a lady takes her shoes off, be very careful. Things are about to go down. I like it. You're comfortable in your space, you know your stuff, and you make sure that you communicate and convey that message. Thank you, Terry, for that summary. I now want to invite Dr. Nora Obudo to come up and give us her closing remarks and her experience through the day. So once again, let's appreciate her.
Thank you, everyone. I have like 3 pages. Serious stuff, but anyway, I'm not going to go through this. It's about speaking from the heart, what we came here for. This was the East Africa Dialogues. We were supposed to have a dialogue. And we're having a dialogue around allyship and why it's important for us to achieve gender equity and, to get better health outcomes, because we've agreed women have to be seated at the table. But for us to sit at the table, we are not working in isolation. We have our male allies, we have our senior women, and we have our peers as well to accompany us in this journey. And so we've talked about, from the beginning, we had the Fireside chat as well. Oh, let's start from the keynote speech from government. They were very clear that it is also a challenge within government, at least as we look at Ministry of Health, where the division leaders mostly are women, and that's where the work is, the proper work. But at the directorate level, where the decisions are made, women are not there. And why is that? And can we change that narrative? We got into the Fireside chat. We got very challenged by the three ladies who are here and what we need to look at, how we need to give grace to each other as women. We show up differently. But then as well, we have to really tap into each other. As in, just ask. I need this job. I know you're here. Could you help me? Right? Not to feel shy about that. Just speak and go out and ask. Leverage on your networks. You need it. You cannot lead in isolation. We cannot lead in isolation. If you're finding yourself in a space of leadership and we never tick all the boxes, but who are you surrounding yourself with? It matters. Your networks matter. Your alliances matter. And the right people need to be around you in your leadership journey. So I thought that was very important for us to take home. We got then into, of course, the interlude, which I know we were looking at allyship, feminism, and I know you picked whatever you needed to pick from that as well. A very important break for us to, challenge our thinking around feminism. We got into the male allyship, and that was really something. Men also don't know what you want, right? But we give them what we want. And so we are hoping that they can be champions up ahead to rally on why women's leadership is important, why our voice must be there, why we must be at that table. And we have to journey this together, right? And even for me, there was a challenge there from Gates Foundation that we need to bring more people who are not as vocal, and also the men who we need to speak to, so that we do not have an echo chamber. So I'm taking that challenge as well to look at how we can transform even the next dialogues better and get more of the people who need this conversation to make the change. So that was really exciting as well. And then we got to the senior women and the support that is there or not there. And we said we are dropping the mic on what? We are dropping the mic on? Yeah, because there is no narrative. We are the ones perpetuating it, right? They're just bad human beings, and there's just a bad leader, male or female, woman, man. There's just bad leadership. And we've talked about not being in a space where if it's toxic, it's toxic. Make a decision. Read the flags. Surround yourself, right? Leverage on your networks. Support each other. Humanize leadership. And I think those are the things that we need to take forward. And I think this were also really galvanized as you went into these workshops and had these discussions as well. Because leadership can only start from authenticity. When you bring yourself in your own authentic self, learning what your values are, being very clear about what your barriers are as well. What are your guardrails? I'm not going to work until 6, or I'm not going to work until midnight. Whatever is working in your environment, make the decision that is right for you and surround yourself with the right people to guide you in your leadership trajectory. So I'm really grateful that we've had these conversations, and I'm hoping that we are transformed people, and I'm hoping that we don't have primitive husbands or boyfriends or institutions that we're going back to because we've said no to that, because we are not going to achieve anything. And so I think at the end of the day, it was allyship that we were looking at. It's been a dialogue, and dialogues continue. These conversations continue. Can we be the change? Can we be different? Can we practice transformative leadership? Can we support each other? Can we surround each other? Can we ensure that leadership is not a lonely place for women? And even when you get into that space, that you'll surround yourself with the right networks and the right people to surround you, whether peers, male allies, or senior women, or even your juniors as well. Let's humanize leadership, and I think that's what we need to take home on this day. So WomenLift Health, of course, we are hoping that we'll continue these conversations. We can work in partnership. This was an inaugural one, and we led it full-handedly as WomenLift Health, but we can work together as partners because you are in institutions, and we all know that these dialogues need to continue. So I really welcome partnerships in this process, so that next year we can be talking about something else, because we've moved forward and we've looked at what allyship is, and we are moving the allyship agenda, and we're not falling back on achieving gender equity and achieving health outcomes that we're looking at, because women must be in that decision-making table. If we're going to close that gap on SDGs where we are all falling behind, we need women at the table. If we need to close that gap on 140 years to getting into gender equity, we need women at the table. So let's put ourselves out there. Let's not be shy. Let's advocate for ourselves. Let's not tick all the boxes before we apply for a job. Let's go and do it afraid, right? These are the things that we've had. And it's leadership from heart, mind, isn't it? Just go forth. And this is now a network. This is also another platform that we are trying to create, where women can come in a safe space, support each other, exchange phone numbers, get on LinkedIn, speak to each other, and show up for each other. So with that, the 3 pages are done. And of course, now it is my great pleasure to call Amy Betson, who's our president at WomenLift Health, who embodies transformative leadership. We work very well as a cross-regional team, no headquarters, nothing. We are just all working across the globe, creating this movement and trying to, address this global health challenges by ensuring women are at the decision-making table. So a round of applause as I welcome Amy Betson to the stage.
Thank you so much, Nora. Sometimes I think I have the best job in the world. I get to come to events like this, meet women like you and men like you, and do it not only here, but also in India and in North America and in Southern Africa countries, and in Nigeria now, where we're opening up very soon. And what's extraordinary is the kind of conversations, the kind of experiences, the stories that we heard today. We hear with its own cultural context and flavor, but the same kinds of issues, the same kind of bravery, the same kinds of stories from the women all around the world. We are truly connected in the experiences that we have and that we share and that we bring for each other. This has been a fabulous day, a truly fabulous day, and I am just so inspired, and I've learned so much listening as we kind of unpacked, what does allyship truly mean? What does it mean to have to break stereotypes and challenge biases and demand our institutions change and show up for each other in our own ways? And so I'm taking all of that wealth of thought home with me. I just want to do 2 things. I want to, 1, say some thank yous, and 2, have one final reflection. So for the thank yous, first, I want to extend my sincere gratitude to all of you. Everyone that showed up today, that was willing to share their stories, to listen, be supportive, be doing the things you do every day, fighting the battles you fight every day, showing up and being such brave and extraordinary women. You are going to change leadership and change health. So thank you. So I want a round of applause for all of us. I also want to thank our speakers, who were just so amazing and so honest, right? They sat up here and they shared their stories. They shared the things that are so important and meaningful to them and some of the hardships that they've had to face in their own careers. And they shared their commitments to making change and the types of things that they're doing as male allies, as senior women allies, as women who are facing the challenges in the health sector, as women in the government. So I want a huge round of applause for our very special speakers. I also want to thank all of the tech around. We have videographers, photographers, light technicians, sound technicians, people that have been supporting us and making all of these moves so smoothly. And so I'd really like us to thank all of these guys who have been running around and really making everything happen for us today. Of course, I also have to thank our wonderful MC June, who has kept us all engaged, kept us on our toes. Just when you thought you could snooze, you would find a mic under your nose asking you a question and who you met and can you remember those names. So thank you, June. You've really brought energy into the entire day, and we thank you so much for it. And of course, I want to thank Nora and the absolutely fantastic WomenLift Health team. Can you please all stand, all the WomenLift Healthers? They have done such an outstanding job organizing this conference, bringing together the wonderful agenda and speakers, making for this absolutely beautiful venue, taking such good care of us, leading these workshops. They've really done an amazing job. I am just inspired by the collective power in this room. Each of us has our individual power, but what we do together is where we start to really see change. So I want to leave you with one final thought. Each of us has the potential to be a powerful catalyst of change. Our challenge is to turn that potential into concrete action, both big and small. Whether it's taking the time to be a mentor for someone, speaking out when you see a woman colleague being harassed or ignored, raising your children so that boys and girls see each other as equals, refusing to participate in a manel, or taking steps to make your institution a place where women leaders can thrive in their roles. We all have actions that we can and we must take. So our call to action is for every person in this room to identify 3 things that you can do to support women leaders, and then take that action forward. So thank you. Thank you so much for joining us on this journey to shape a future where more women have the opportunity to advance to leadership and to be at the decision-making tables so that collectively we can improve the health of all and we can change for more gender equality. Thank you.
Thank you, Amy. Could we please give her a round of applause? I don't know many presidents who would just sit and observe and let their team work. So thank you for leading by example and trusting your team, because they are definitely very able. I have to say that I've enjoyed being a part of your day, but also the planning process. And I think as someone who does this work often, I appreciate how organized your team is, Nora. And I think it made it easier for me to prepare, to be ready to have fun with all of you and to understand my brief. And I hope that you've also enjoyed the day with me. I also want to just appreciate our sign language interpreters. If you would give them a round of applause, please. We speak about inclusivity, that it's actually happening, I think is something we need to highlight and appreciate. So thank you for being here with us. Also, we've talked about our media team, so thank you, and our photographers who are about to do something that has never been done before. We need your help, so they're getting ready and doing their push-ups, but I'm sure they're really up to the task. I also want to acknowledge our venue, Radisson Blu, for hosting us so ably. Did you enjoy your food? Did you enjoy your snacks? Those who are still chewing, I see you. And thank you for keeping us safe and comfortable. We don't take that for granted as well. And of course, the Ministry of Health, who's been with us in various capacities. Thank you for participating in this discussion. And of course, Dr. Zainab Gura was here and kicked us off with such a brilliant keynote address to set the tone. I'm going to share a quick personal story that is currently ongoing right now, and it's made me really question life and things, but knowing that you all took the time to invest in your conversation and your dialogue today gives me a little bit more hope. I have 2 really good friends who have been in hospital, one for 2 months now, and one for 3 months. They both suffer from lupus. And as you know, this is something that more women are prone to than others. And what has been astronomical for me is just how much money we have had to continuously contribute to help get them out of the situations they're in. One has hit 17 million, believe it or not. And one is currently, I think, in total, maybe about 4 or 5 million currently. But it is insane to me that these young women, one is in her, I think, late 20s or early 30s, the other one is in her 40s. And their lives have basically been brought to a standstill. So if you were wondering whether you are in the right space or whether your work matters, please know that it does. And because individuals like these, whose families have been affected, their livelihoods have been affected, their children have been affected, require these 75% to be in these tables, in these discussions, so that a 17 million bill is not something that we see on one family having to figure out how to get their family member, their loved one out. Okay, so I want to thank you on their behalf, and I hope you wake up on Monday knowing the work that you do is important. Okay? Great. So what is left now for us to do as we come to the official end of today's program? I really want to ask you to continue being challenged to do better, to be a bolder ally. And even when it gets tough, I think we were told by Ms. Ekirapa, do it afraid, yeah? We don't always know everything sometimes. That fear, I think, is nice, good adrenaline to help keep the fight going. So my name has been June Gashui. It's still June Gashui. It will be June Gashui tomorrow. Until a man finds me and marries me, it will still be June Gashui. What I'd like us to do is to take a photo. This photo, I'm going to tell you about the final photo we'll take. We'll require all of you to join us if you are comfortable. And we'd like to have you on this stage in some way, shape, or form. And this is why I was telling you, just take a bite of lunch. So now you understand how important it is to have followed that instruction. But we will figure out how to get you all up here. But for now, I'd like to invite Dr. Nora Obudo, Amy, and our speakers. If you were one of our speakers today, could I just ask you to be on stage with us? Maybe our technical team can help me move these seats. Or do we need them for the photography? Perhaps? We don't. So we can have them moved? Okay, thank you. So if that can be happening while our speakers, if you were a speaker at any point today, we'd like to have one nice group photo. Please come up. If you're on a panel, in the fireside chat, I recognize that some have had to leave us to get back to work. No problem at all. If you ran one of our sessions today, please come up so that we can grab a photo to remember that you were here. Our photographers will help position us. If one of you is outside still eating the cashew nuts, please come. Please come and join us. Please come and join us. Anybody else who's still wondering if they were one of us? Anybody else that is seated next to you who spoke and has forgotten? No? It happens. I told you at this age, it's not just temperature. There's a thing called foggy brain. You walk to the fridge, you open it, and you look inside and wonder, why am I here? Huh? You asked a question. What was the question? You also, if you asked questions, you will be in the big photo. Don't worry. Question askers. Okay. And now for the Android and iPhone people in the front, you will just put your phone down for 2 seconds because it's in the picture behind and we don't want it there. It's a nice phone, but we don't want it, okay? So just give us a few minutes to take this photo and then we can have you take yours, yeah? I thought I'd see more people putting lip gloss, but it's nice. If you are comfortable the way you are, that's okay. I hope that you've taken great pictures and you're posting them. Remember, our hashtag is EA Dialogues 2024, hashtag WomenLift. WomenLift Health is the handle, but the hashtag is WomenLift, but it's true. We lift each other, we lift health. Okay, are we good? Have we taken the photo, guys? One more, just a minute, okay. You guys keep smiling. Teeth. You've been here all day, so these few minutes you can handle. Yes, I'm looking for the thumbs up. Okay, all right, thank you so much. We'll have you stay where you are, and now have these guys join us. Come in an orderly fashion, ladies. Decide if you're my height or lower. You know this is your position here. I don't want to see you behind. Sasa? All right, start coming up. We're going to try and position ourselves in a safe, orderly way. I think some of us can position ourselves down here. If you're taller, come and stand down here. Yes. And the rule of thumb is if you cannot see the camera lens, it cannot see you. So let's see how we manage this exercise. I'm going to observe it from far in case it doesn't work. Okay. Let's balance out on both sides. More of you can be on the stage, I think. I think more of you are on the stage right. You can balance out on the far left. Oh, this is a good picture. This is a good picture. Okay, yes, don't worry. We'll do as we'll do when. With the right hand. With the right hand. Yes. So which line? The one in front. So from the lady in pink, red, this way. Okay. There's no straight line. You don't. Okay. Okay, ladies, we're going to guide you a little bit, so just be patient with us. There's a line here, after which we cannot see you, right? So it's the lady in. Tell me what, guys don't know color. Just tell me how her hair looks. Okay, the lady in white smiling. With the glasses or without the glasses? Without the glasses. So, my pharmacist. Yes, from there, so she's our last person. Okay, if you're on this side of that hand, we need you to move to our right. Yes, everyone look at the hand behind you. The lady in red, I think you've just made it. So be tight, you're okay on this side, but everyone on this. Okay, let me speak plainly. If you are on the right side of this lady here, please put your hand up. We cannot see you. So you need to move to this side so we can see you. Or find a way of, are your knees okay? Can you kneel? The knees are not fine. Okay, let's have you on, I can relate, so let's have you here. We can kneel, if you can kneel. As long as we can see you in the lens, that's what we want to achieve. Let me go do another check to see if anybody is hiding. Short people, oh yay! Okay, there's somebody behind there who is hiding. You, yes, if you've had to tiptoe to see me, then that is a problem. Can I ask you to, the lady with the glasses and the platinum blonde hair? Yes, you with the green, yes, okay, we have solved the problem. One more person, come in. Take your position, ladies. Take your position, yes? Okay. Give me feedback, so I give them. Are we good now? Yes? Lip gloss? Spinach, not in the teeth. Check your sister's teeth quickly. This is part of holding us up. No spinach, yes? Some of you are munching during the closing ceremony. I want to make sure you look your best. Okay. All right, on the count of 3, give us the biggest, warmest smile you can manage. 1, 2, 2, 3. Yeah, this is so nice. Success? Okay, stay where you are, stay where you are. If you are kneeling, get up, stretch for 2 seconds. Now we want to do a quick video. Put it up. All right, this gentleman would like you to do the following. He will cue me. He would like you to use your right hand, identify it quickly because earlier we had a problem. This one is your right hand, yes, for you, this one, okay? And he'd like you on the count of 3 when he cues me to say WomenLift Health with your, it's a video, remember, yeah? So WomenLift Health, something like that. Make sure you don't punch the lady next to you and you don't block her face. So find the right position. Do you want to practice? 1, 2, 3, let's try. WomenLift. Okay, yeah, that's good. Nobody is injured, yes? We've made it. So you'll cue me? Okay, he'll cue me. Wait, let me position myself. You can start coming. Okay. 1, 2, 3. Did we get it? No. My guy, you should have been practicing when we were practicing. All right, he's going to a moment. A moment, ladies. You can breathe. It's okay. I feel like that's the quietest this room has been since morning. Okay, I think he needs a couple of seconds. So I'm going to do something that I promised 1 or 2 people to do, and you're going to help me, right? Is that okay? You don't know what I'm going to do, but just commit to helping me, please. Say yes. Wonderful. And I never thought I'd feel this way. And as far as I'm concerned, I'm glad I got the chance to say that I do believe I love you. And if I should ever go away, well then close your eyes and try to feel the way you do today. And then if you can remember, sisters, keep smiling, keep shining, knowing you can always count on us. For sure, 'cause that's what friends are for. In good times and bad times, I'll be on your side forevermore. Choir, yes. Very well done. I think he's ready. Are you ready? Okay, on the count of 3, WomenLift Health with the right. 1, 2, 3. All right, he got it. Well done. Thank you so much, ladies. If you didn't have a cup of coffee, feel free to do that. Remember to keep tagging, hashtagging. Have a wonderful, wonderful evening. Thank you.